Okay, thank you all. It's now 10:31, and we're back in session. 10:31. Shh. 10:31. We'll get back in session, and we will go back to page 43, item 349, and the next speaker. Okay. Yes. Next speaker, Tiffany.
Bridget Lois Jensen, Caleb Ashmore, Ashley McPhail, Conchita Reyes, Bishop John Ogletree. You each have 1 minute.
I should mention while Reverend's coming up, I got a letter from Senator Boris Miles, who wanted to be shown testify and support us today, but couldn't be here. Just asked me to mention that for the record, and I'll submit it to the record.
Good morning. My name is Bridget Lois Jensen. It's quite clear that the voters of Harris County support the mission of Harris Health by overwhelmingly passing the bond election in 2023. However, many of those voters are now disillusioned and have lost trust in the leadership of Harris Health because of the lack of transparency perceived. This 8.9 acres locks us into a location where eventually Harris Health is going to want to build another hospital. And so this is going to put all of the hospitals for Harris Health in only 2 locations. And that can hardly be said to serve all the people of Harris County for whom Harris Health was formed. And these locations, like I said, happen to be in the middle of the floodplain. Again, that is not the most wise thing to do. Furthermore, if we think that things are so urgent right now.
Thank you. Your time's up.
Thank you.
Good morning, Commissioners. I'm Bishop John Ogletree, leader in TMO and pastor of First Metropolitan Church. We are here again to voice our support for this expansion. We held a press conference on March 17th and had an array of community organizations that came and supported us. And by the way, there are over 30 organizations across Harris County that support this expansion. On Tuesday, we saw Doug Griffin from the Houston Police Officers Union, Mark Langton from the Houston Professional Firefighters, Bishop Dixon from the NAACP, Blanca from LULAC, Cesar Espinosa from FIAL, Paul Puente from the building trades, and we are here today to voice our
Your time's
support.
up.
This is a historic vote, and this will set a pace for the expansion of emergency and indigent health care. So thank you,
Thank you,
for
Bishop.
your attention to it.
Thank you, sir.
Commissioners, my name is Conchita Reyes, and I serve as an officer with LULAC 60. Today is about life and death. Ben Taub Hospital is a level 1 trauma center, one of the most critical in our region. When tragedy strikes, this is where our community goes. And the reality is simple, it is running at capacity with our population continuing to grow. We cannot afford delays, we cannot afford half measures. A group of us have attended more or have coordinated more than 6 town hall meetings across Harris County where Harris Health has provided open dialogue and Q&A directly from the community. That is why we support acquiring 8.9 acres from Herman Park Conservancy to expand the life-saving facility. There is no question that this is a life-saving measure. Eminent domain exists for moments like this, when the need is urgent and the impact is measured in lives saved, not acres. Our community, working families, uninsured, underserved patients, and many in the Latino community depend on you to make
Thank
this
you. Your time is up.
decision.
You want to wrap it up? Conchita?
Yes. Depend on you to act decisively. As LULAC, we urge you to move forward, approve this acquisition, and give BidTop the capacity it needs. Vote yes for this acquisition.
Thank you for being here.
Thank you.
Good morning, Commissioners. Ashley McPhail, Chief External Affairs Officer for Texas Medical Center. BidTop Hospital is a lifeline to Houston's most vulnerable populations and a national leader in trauma care and medical education. With our city's rapid growth, the hospital is operating beyond capacity, putting access to life-saving treatment and care and training of our future healthcare professionals at risk. Expansion of BidTop is not just a desire, it is an urgent public health necessity. We, the leaders of the Texas Medical Center, fully support Harris Health's proposal to acquire the 8.9 acres for the critical expansion of BidTop. Due to space limitations and operational needs, the land adjacent to BidTop is the only viable option for continued care of our community. On behalf of the CEOs of the Texas Medical Center, Baylor College of Medicine, Baylor St. Luke's Medical Center, University of Texas MD Anderson Cancer Center, Houston Methodist, Memorial Hermann, Texas Children's, and UT Health, we support the critical expansion of BidTop.
Thank you.
My name is Caleb Ashmore. I'm the ortho rehab supervisor at Harris Health, and I live in Precinct 4. The American College of Surgeons recommends having at least one level 1 trauma center for every 1 million residents in a geographical area. The Houston metro area has approximately 7 million people in it. As was previously mentioned, Houston currently has only 2 level 1 trauma centers for adults. BidTop Hospital is always functioning at full capacity. Every day, there are more than 50 patients who are admitted to BidTop without a bed to put them in. Many hospitals wonder how they are going to attract and keep patients within their system. Harris Health has more patients than we know what to do with. We need capacity. We need space to put people. It's hard to provide quality care for patients when you have more than 50 of them at any given moment who cannot get into a bed or room. This is not a sustainable way to operate. Harris Health will continue to be excellent stewards of the resources that are entrusted to us, as we have done for the past 60 years if given a chance to expand BidTop. Thank you.
Thank you.
Next is Cherry Joseph, Mary Koch or Cook, Christine Irvin, Perla Garcia, Ubalda Barrera, Damaris Gonzalez. You each have 1 minute.
Hello, my name is Mary Cook. I'm a TMO leader and a member of one of our congregations, member congregations of TMO, First Unitarian Universalist. I'm here to support the expansion of BidTop. Make sure I get it in. Please vote yes on this. But the need has been spoken to. And 60 days ago, y'all asked that the Harris Health go out and get more community support. We have worked with Harris Health and with our various communities to encourage that support. In fact, we have over 2,000 signatures on a petition that supports the expansion. Those signatures are from each one of your districts. We have been in support of this expansion since the get-go, as folks say here in Texas. And this is the 3rd time I've testified. So
Thank you. Your time is up.
vote yes, please.
Thank you.
Good morning, Harris County Commissioners and all assembled. My name is Sherry Joseph, and I'm a proud Harris Health employee of 8 years and a resident of Harris County for over 40 years. As a servant leader in this community, I have witnessed firsthand the countless lives we've touched every single day at BidTop Hospital. Every life saved, every family comforted, every patient given hope, it all matters. The expansion is not just about more space. It is a lifeline for our community, ensuring that we can continue to serve those who need us most today and for generations to come. Today, I stand in full support of BidTop expansion project because every investment in this hospital is an investment in health, safety, and the future of Harris County. This expansion means more lives saved for Harris County. Thank you for your time and for giving me the opportunity to speak today.
Christine Irvin, Perla Garcia, Ubalda Barrera, Damaris Gonzalez, Sunny Messiah Giles, Rafael Rivas, Jonathan Garcia,
Good morning, Commissioners.
Morning.
So I'm here, Sonny Messiah Giles, owner of the Houston Defender, Houston's leading Black information source, but I'm here to talk about Ben Taub expansion. The reality is that this is more than a construction project. This is about a promise that was made to 73% of the voters who want a better public health safety net. With that in mind, I think this 100 rooms is going to improve not only the lifespan of Ben Taub, but also deal with the medical care that happens in the hallways and the emergency detours. As far as Defender readers, we are looking for equity. We want to make sure that we have the access in the heart of the city. The reality is Black and brown community depends heavily on Harris Health. And because of that, when that 98% capacity hits, guess who's in the hallways? It's our families. And with that in mind, we want you to support this venture, but more importantly, we want to respect Herman Park with the idea
Thank you. Your
at
time is
least
up.
on upholding the lives that are going to be saved with this expansion. Vote for it. Thank you.
Good to see you, Sonny.
Thank you. Love you.
Good morning, Commissioners. My name is Jonathan Garcia, Director of Nursing over Psychiatry in Harris Health. I've served in emergency and psychiatric care here in Harris County, and I also grew up receiving care in county services as a trauma patient. Ben Taub has always been a beacon of hope for the most vulnerable in our community. Today, that system is beyond capacity. Patients are boarding for hours, sometimes days, in the emergency center hallways. We're also evaluating patients in the waiting rooms. In psychiatric care, where safety and dignity are critical, we're stretched thin. Right now, we're being asked to choose between a single underutilized stretch of land and the opportunity to build multiple levels of high-quality patient care. We have an opportunity to positively impact hundreds of thousands of lives. From the front lines, I can tell you, we don't have the space we need to safely care for our community. This expansion is not optional, it is necessary. I'm asking you to move forward. Our patients cannot wait. Thank you.
Thank you. Before we call other speakers up, I want to ask if you've spoken, would you leave the room politely? Because there are people outside who want to testify who cannot get in. And you can still watch it on TV. You can go up to my office, whichever side you are on the issue. Just don't get up there and get in an argument and tear up none of the art. You know what I mean? But if you spoke and tip out so we can let those folks come in. And I assume you're all going to announce in the hall, so if we have to wait to let them in, we will. Okay, next speakers.
Rafael Rivas, Angela Obasi, Sylvia Olivia, Stan Merrick, Tamara Bell, Jan Glasner,
Good morning, judges and commissioners. My name is Christine Irvin, and I am a member of the Texas Organizing Project, and I'm here to ask for support in the expansion of Ben Taub Hospital. In around December, I was hospitalized with walking pneumonia, and the only medicine that can help me was a medicine that I am very much deadly allergic to. And with the help of the doctors at Ben Taub, they safely found a way for me to take this medicine, and that is why I am here today, because of that hospital and the doctors that work there. So I am all for this expansion for Ben Taub Hospital. Thank you.
Good morning. My name is Stan Merrick. I am definitely in support of this project. My dad and his brothers came from a Czech immigrant family that lost everything during the Great Depression. They moved to Harris County in 1938 and started hanging sheetrock, working men. They served proudly in World War II, all three of them. After the war, they came back and started up again. We are most proud of the fact that over these past 85 years, we have trained thousands of men and women how to use their hands and to realize their American dream. We are also proud that we provide hospitalization and workman's comp for for our workers. Many in our industry do not provide workman's comp if the person gets hurt. They can't afford hospitalization for basic health care. These workers rely on Ben Taub and LBJ for their safety net. Our industry has grown. Our health care opportunities have not. It is vital that we pass this resolution and get beyond it. Steve Kane said it well. Houston is growing. It's a place to be. It's a promised land. And thank you.
Stan, thank you for coming down. And I just want to point out, you lend your voice to very few issues, but to the issues you do lend your voice to, they are critical and important and urgent issues. So thank you very much for your leadership.
Thank you.
Good morning. My name is Jan Glazner. I've been a resident of Harris County for 54 years. I support Ben Taub's acquisition of 8.9 acres of Herman Park to increase patient capacity and improve medical services in one of only 2 Trauma One hospitals in Houston. Please vote to declare eminent domain for these reasons. Relieve overcrowding, reduce hallway medicine, and enhance healthcare access at Ben Taub. To honor the bond that Harris County voters approved in 2023 to expand Ben Taub. And because the parcel of land under consideration is separated from the rest of the park by Cambridge Street and is currently planned for use as a parking garage, not for more outdoor park space. I fervently believe Harris County needs an expanded Trauma One hospital more than another parking garage. Let's preserve and enrich Houston's reputation as a world-class provider of medical services.
Thank you.
Thank you.
Good morning. Before I go into the point I want to make, the first thing that I want to correct out here is that Ben Taub is the only hospital that allows indigent patients. Every hospital and medical center, by federal law, if you present yourself in an emergency room as an emergency, they must take you whether you can pay or stay. So that is the federal law. So that's not your only choice. You can go to other hospitals. I myself was a patient at LBJ Hospital with a 5% chance of survival after an automobile accident with police chasing a bank robber. LBJ absolutely saved my life. I'm the first ever plasma transplant in the history. I voted. I wanted you all to give more beds. I absolutely. But the method that you're doing this in, I don't understand how you say you got a win-win when it's not written in pen, and when in the reality, when it comes up for you to apply it, it's going to be a reneging of the promise that you made. If it was really real, it would be in pen. But what really concerns me is the piss poor moral attitude of putting money over mortality. I don't understand how you could come to that conclusion and not listen to the voters who voted to support you. Because I know it's 25 more years before you can come for another bond, but you're going to need more money, so you're going to need our support.
Thank you. Your time is up.
Good to see you tomorrow.
You too.
Good to see you. Thank you for coming. I'll get my picture with you later.
That ain't happening.
Good morning, Commissioners. I'm Jim Blackburn. You've heard from me on this issue a lot, but I would like to just note this is a Chapter 26 hearing about taking parkland. Parkland is protected by Texas law to a high degree. In my opinion, I have not seen proof yet that the Chapter 26 requirements of documenting no feasible or prudent alternative has been met. That's the purpose of this hearing. I've heard nothing about this. I absolutely support Ben Taub. We think that there are ways to do this expansion without taking parkland. When I first came to Harris County in 1972, I met Terry Hershey. And Terry Hershey raised me as an environmental lawyer in this town, protecting parks and building parks. Parks are sacred. It's a sacred trust. It should not be taken lightly. I'm probably most worried about the precedent that this sets if we go forward. I ask you to delay this vote and gather and see before yourselves a full discussion of this. I'd like to file these written comments with the county attorney just for the record. Thank you for your time and attention to this.
Good deal. Jim, thank you so much for being here. And I appreciate the work and the role that you play in this process. I just hope that you would also look at James Driver Park, because I got that concrete batch plant going up next to it, and it's just a continued nightmare for me.
Well,
but
let me see if I can help you on that. And Commissioner Ellis, I would have spoken in tongues if I'd have thought it'd make any difference.
Jim,
Thank
it's
you, Mr.
always
Blackburn.
it's always good to see you, Jim. I came to Houston in 1954, and I was born in Houston Negro Hospital. They did have a Negro ward at Herman, but my parents figured it was a better choice for me to be born there. Many people during that era were born in their homes because they couldn't get in any hospital. But I appreciate the work that you do. We worked on many issues together. We don't always agree, but it's always good to visit with you. Thank you.
Buenos días, señor juez y comisionados. Mi nombre es Ubalda Barrera. Soy miembro de Texas Organización Project y madre de 6 hijos. Estoy aquí para apoyar la expansión del hospital Ben Taub. Soy paciente de cáncer y recibo mi tratamiento actualmente en el hospital. Dependo mucho de la atención del hospital. Anteriormente tuve una cirugía de espalda de emergencia y en lo personal tuve que esperar 3 días para poder agarrar una cama y que tenía una emergencia. Como madre, mi mayor miedo es dejar a mis hijos, pero tengo la fe en Dios que me van a sanar. La atención del hospital es muy buena, excelentes médicos, excelente atención de las enfermeras, de todo. Solamente que necesitamos el apoyo de todos ustedes para expender un poquito más y tener un poquito más de camas para las personas que necesitamos.
Thank you. Your time
No
is
nada
up.
más yo, muchas personas. Gracias.
Good morning, Judge and Commissioners. My name is Ubalda Barrera. I am a member of Texas Organizing Project and the mother of 6 children. I am here to support the expansion of Ben Taub. I am a cancer patient and I receive my treatment at this hospital. I depend greatly on its care and I am grateful, but I have also seen how overcrowded it gets. I have had to wait days to see a doctor. Recently, I waited 3 days for a surgery because I was postponed due to a lack of beds. As a mother, my greatest fear is leaving my children, but I have faith in God that He is going to heal me. That is why I ask you to act urgently. The hospital no longer has sufficient capacity. Approving this expansion can save lives. Thank you.
Thank you.
Buenos días, jueces y comisionados. Mi nombre es Silvia Oliva, soy miembro de la organización Project. Estoy aquí para apoyar la expansión del Ben Taub. Tengo familiares y amistades que dependen de Ben Taub para recibir atención médica. He visto de cerca qué pasa cuánto pasa el tiempo y no tienen suficiente espacio. Un familiar mío tuvo que esperar 3 días para poder ver un doctor. No había camas disponibles. Nadie debería de esperar tanto tiempo cuando está enfermo. Por eso es urgente aprobar la expansión. Como mi prima Enedina necesitó acceso a atención médica sin tener que esperar para recibir ayuda. Este es un momento crítico. Aprueben la expansión. Hoy ya habrá tiempo para hablar del futuro de Ben Taub, pero este es el momento. Nuestra comunidad necesita la expansión. Si nos apoyan, gracias.
Again, good morning, Judge and Commissioners. My name is Silvia Oliva, and I am a member of Texas Organizing Project. I am here to support the expansion of Ben Taub Hospital. I have family members and friends who depend on Ben Taub to receive medical care. I have seen up close what happens when the hospital does not have enough space. A relative of mine had to wait 3 whole days to be able to see a doctor because there were no beds available. No one should have to wait that long when they are sick. That is why it is urgent to approve this expansion. People like me, my cousin Enereida, need timely access to medical care without having to wait days to receive help. This is a critical moment. Approve the expansion today. There will be time later to talk about the future of Ben Taub, but right now, our community needs the expansion. Thank you.
Good morning, Honorable Commissioner Judges, fellow Houstonians, and people at home. My name is Angela Obasi. I've been in Houston for the past 37 years, and I'm 67 years old. I've only been to Bentop once, and when I went there, what I saw, I didn't like it because there were no room for patients. I stayed 7 hours before I was attended to. This expansion is necessary, is important for the life of, to save lives. And we know you can use your good office to vote for this expansion. It's necessary for our community and our children and children's children. Thank you for your good work and continue doing. God will bless you.
Buenos días, comisionados. Mi nombre es Perla García con Texas Organizing Project. Hoy en este día estoy aquí porque estoy a favor de la expansión del Hospital Bentap, ya que miro mucha falta de atención en el cuidado médico, largos tiempos de espera para urgencias, falta de camas, falta de personal, falta de espacio, etc. Me gustaría que se hiciera obligatoria la adquisición del terreno en el Parque Germán para que se le dé al Hospital Bentap, ya que es necesario para nuestras comunidades, ya que dependemos de este recurso para tener una estabilidad de nuestra salud. El condado Harris está creciendo en población. Tenemos pocos lugares accesibles para atender nuestra salud. Prácticamente nuestras vidas están en sus manos para una pronta y mejora atención, ya que no sabemos en qué momento podemos necesitar ir al famoso Hospital Bentap.
Good morning, Commissioners. I'm here today to advocate for the expansion of Bentop Hospital as I observe a significant lack of adequate medical care. We face long wait times in the emergency room, a shortage of beds, insufficient staff, a lack of space, and other issues. I would like to see the acquisition of the land in Herman Park made mandatory so that it may be allocated to Bentop Hospital. This is essential for our communities as we rely on the resource to maintain our health and well-being. Harris County's population is growing, yet we have few accessible facilities available to address our healthcare needs. You effectively hold our lives in your hands regarding the provision of prompt and superior medical care, for we never know when we might find ourselves in need of the services provided by the renowned Bentop Hospital. Thank you very much for your attention.
Good morning, Commissioners. My name is Maita Gonzalez, and I'm a proud member of Texas Organizing Project. I'm here today because I believe healthcare is a human right. Every person in our community deserves access to care that is timely, respectful, and humane. Right now, that is not the reality. There are people in our community sitting in emergency rooms for hours, sometimes even days, waiting in hallways just to be seen. Imagine being in pain, worried about your health, and not knowing when you will get help. That is not humane, and we cannot accept that as normal. Bentop serves some of the most vulnerable families in our community, in our county. Expanding this hospital means more access, shorter wait times, and better care for people who need it most. I urge you to support this expansion. Our community deserves better, and the time to act is now. Thank you.
Good morning, Commissioners. My name is Amaris Gonzalez. I'm a community organizer with the Texas Organizing Project, and I am here today in support of the expansion of Bentop Hospital. Bentop is not just a hospital. To my family is the reason my sister and her baby are alive today. The care she received was critical, and we thank God the doctors, nurses, and staff who work every day to save lives. That is why expansion is so important. The need is not in the future. It is right now. Our community is growing and the hospital is already stretched beyond capacity. And when we think about the world we are living today with the increase in mass shootings across the country, we have to ask ourselves, if something like that was to happen here, where will people go? Bentop is one of the only two-level trauma centers in our county. It must have the space and resources to respond. Today is an opportunity to take the first step. I urge you to vote in support of the expansion. Lives depend on it. Thank you very much.
Good morning, Commissioners Court. Christopher Jenkins, CEO, founder of Fiji Hood Organization. I'm community organizer, native resident of Harris County. So what is trauma? There are many types of trauma, right? So everybody deals with trauma differently. And so with that being said, I have a scenario. A Harris County resident is being abused by a neglected landlord and weaponizing law enforcement against the tenant. The citizen ends up in Harris County mental health facility, right? And so then they go through the process of getting out, going to court, filing lawsuits and everything against law enforcement and the tenant, and ultimately win a case. But their character is destroyed in the process, and so now they traumatized. I'm in support of building a new hospital along an evacuation route out of the floodplain because of past natural disasters and a pandemic. Should have taught us our lessons about having room for a triage and then having extra parking space in case you need to have a drive-through situation for the vaccine. I ain't come here to fight. I came here to talk about business.
Thank you.
Thank you. Your time is up.
Bishop Dixon, Kara Lambright, Ricky Castillo, Mathy Gonzalez, John Hoverson. You each have 1 minute.
Good morning to our court, to all of you, and to all of the officials of Bentop Hospital Harris Health. Great to be here today to give a 40-second endorsement from the Houston NAACP and from the faith community. I've preached sermons in less time than that. To simply say, Jesus teaches us in the scripture to love your neighbors as yourself. It behooves all of us as neighbors to think about the fact that the least of these among us, who are normally the voiceless, need our care, compassion, concern, and commitment. Just today, the reality is so many are lacking access to quality health care. And your salary nor zip code should determine the quality of health care you receive. Every person's life is of sacred value, and I honor the court's decision today. Please vote in support of this expansion. I've lived in Houston all my life. We know what Bentop does and the more that it can do and needs to do. Thank you in advance for being visionaries to make sure Bentop is expanded
Thank you. Your
and
time is up.
healthcare is elevated. Thank you very much.
Thank you, Bishop.
Thank you.
Good morning, Commissioners. My thanks to each of you and your offices for your continued attention to this important issue. My name is Kara Lambright. I'm President and CEO of Herman Park Conservancy. Chapter 26 requires that all reasonable planning to minimize harm to protected parkland must be done, and the Conservancy believes that standard is met if the parking garage that was planned for the Warnicki tract is instead delivered at an alternative site on Fannin. We want to thank Commissioner Ellis for his leadership and his commitment to facilitate the county joining TERS 28, resulting in $20 million in TERS funding toward the Fannin parking garage, a very meaningful step to making the park whole. We also appreciate the collaboration with Harris Health, including a shared memorandum of understanding that reflects important commitments to keeping significant park-like elements on the site and continued collaboration. A funding gap still remains.
Thank you. Your time is up.
You can continue.
Please continue.
Thank you. A funding gap still remains, and we are hopeful that additional TERS participation will move the project forward as a priority. After extensive study and discussion, our board is convinced there is no viable alternative that both expands access to healthcare and protects Herman Park. If harm to the park can be minimized through this new parking garage, the Conservancy supports this condemnation and the expansion of Bentop so that Harris County residents can continue to access critical health care. We look forward to continuing to work with the county and the city, TERS 28, and Harris Health to finalize these commitments and deliver a solution that addresses the most urgent needs in Herman Park, which is parking and access, and ultimately allows us to get to healing the heart of Herman Park. I thank every one of you.
Thank you.
Thank you,
Ms.
Mr.
Lambright. On this point, just for my colleagues, just a quick comment, 2 points. One, obviously, we cannot control whatever happens with the city. And as I stated when this came up, if you recall, I did call the mayor that morning. I wouldn't want to be in a position where I'm trying to speak for him or he would speak for me. I think he would be respectful of that as well, so I won't share a private conversation. But the way we're handling TERS at the county now is the county controls the county money. It's not an issue of how many people on the board. That's all real nice. But at the end of the day, what was that line I got from Javi? It's 90% finance, 10% poetry. Sometimes on the boards, how many seats on the board, that's poetry. The county controls the county money. And the tradition here is whoever the commissioner is from that precinct, they control it. If it's a split precinct, I'm assuming we'd figure out some proportionate to figure out how to do it. So I don't get into their business and they don't get into mine. Works pretty good, both ways. But so if we're permitted to join, that's the city's condition. I think this memorandum of understanding was about 1 a.m. in the morning, so my staff has read it. But I just want to stress that because I think I've been real clear. I don't want to be redundant, say it over and over again. I've done my part, my staff working with you and everyone else. I think my colleagues understand that. Second point, and I just thought of this for you and Dr. Porsa, when some other speaker said something. Somewhere in these discussions, at one point I said, this could be down the road, as someone said, when the money is there to replace it. But Dr. Porsa, I remember some discussion about wanting to tie the hands of a future Harris Health Board and Commissioners Court. Now, they can always change it, but I want to make sure there's some language, because I think there ought to be green space in there for people in MD Anderson, in any of the hospitals. So I don't know if that's in there. I just asked, I text my staff, I don't know, but I don't know if legally we can tie their hands, because that could be sometime down the road. But if we can't tie their hands, I want to make it damn uncomfortable for them. And they can go pull my comments. It'd be a little more spicy if they were in private. Okay, all right. But I want to state that. So I've done, I think, not speaking for my colleagues, other than what we said here, for them, I made that commitment on what we can control, but I don't get into what anybody else does, and don't want to be in a position where I'm asked to lobby. It's enough trying to lobby these and can't even talk to them. So I don't want to have to be trying to go lobby another entity of government. I have enough trouble lobbying the people I serve with in the legislature. But so that's not part of my job description. Thank you.
Thank you.
Thank you.
Thank you, everybody.
I'm John Hoverson with the Harris Health PFAC Council. I live in the city of Bel Air. Harris is the third largest county in the United States and the most diverse. This is an important source of local pride, as is the rodeo, and so too Harris Health. One of the largest, most efficient, and best public health services in the country. Harris Health is recognized for the 7th best nursing staff in the United States. Yes, we provide the 7th best nursing care nationwide, not just in Houston. Ben Taub provides one of only 2 level 1 trauma centers in Harris County. We need 6 or 7. Our law enforcement officers are sent to Ben Taub when they are traumatically injured. Ben Taub Hospital is precisely where they find the very best traumatic care. Ben Taub has outgrown its current facility. Patients are routinely treated in hallways. For shame. We cannot build upward. We cannot build a new hospital. The highest and best use of this isolated adjacent parcel is Ben Taub Hospital. The Ben Taub adjacent land is part of the Herman Park in name only. You're being deceived if someone tells you we're losing zoo animals over Ben Taub.
Thank you. Your time
The
is up.
adjacent land is the most cost-effective solution. Please support this thoughtful, intentional addition to Ben Taub.
Thank you.
Thank you.
Good morning, Commissioners. My name is Rixie Castillo. I'm an organizer with the International Union of Painters and Allied Trades, District Council 10, and I'm a vice chair of the Harris County Essential Workers Board. And I'm here today regarding the Harris Health LBJ expansion construction project. I want to raise serious concerns about this project, about the enforcement of prevailing wage requirements of this publicly funded project. While contractors are submitting certified payrolls, reports indicating compliance, workers live a completely different reality. They're missing or unpaid fringe benefits, including no health care, no pension, and no training contribution. This is deeply concerning. Prevailing wage is not optional. It exists to protect workers, ensure fair competition, and uphold integrity of public funded projects. When these standards are not met, workers are harmed, responsible contractors are undercut, and public trust is compromised. We respectfully urge the court
Thank
to
you. Your
initiate.
time is up.
All right, thank you. Thank you.
Good morning, Commissioners. My name is Rafael Rivas, organizer with SMART, Sheet Metal Workers Union, Local Union 54. I'm here today on behalf of local workers to raise serious concerns regarding prevailing wage compliance on the LBJ Hospital expansion project. Harris County has established a required sheet metal rate of $29.70 in wages and $13.85 in fringe benefits, totaling $43.55 per hour. However, based on certified payroll records and workers' testimony, a contractor appears to be reporting compliance on paper while failing to provide those fringe benefits to workers. One example, a worker employed for over 7 months reports no health care, no pension, no paid leave, no training benefits, despite payroll records showing those benefits are being paid. This raises concerns and misreporting on potential violations on a taxpayers' funded project.
Thank you.
Next is Maythi Gonzalez, Marty Langton, Ann Kennedy, Terry Elliott, Barbara Davis. You each have 1 minute.
Morning, Commissioners. My name is Ann Kennedy. I support the essential work of Ben Taub and its dire need for expansion, but I think it's critical that Harris Health follow the law. Harris Health has not shown that no alternative sites exist. Harris Health has refused to honor requests made under the Freedom of Information Act for information about alternative sites that it has analyzed. We have abundant examples at the national level of obfuscation and ignoring of process and rule of law. We do not need to reproduce that behavior here in Houston. I ask that you please delay the vote until the public has access to that information that's so critical to your decision. Thank you.
Good morning, Commissioners. My name is Marty Langton. I'm the proud president of the Houston Professional Firefighters Association. And on behalf of the third largest firefighter organization in the nation and the largest in Texas, we are here to support the Ben Taub expansion. Every day, Houston and Harris County firefighters and paramedics respond to neighbors on their worst day. We can only deliver life-saving care when the full emergency response system is strong, and Ben Taub Hospital is a critical part of it. As a level 1 trauma center of one of only 2 in the region, when Ben Taub is on diversion or can't accept patients, it creates dangerous delays and critical life-saving minutes to the patient. We need Ben Taub to be ready and available for critically ill or injured patients. If the hospital isn't able to receive them, we can't do our jobs, and patients' lives are put at risk. Some ask, why not build elsewhere? And what we tell people is this is the most cost-effective place to put the Ben Taub expansion that will help firefighters and that will help us take care of the community.
Thank you. Thanks for coming.
Thank you, Marty.
Good to see you, Marty.
Good to see you. Thank you.
Appreciate you.
Morning, Commissioners. My name is Terry Elliott. I'm the Administrative Director of Facilities for Harris Health, and I'm here today to support the redevelopment and expansion of the Ben Taub Hospital. The infrastructure at Ben Taub is in very serious shape. Many of those systems are beyond useful life. And in 1988, 89, when it was not built under the best practices for engineering. Many of the piping and mechanical systems are inaccessible. We can't get to those. Due to the patient volumes that we have, we're simply unable to get in there and get the maintenance work done to maintain that facility. So what we proposed is an expansion, a phased expansion once the redevelopment has occurred, so we can get in there with a phased expansion and complete those repairs to maintain the existing facility. Thank you.
Hi, my name is Barbara Davis. I'm a survivor of a drunk driver where I was actually, my husband was killed, and I was declared, actually by arriving at Bentop, they thought I was brain dead. Needless to say, I'm very appreciative. I've tried to volunteer, donate my life to making a difference, including I was speaking on behalf of Adrian one day. I'm a volunteer at the rodeo. In fact, I'm supposed to go to a meeting, a committee meeting. But I have been saved by Bentop. A year ago, I'm limping because I was flipped over. And it was a Tuesday afternoon at 4 o'clock. There were no bed space at Bentop because that's the first place I asked to go. I wasn't sure how injured I was in the car accident. I reside in Precinct 4. And I said, it's whether you have insurance or don't have insurance, the point is they're the #1 best level 1 trauma center in Houston. You can't just wiggle your nose and start another one somewhere else. It takes a lot of effort and time to get that designation. And having more bed space right across the way where area wasn't used.
Thank you. Your time is up.
All right, thank you.
Thank you, Barbara. I
Appreciate
think we
it.
got the point.
Thank you.
Thank you. Thank you.
so much.
Not sure if they're here. Ingrid Robinson and Myth Gonzalez.
Can they hear us in the hall as well? Or do we have to walk out? Somebody walk out there and yell at Ms. Robinson's here. But can they hear us in the hall? No. Okay. And Mr. Farnbaum, we are right. We don't have to walk over and yell out in the hall, do we?
We can send someone out there and check.
Well, just call it. Maybe somebody walk out there and just call the names. Go ahead, Ms. Robinson.
Good morning. I'm Ingrid Robinson. I'm a member of the Board of Trustees for Harris Health. And I'm here in asking for support. The Harris County expansion of Bentop. Harris County voters overwhelmingly approved $2.5 billion bond for Harris Health strategic planning purposes. The vote was more than an investment. It was a clear expression of the public's approval of Harris Health's long-term vision to improve access to high-quality health care from our community. As a native Houstonian, Bentop Hospital is a cornerstone of our healthcare system. It serves our most vulnerable residents and plays a vital role delivering essential emergency trauma services to Houstonians. The decision before you is not an easy one, but it's a decision that will shape the health and well-being of our community for decades to come. I respectfully urge you to the court to vote today to support Bentop's expansion.
Thank you. I know I owe you a call, Ms. Robinson. You got to, at my age, sometimes I forget that my wife keeps telling me to take that Ginkoba, and I can remember it, but I don't think it's helping. So just call again.
I will.
Anybody else?
If Maythi Gonzalez is not there, then that's the last speaker for this item.
Now, we'll just make sure we're complying with the law, Ms. Farnbaum. So we're going to just ask him.
Yeah, Tracy just went out there and checked.
Okay.
No.
Nobody?
Looks
Okay.
like good.
And you mentioned Miss Guns. Did you say Miss? She's coming down. Miss Macy. Take your time. My doctor always tells me, don't fall when I'm on the bicycle.
Thank you. My name is Ann Hamilton, and I did sign up to speak today. I don't know why I wasn't called. But as a longtime park advocate for open space in Houston, I'm asking that you and your staff carefully consider all the issues on the proposed condemnation issue that we are addressing today. I support more, better, and accessible health care and parks for the citizens of Houston and Harris County. We can have both if all the facts are brought forth and addressed. This issue is complicated and will affect the citizens of our community for years to come. Please take additional time to consider all the sides of this issue. Thank you.
Thank you for being here. Thank you for your work for many years with the Houston Endowment as well.
Hi, I signed up and was not called, so may I
Oh, your
speak?
name, aren't you good? Yes.
Commissioner, it looks like some people were signed up for item 460.
Is this one,
So-
are you on this item? This
I was
issue?
on Bentop,
Okay, fine,
Harris
go
Health.
ahead.
It's fine to take them as part of the hearing.
Okay.
Okay. And FERS Precinct 1, Bentop is fantastic and needs to expand. We were excited to vote for the Harris Health Bond. That $2.5 billion is disappearing fast, and taxpayers aren't getting what we were promised. You, Commissioners Court, are partly responsible for this. The cost of the new LBJ has risen to more than $2 billion, with 3 more years of construction to go. The planned renovation of the current LBJ hospital has been halted for lack of funds. Ben Taub was expected to receive $410 million. That number is shrinking fast and is now $157 million. Harris Health has blocked public information requests for more information about this project, and they have lied about an important missing video. You approved this bond. You are responsible for monitoring it and continuing to fund it with our taxpayer money. You plan to condemn this parkland for an expensive project that has no funding and may never happen.
Thank you.
Do the right thing.
Thank you. So we're going to take speakers as well on item 460, just so there's no confusion.
Yeah, Tiffany's on it.
And we'll let them know that in the hall as well. And as he's coming up, Chris Daniels sent me a note. I'll submit it to the record, but he just sent a text, and it says there's a historic case in the historic documents room that shows that George Herman, who donated all the land for Herman Park, also intended to build a free public hospital before he died on a train ride to Missouri, ironically, to get health care. So one of the benefactors, one of the most powerful leaders himself, intended this land contain a free public hospital, and expansion of Ben Taub is in line with that. I just want to submit that to the record. Since so I've been bipartisan since old Chris Daniel sent me that text. Want him to know I do read my text most of the time. Thank you.
Good morning, Commissioners. My name is Mark Robinson, a physician at Ben Taub. I want to thank you and your offices for the hard work on the Ben Taub expansion. It won't soon be forgotten. This week, the need for additional beds has been more evident than ever, with the hospital having to mobilize resources previously used for natural disasters. It's become a weekly occurrence due to overcrowding. Our patients don't have the luxury of a choice of where to go. We're it. We owe it to them to provide the best care possible. Anything less, such as hallway beds or treatment in the waiting rooms, is saying that people deserve less. That's not us. That's not Harris County. Personally, I'd also like to thank the Herman Park Conservancy and their passion for green space. Green space and medical access are not an either or. To use a court phrase, they're a both and. While I truly feel this expansion is right, we as a medical community need to be fiercer advocates for the necessity of our parks. We're all on the same team. Thank you all again, and as I tell my patients, I hope to never see you in the hospital, but you're always welcome at Ben Taub.
Thank you.
Me too, Doc.
Good morning. My name is Salman Kazmi. I'm a resident doctor also at Ben Taub. I'm here to speak in support of the proposed expansion. As a resident who's been working there for almost 2 years now, this hospital holds a very special place in my heart because of the unique privilege that I have of getting to serve these patients. As you guys are all very aware now, the hospital is over capacity for much of the year. And seeing these patients firsthand being boarded in the hallways, delays in care and things of that nature, and seeing the burnout and the effect that it has on healthcare workers, it has become more apparent now than ever that this expansion is needed. I took it upon myself to conduct an internal poll to assess the level of support for a hospital expansion among Baylor's residents, and it showed that over 92% of residents believe that this expansion will improve patient care. Ultimately, Ben Taub is a place of refuge for so many of Houston's most vulnerable people, and I believe that as the needs of Harris County continue to grow, so too should its ability to care for them. I strongly support this hospital's expansion, and I hope that you will continue to support the countless people we serve and the
Thank you. Your
healthcare
time is
workers
up.
who are serving on the front lines. Thank you.
Thank you.
Hello, Commissioners. My name is Madeline Malloy. I'm also a resident physician working at Ben Taub. I am actually coming to this meeting today from a night shift at Ben Taub, but it was important for me to be here today to speak in support of the proposed expansion on behalf of our patients. Ben Taub is able to offer incredible care to some of the most disadvantaged residents of Harris County. However, the strain of limited space and resources is obvious every time I walk down the halls. We constantly have patients boarding in hallways and sleeping cramped in chairs 3 to a room in the emergency department. Our patients deserve better than this. I come to work every day biking along the section of land that is in question here. I'm a massive fan of Herman Park, but this is not the best of Herman Park. There are often downed tree limbs left in the paths for days on end, trash strewn across the grass. The reality is that this tract of land is not currently acting as a public good, but it has the potential to offer so much to our community as part of Ben Taub. I hope that you can support this expansion. Thank you.
Thank you.
Okay, that should be all the speakers for these items.
Okay. We all right, Ms. Fonbaum? I've done everything then?
Yep.
Okay. I'd like to call up Dr. Parser before I make a motion on this item.
And Commissioner, it won't be a motion on this item. You'll just close the hearing, and then 460 is the actual action item.
So should I close the hearing now? Or let him speak?
I think Dr. Porso wants to speak.
Good morning.
Good morning.
Commissioners, I'm here today to explain, I think we had a couple of slides. Tiffany. Thank you. And you can actually go to the next slide. Thank you. I'm here today to explain why it is necessary for the court to authorize Harris Health's acquisition by eminent domain of the 3 park parcels adjacent to Bentop Hospital for the expansion project. As you can see, although this land is within Herman Park, it is separated from the bulk of the park by Cambridge Street and South Braeswood Boulevard, and represents less than 2% of the total acreage of the park. Before discussing the project itself, I want to thank the court for its continued guidance and support over the past several months, as Harris Health has traveled around the county to engage directly with community members and stakeholders about this project. At your October 30th meeting, the court ordered Harris Health to hold 4 additional community meetings about the Bentop expansion project, 1 in each precinct, and to meet with Herman Park Conservancy at least twice before January 20th, 2026. On January 29th, I returned to provide you with an update on our community engagement and request this hearing. While some community members have publicly voiced opposition to this project, we have also received overwhelming support from many more residents, public officials, and community organizations who recognize and understand the need for this project. We very much appreciate that support. Let me start by giving a bit of background about Bentop Hospital. Bentop was established in 1966 by the vote of Harris County residents and is a critical part of the healthcare system within Harris County. As a public safety net provider, Bentop is a crucial pillar of the healthcare system within the city of Houston, Harris County, and the surrounding counties. Bentop is also one of only 2 adult level 1 trauma centers in the region. It provides the highest level of emergency care for patients with life-threatening injuries and complex medical needs. Level 1 trauma centers are uniquely equipped to deliver immediate, comprehensive care 24 hours a day, including specialized surgical services, advanced imaging, and multidisciplinary clinical teams. National standards suggest that a county of the size of Harris County should have 4 to 5 level 1 trauma centers. Bentop serves nearly 5 million Harris County residents, as well as the broader 9-county Southeast Texas trauma region Q. Today, Bentop consistently operates above its inpatient capacity of 402 beds due to the growing demand for medical care in our region. The chronic hospital saturation that results from inadequate capacity negatively impacts Bentop's operations efficiency and its patients and employee experience. It also has the potential to impact patient safety. Looking ahead, the pressure will only increase. Harris County's population is projected to grow 5% by 2030, with the senior population increasing 20% over the same period, adding to the current strain of Bentop's trauma and emergency services. Harris Health anticipates the need for approximately 110 new beds to accommodate an estimated 18,000 additional emergency room visits over the next decade. There is an urgent public health necessity to expand Bentop's level 1 trauma facilities to meet current demand and prepare for the future needs of the communities it serves. At the same time, it is essential for Bentob to continue operations while the expansion occurs, to ensure there is uninterrupted delivery of level 1 trauma services and high-quality care for all patients. The only feasible and prudent way to achieve the expansion while continuing to provide level 1 trauma services is to connect the future expansion facility to Bentob. This connection will provide patients with access to the entire range of specialties and expertise that is available at a level 1 trauma hospital, including vital and scarce neurological services, advanced diagnostics capabilities, operating rooms, and other support services. The connection also would allow for efficient exchange of staff between the existing hospital and the expansion facility. Importantly, the connection between Bentob and the expansion facility also will enable the hospital to remain in its current location within the Texas Medical Center. TMC is a prized, internationally renowned medical center and an invaluable asset to our patients. The physician faculty and medical residents who care for Bentob's patients are from Baylor College of Medicine, which is located in the TMC, a short distance from Bentob. These faculty and residents are highly regarded and also work in other TMC institutions. Bentob's close proximity to these institutions makes it feasible for them to respond in times of increased need at Bentob. Harris Health is proud to be part of the Texas Medical Center, and it is in the best interest of Bentob's patients that the hospital remains in its current location as part of TMC. If Bentob does not remain in its current location, the Texas Medical Center, and by extension the communities served by TMC, will be deprived of the synergy that currently exists between Harris Health and its TMC partners. These partners work closely together on a daily basis to utilize Bentob as a training facility for medical professionals and to provide access to additional healthcare providers, services, and facilities all in one central location. In short, the Bentob expansion project is essential to ensure continued access to life-saving emergency services and comprehensive healthcare for a growing and diverse region. Expanding the level 1 trauma capacity of Bentob in a location adjacent to the existing hospital site allows for implementation of a phased development strategy that will increase capacity at Bentob while preserving current operations throughout the transition. As our Chief Operating Officer, Lewis Smith, will explain in more detail, it is not possible to expand Bentob within the current campus footprint. The 3 park parcels are the only available adjacent property that can be utilized for this expansion, so there is no feasible and prudent alternative to expand Bentob other than taking of the 3 park parcels that are the subject of this hearing. Harris Health will coordinate with the city, the Herman Park Conservancy, the Houston Zoo, and other stakeholders to ensure that the project includes all reasonable planning to minimize harm to the rest of Herman Park. This will include our best efforts to incorporate reasonable measures to preserve and maintain access to the park, as well as installation of landscaping buffers, trail improvements, security lighting, signage, and other measures to mitigate risks to pedestrians and promote connectivity between the expanded hospital facilities and the park. With that, I would like to turn it to our Chief Operating Officer, Lewis Smith.
And thank you, Dr. Porsa.
Thank you, Commissioners, and thank you, Dr. Porsa. For the record, my name is Lewis Smith. I'm the Chief Operating Officer of the Harris Health System, serving proudly in an organization trying to secure the future of Bentob and the rest of the system in terms of a path forward and a future related to serving the communities in which we do. I'd like to expand on what you've heard by walking through the facility options that we've evaluated to illustrate why it is necessary for Harris Health to acquire by eminent domain the 3 park parcels to construct the expansion facility. This is documentation for the record related to the public hearing and appreciate the opportunity to do so. Hospital construction is uniquely complex. Healthcare facilities are governed by extensive local, state, and federal regulations that cover everything from physical entry and exit to the hospital to the standards that must be met for inpatient units to maintenance of emergency power and so on. Options that may seem simple on paper often prove neither feasible nor prudent in reality. And we have to work through multiple iterations to find those ability to really address in a sustainable way the ability to continue to serve our services. Several years ago, after experiencing infrastructure failures at other hospital facilities, Harris Health began to focus more proactively on how to manage the modernization and expansion of its facilities. As the need to add inpatient beds at Ben Taub was becoming more urgent, we considered expanding Ben Taub at its existing campus or constructing a full replacement for Ben Taub in another location. It became clear that expansion of Ben Taub within the existing campus would not be feasible. A vertical expansion was ultimately determined to be virtually impossible because of the advanced age of the existing structures on the campus, including the hospital, Ben Taub Tower, and the Neuropsychiatric Center. The tower and the Neuropsychiatric Center were constructed in the late 50s, early 60s. Since that time, building codes, structural requirements, and clinical design standards have changed significantly. The current hospital building itself was not designed to be vertically or horizontally expanded, and vertical expansion of the other structures would require extensive and costly upgrades that render this approach impractical. Finally, equally important, Ben Taub cannot partially shut down during construction and still serve the essential emergency services and healthcare needs to the public. Quite simply, investing in vertical expansion of the aging infrastructure does not align with responsible capital planning or stewardship of public resources. Relocation of Ben Taub is also not a feasible option. Acquiring additional land and constructing a full replacement hospital is substantially more expensive than beginning with an expansion project on adjacent land and requires additional regulatory and licensing requirements to be addressed. If an inpatient unit is not physically connected to the existing building, which I know you've heard multiple times, that is already licensed as a general hospital, then this new hospital building must contain the full complement of physical spaces and associated ancillary services required for a general hospital in Texas and in most other states in the country. Harris Health does not have the borrowing capacity or the funding available to build a full replacement of Ben Taub, which would cost approximately $2.5 billion or more to complete in today's dollars. And that is an estimate, Commissioner Ramsey, an estimate related to what we think that cost would be. Also, a hospital trauma status is tied to its physical location, and achieving level 1 status in a new location would require significant time and financial resources. To continue providing level 1 trauma services in our region, Ben Taub would need to maintain level 1 in the current location for as long as it takes to achieve level 1 status at the new location, essentially doubling operational requirement and resources in the years that it takes to achieve that. As you can see from these slides, and if you could advance the slide 1, please. As you can see from these slides, the Ben Taub campus is landlocked, surrounded by other hospital facilities, and as Dr. Porsa mentioned, the 3 park parcels adjacent to the campus constitute the only adjacent land available for the expansion purpose. Unless Harris Health acquires these parcels, it is not possible to expand Ben Taub to deliver a safe environment for patients. And that's really a key word, a safe environment, among the other type of issues and challenges that we are managing. Regarding the floodplain concerns, like so many other areas within the city, these parcels are located in the 100-year floodplain. It is important to note that construction within a floodplain is not legally prohibited. In fact, construction within MAP floodplains, including special flood hazard areas, is permitted, provided that the many federal, state, and local laws, regulations, ordinances, and permitting requirements are satisfied. Development within a floodplain may proceed if the site and structures are elevated in compliance with the applicable FEMA base flood elevation and all applicable city flood protection elevations requirements are met, city being the permitting entity of a construction project within this area. With respect to medical facilities specifically, there is no Texas statute banning construction of a new hospital in a floodplain. Instead, the Texas hospital licensing rules allow an existing hospital to expand into a 100-year floodplain if the facility and access to the facility are above the flood zone after construction is complete. The Texas Health and Human Services Commission must approve plans for hospital facilities before construction can even begin. The agency has a well-established regulatory process for evaluating proposed facility designs, and we have consistently and documented followed these procedures for any construction, including the LBJ campus project. Harris Health has already discussed its proposed approach for the expansion facility with the Commission. Harris Health will follow the Commission's procedures and work with the agency to develop an appropriate design for the expansion facility, which will be constructed above the applicable 100-year floodplain elevation and any applicable city flood protection elevation requirements as required through the city permitting process. As we have all come to learn over the past few decades, flooding is not just a possibility in Southeast Texas, it is a reality. The TMC has experienced this as we have heard references to Tropical Storm Allison. What we've got to remember that as a result of that storm, the TMC took a number of measures, and so did Harris Health through its Ben Taub facility to protect medical facilities. Flood mitigation improvements installed in the TMC since Allison include a floodgate network and above-ground electrical vaults, generators, and water pump systems. Developing the expansion facility adjacent to Ben Taub will allow Harris Health to undertake additional flood mitigation measures that go beyond these in existence at the current Ben Taub facility. The design and construction of this project, which will be done in accordance with current TMC standards, will include all required floodplain and stormwater mitigation features necessary to protect the expansion facility from adverse weather events while also safeguarding the surrounding environment, including Herman Park and the neighboring medical facilities. Finally, to minimize harm to Herman Park, the design and planning for the Ben Taub expansion project will include coordination with the city and other stakeholders to incorporate measures that maintain the public's ability to safely and conveniently access the remainder of the park and provide for beautification and pedestrian safety elements within the expansion site to the fullest extent possible given the physical and geographic constraints of the site. These measures will include improvement along Cambridge Street to create a park-like buffer for a pedestrian visiting the park, internal wayfinding and lighting that improves navigation to major destinations in the park and surrounding area, green space dedicated to patient healing and recovery, targeted trail improvements that promote a physical sense of connection and integration within the park, and a plan to preserve and relocate as many mature and healthy trees as possible. We have shown the ability and dedication to this in the LBJ campus design of park like features, and we would extend that into the Ben Taub. In closing, the expansion of Ben Taub is an urgent public health necessity, and there is no feasible and prudent alternative to expand Ben Taub other than the taking of the 3 park parcels to construct and develop an expansion facility connected to Ben Taub. Harris Health commits to continue coordination with the city, the Herman Park Conservancy, the Houston Zoo, and other stakeholders to ensure that this project includes all reasonable planning to minimize harm to the surrounding area. Thank you for your time.
Thank you. One quick question, and then all 4 of us want to make comments. I'm going to exercise my privilege of being first.
Commissioner, do you want to close the hearing first and then move on to 460?
No, we just closed the hearing. So I'll announce that the hearing is now closed. And then this is a question, there'll be discussion now. And it's me, Commissioner Garcia, Commissioner Ramsey, and Commissioner Briones.
This is on item 460.
On item 460. So first, I want to ask our county attorney, are you comfortable that we have met all the legal requirements, assuming there's support for the motion that I'm going to make at the appropriate time?
I am comfortable that you can make the findings required by Chapter 26. If you want an additional discussion on legal
good.
questions, we can
I
go to
think that's
executive
enough.
session.
So I want to say that, first of all, I appreciate Commissioner Garcia, you put an item on the agenda while we went through a robust process. And, I'm a strong advocate of public hospitals. And the reason is because I mentioned earlier when Blackburn was speaking that I was born at Houston Negro Hospital. Just to give you a little history, some iterations before Ben Taub, that was Jeff Davis, and it operated from two sites, from the Elder Street facility from 1924 to 1938. And that is now the Elder Street Lofts. And it was known as Houston's Haunted Hospital since it was over a cemetery, considered one of the most haunted sites in our region. I hope people don't feel that way who live in the Elder housing. Street Artist Lofts, it says 2005. And then you had that other facility on Allen Parkway, which was considered by many people to be a death trap, quite frankly. I'd be remiss if I did not thank Jan D. Hartog. She wrote a book in 1964 called The Hospital, which is one of the main reasons why there was a public outcry over the appalling conditions, and that led to the transition to Ben Taub. Because we opened up Old Riverside Houston Negro Hospital, the county health department's going to be there. I've been doing a little reading and doing a little research. Found out that Barbara Jordan's father, Reverend Jordan, decided he would prefer that she come into the world at home at her age instead of being born in Houston Negro Hospital because he was fairly young at that time. I want to stress how we ought to never act like it's normal in this state not to draw down that affordable health care money. It was interesting to hear so many people testify with such passion on both sides of this issue today. During my time in the legislature, after the Affordable Care Act passed under President Obama, I didn't see many of those faces on either side show up and talk about how much sense it would make to draw down our money to do the Affordable Care Act, and we still losing money. You talk about a real windfall for us and to not put pressure on us to have to raise money, taxes on the local level for health care. I'm committed to this expansion because I grew up without health care, with my daddy working as a nurse's aide at the Veterans Hospital. A veteran himself, nurse's aide meaning orderly, cleaning the beds. So my health care for me, my brother, and my sister, and my mother, who was a maid and a nurse's aide, orderly. We just say nurse's aide at convalescent homes. Our health care was from doctors who would give it to us on the sly because he worked the graveyard shift. I think it was pretty good care, but I don't know. I do know that they thought something was wrong with me because I'm hyper. They didn't know you call it ADD. So I don't drink caffeine. I don't touch alcohol because it exacerbates the problem. Now, if I got 10 things to do, I can do it. If I got to do one thing, it's a real problem. So with that bootleg health care, somebody said, put the boy on Ritalin, which made it worse. But that's what the doctors put me on. And then eventually they decided we won't put him in one of those classrooms for people who won't stop. But, I manage it. I know that most of the people that I represent don't have health care. And that's why this is so important. And I'm going to make the motion, even if there's some heat I get. I guess all of us, however you vote, you can get some heat either way. But probably a little more on me because they are in my precinct. But it's important. And I just, one of my best friends, when he passed away, his widow had to go to a public hospital because I took her there. And that was the best place to go in an emergency, or she would not have made it. So for me, it's a personal matter. It's real. I also want to stress, I remember when the legislature passed the Charity Care Bill, taking on the medical establishment at the Houston Medical Center. It was my bill. And I was doing it because the Attorney General of Texas was suing some of our respected medical institutions because of lack of health care that they were providing for the indigent. And obviously, most hospitals don't pay taxes. They are not for profits. They're where we go. It's the first state in the country to pass a charity care requirement. And I didn't see a lot of firepower showing up. In fact, the joke was nobody would give me a ride back to Houston if I missed my flight in case that was a wreck, because they said no hospital in Texas would take old LSN. And we watered that bill down a bit, but it matters. Far too many people in Houston, in Harris County, in the shadows of the best medical center in the world, do not have access to adequate health care. So at the appropriate time, I'm going to make the motion, but at this point, we'll hear from Commissioner Garcia, then Commissioner Ramsey, and Commissioner Briones.
Thank you, Chair. Thank you, Dr. Porsa, and thank you to members of the Conservancy and to all other stakeholders, TMO, and others. Thank you for coming down and speaking on this matter. Over the last few months, we've gotten a lot of feedback in regards to the many community groups that have been engaged on the project, and that's what I wanted to hear. Whether for it or against it, I needed to hear all of it. And so I really did appreciate the willingness to go back and do the engagement, Dr. Porsa, so I appreciate that. I've got a couple of questions, and number one, let me begin with this. Almost everybody from the community who spoke today spoke about wait times. Is there a way for the public, or at least the court, to track these wait times so that when and if the new BENTOB is created, we can see that what has been proposed to the community is having a positive impact against those horrific wait times that we're hearing so much about. So I'd like to know if there's a commitment to creating that public dashboard.
Absolutely, Commissioner. And I'm just going to use an example because we talked about, you hear BENTOB is consistently, over capacity. Just this Monday, because it was really just because every day at 10 o'clock in the morning, we have a safety huddle when we talk about hospital operations. Just this past Monday, BENTOB reported that they had 70 patients admitted to the hospital in the emergency room. The entirety of BENTOB emergency room has 98 patient bays. When that happens, when basically 70% of our emergency room capacity is taken up by patients who've been admitted to the hospital, that creates the backup. So to answer your question, absolutely. And to make that matters worse, one of the other things that they talked about was that there were 2 people who had been boarded, quote unquote, in the emergency room, admitted with no hospital beds, who had been in the emergency room for over 8 days. That is not compassionate care. That is not quality care. So to answer your question, absolutely yes.
Good deal.
You have my commitment.
Good deal. And I also want to say that this body had asked for an MOU to be signed, and so I appreciate the update, Dr. Porsa, that an MOU has been signed between you and the Conservancy. So I appreciate that. The last question I have is, Mr. Fonban, one of the other issues that has sort of been touched on, but I heard it a little louder, is that the bond campaign was almost entirely focused on LBJ, or maybe exclusively focused on LBJ. Is there any concern that LBJ bond dollars, if that's the way people understand it, will be spent on BENTOB?
So we've looked at whether this would comply with the bond approval language, and we don't have any concerns. In terms of the actual dollars themselves, I would defer to Dr. Porsa. So,
Commissioner, if I may, the answer is no. The funds that have been earmarked for the Bentop expansion remain, and we are committed to using that fund for Bentop expansion and for Bentop expansion only.
Good deal. So no concerns there?
No concerns.
Okay, very good. That was my primary concern. And so again, for everyone who, and I actually got one last one. So we're describing a win-win. And so I feel like I have heard clearly that the Conservancy and the Harris Health System are in the same space in terms of defining today as a win-win. Is that accurate?
That is accurate.
Good deal. Thank you.
Yes, sir. Thank you.
Commissioner Ramsey?
I've been practicing engineering for 45 years.
Yes, sir.
I have never seen a more complicated project than what y'all have chose to undertake. I have asked a lot of questions. Lewis Smith is my new best friend.
He's mine too,
He
Commissioner.
sometimes hates coming to see me because there'll always be another question. And I think that's important. I think what we as Commissioner Court had the discussion back in the fall was we wanted public input. And we felt like that there hadn't quite been that done to the level we'd like. That's one. Two, there was concern about the Conservancy, the Herman Park. Someone even donated to me 200 songs that had been written about Herman Park. I'm not going to sing any of them, but people love Herman Park for a lot of reasons. So there were three real big issues when we began this conversation. Public input, I think we'll check that box. People get to speak, and they have. I think there's been a lot of good input. Y'all have vetted that input. You didn't ignore that input. The Herman Park Conservancy, I think you've dealt with that issue, and I think that's important. I appreciate Ms. Lambright's engagement. I think she has done a good job of representing those things. Park, having worked with 50 cities and 20 counties in the state of Texas and dealing with parks, I knew right away that park condemnation, that's a whole nother area. And so I think as we've talked through and worked through where it could be and where it should be, I think y'all have checked that box. I think your exhibit you provided earlier that showed where the Bentop facilities are today, where the park is today, there's clearly a separation, aim of the street, between the two. So it just, from an aerial view, would look appropriate. Flooding is always a concern out there. I've known a lot of flood studies. I've been involved with probably 4 or 5 of the last master drainage plans for Harris County. I know we always do another one. There's Tropical Storm Allison, then we do one, then there's Hurricane Ike, we do one, then it's Hurricane Harvey, we do one. Listen, it's not because we don't know what we're doing, is doing these. You learn something different every time we have a storm. Every storm is different. And I think the medical center has benefited from that. I know people that have done a lot of work out there. They ask really good questions. They are engineers that I trust. I've known they've worked out there for many, many, many years. So the details related to the flooding, which you've addressed, you've made sure you've crossed your T's, you've dotted your I's. But one thing that's come up in this whole discussion to me that maybe we didn't quite say, it's going to be almost impossible to address the upgrades to the current Bentop facilities unless you have someplace else to go while we do those things. I think the best example of that is there's been a lot of new schools built in Spring Branch, we'll say. Well, they build the new elementary school in a part of the land where the old elementary school is. They go to the old elementary school till they get the new elementary school built. I think there's something very similar going on there, plus just the medical requirements that you just can't pick up and move a level 1 trauma and go to places that's unknown. Those are things that this 4 or 5 month process has allowed us to, as we say in East Texas, more better understand what is going on in terms of each one of those issues. I represent most of the unincorporated area of Harris County, which is not necessarily near Ben Taub. We've got indigent healthcare needs there. My brother did his residency in John Peter Smith in Fort Worth. So Perry has told me many a story about John Peter Smith and the things that happen in a trauma center, in a indigent healthcare situation. And we got to have that. We've got to have more of that capacity. But I know there's needs within unincorporated Harris County, indigent healthcare needs. I look forward to, I think I've heard the commitment related to partnerships with healthcare clinics in that part of the county. It's so important. There is many quality. Commissioner Briones and I are talking right now to Spring Branch Community Health Center. They do great work. 10% of the patients seen at Ben Taub are trauma. What does that mean? 90% aren't. So that's great opportunity, I think, for clinics, partnerships with these folks that are already doing a great job. So there might be an opportunity. Not everything has to be brick and mortar. There are some things that we can go into, and they're already working in the neighborhoods, working in the areas. And I think I heard, at least Lewis has told me that 5 different ways, that we're going to work hard in those partnerships. So I think that's coming. And the other thing I learned is talking to Methodist and Memorial Hermann, and they provide billions and billions of indigent health care in this county. They ought to be recognized. They ought to be commended. They are your partners. They celebrate you like I hope you celebrate them and what they do. But let's not overlook that. Let's not overlook what they do out there. And I'll say some people refer to my precinct as the hinterlands. So we have these great hospitals out there, and they do those sorts of things. I'm going to end with my last 4 questions on this topic, Lewis, and you'll be happy that it's the last 4. Y'all have addressed the 100-year floodplain issue, both in terms of parkland, both in terms of building a hospital, a level 1 trauma in the floodplain. Is that correct?
That is correct.
Now, some people reserve what I'm about to go through as a list of quote-unquote unresolved issues. And what I'm about is resolving issues, not sitting here talking the next 10 years on things that could be or might be. State regulations related to Texas Administrative Code 26 TAC 505.162, you know what that is.
Yes.
We've complied with that, both in terms of the hospital building and the park-related issues.
Baron, you want me to answer this? I can. Yeah. So the answer is yes, Commissioner. The compliance with that code is a process because we will not fully meet it until we actually have the permits issued by the Texas Health Commission. But the answer is yes. We have already met with them twice. They know about the plans. They are comfortable with our plans. We've also met with the city flood control, and they also understand the plan. So the answer is yes, but it is a process to complete.
It is, and I know you have consultants. And I guess the other point in terms of governance, we provide approval of your tax rate. We provide review of your budget. I know Mr. Ramos has spent a lot of time, and we appreciate y'all's cooperation and his time. But at the end of the day, there's also a board at the hospital district.
Yes, sir.
And they review and vet a lot of what we're talking about. So there's a level that we operate in. We're probably in the 80,000 foot, and y'all probably in the 800 foot with the board and going through. But you've hired the consultants, you've hired the people, and you've dealt with those important issues in terms of the details.
Yes, sir.
And finally, my unending questions related to the budget, particularly related to LBJ. I was pleased to understand how you have adjusted to some increased. So you really had to modify some of the scope of what you were going to do. You're doing what was said in the bond, as we talked about earlier, but there were things that you had to modify in order to be sure that you kept LBJ in budget. And the other thing that I heard someone say earlier, there's only 151 million left for Ben Taub. I don't think that's accurate. At least Lewis told me a much bigger number than that.
Commissioner, thank you for addressing that. That is inaccurate. The
So it's
statement that was made.
over 400 million?
$410 million.
Thank you.
Yes.
Okay, I appreciate what y'all have done and your patience with me.
Thank you, Commissioner. If I may, just a couple of things. One, very astute of you as an engineer to recognize what you just said about the expansion facility allows us the opportunity to do what we need to do at the Ben Taub Hospital. Is absolutely right. And I did mention at the beginning, it deserves to be mentioned again. I want to thank the commissioners because you're absolutely right. The last few months of us going back to the community and providing an opportunity for a conversation has meant a great deal to me personally. I think to Harris Health, we have learned through those interactions, and it has brought us to a much better space. So I want to thank the commissioners again for that opportunity and guidance.
Mr. Ellis, thank you again. I know it's in your backyard. You have put forth a lot of effort to be sure all the T's are crossed and I's are dotted, and I appreciate what you've done.
Thank you, sir. Commissioner Briones.
So yes, thank you, Dr. Porsa. Thank you so much, Mr. Smith. I had very similar questions, so I'll just build on them. But the bottom line is I'm highly supportive of our Ben Taub expansion. We have heard multiple times just how incredibly critical and urgent and imperative this is. We are beyond capacity now. We cannot meet with our current population and given growth. We need to make sure that we're preparing not only for today, but more importantly for the future. And so I'm incredibly proud of the work that y'all do, and I'm highly supportive. And to my both and, which I heard referenced, it made me smile, this is a critical public health need, and we all value green space. So I appreciate the depth of the engagement. I appreciate that in October, this court told y'all to hit pause and do the community engagement, work with Herman Park Conservancy. And I have some numbers and I wanted you to confirm them, but I think it's really important for the public to know these numbers, that since October, when this court mandated deeper community engagement, in total, where we stand today, there have been over 150 community outreach events, correct?
That is correct.
Including 15 town halls, correct?
That is correct.
Including 5 neighborhood bus tours,
That is correct.
which have reached approximately 5,600 community members directly. Is that
That is correct.
Okay, and you have worked with dozens of organizations, and I thank so many of them who are here today, correct, for community support and who really pressure tested the need and the options. Is that correct?
That is correct, Commissioner. I have not said no to any invitation from any organization to go and appear in front of them and talk about this. So yes, that is correct.
And you have met multiple times with Ms. Lambert, whose leadership I appreciate and respect so much, as well as your board. You have met with Herman Park Conservancy multiple times. Is that correct?
That is correct.
Okay, so you really heard what we said and were asking you to do, which we all felt was critically important. And thank you for not only doing what we asked, but exceeding that manifold.
Thank you for
So thank you
acknowledging
for that. My question in terms, and this has been asked, but just so that we're clear, in terms of Chapter 26, and as a lawyer and former judge who had many eminent domain cases in my court, I very much respect our county attorney, Fonbon, and I know we have outside counsel, Baron Wallace, who, with all of the due diligence and work we have done, where we stand today, you feel comfortable with this court proceeding with the vote today, with the Chapter 26 requirements in mind,
Yes, I do.
that they have been met. Is that correct?
Yeah, that's right. So the Chapter 26 does two things. It requires a certain standard to be met, or find you to make findings that a certain standard has been met, and then it requires the public hearing that we just had. And I believe that based on the record, and that includes the backup that you've seen and all the public testimony, and of course all the other engagement that you've considered, that those elements have been met.
Thank you, County Attorney Fonban. And so when we take the vote momentarily, would you please, both County Attorney Fonban and Dr. Porsa, from both kind of the business angle and the legal angle, can you walk us through, so the public is clear, what next steps look like? What is the approximate timeline kind of for next steps as we would proceed, if approved?
I mean, I'll do mine briefly because it's very simple on your end. All you're doing here is approving Harris Health's condemnation of the land. So if you approve this today, and then it goes back to Harris Health to proceed with the condemnation process.
Correct. Thank you. And now from Harris Health's perspective, and I recognize counsel may need to come, Dr. Porsa, you do play a great lawyer, I must say, for a doctor. But could you please walk through at a high level what that entails, what are next steps, what the timeline may be? Because as you all know, we all have this urgency of now, to one of our speakers' points.
I'll do my non-legally informed response, and then Baron.
Yeah, I would not play a good doctor, let's just be clear. So I respect that you play a good lawyer.
So Baron, I'll try, and then you can correct me along the way. Is that okay?
We'll collaborate. Go ahead.
All right, thank you. So this is my, again, non-legally informed idea of what happens next. Assuming we receive the approval, I believe that the next step is you know what? You do it, because I'm gonna do it. I'm just gonna murder this. Go ahead.
Smart move, Doc. Smart move.
He's a doctor, just a doctor of jurisprudence.
Commissioners, Baron Wallace for the record, working with Harris Health. So the next steps, once condemnation is approved, there are, Chapter 21 governs that process, and there would be letters sent to the owners and anyone else that has an interest in that land. That will take some time, but we are ready to do that. We're prepared to send out the letters. There's a little bit of a waiting period, and then, of course, the litigation proceeds after that. So we're prepared to move forward once commissioners have made their decision.
And I know there's many contingencies and variables, Mr. Wallace, but approximately, best case, worst case, what are we looking at in terms of the timeline from your?
Yeah, it's hard to say, but I think we internally have a timeline that looks at about 6 to 9 months before possession of the land is determined. It is at that point, once possession transfers, then you have the litigation determine values, okay? And so the possession would be in 6 to 9 months. It could be a little longer depending on appeals and other litigation, but we would hope to be in that place, and then hopefully the process determining values between the owners and reversionary interest holders.
Thank you, Mr. Wallace. And then my last questions pertain to the budget. So thank you, Mr. Wallace. So Mr. Smith and Dr. Porsa, back to you. So Commissioner Ramsey asked many of them, but the bottom line is, for the public, we thank them for overwhelmingly supporting our $2.5 billion bond. Could you very briefly break the different segments of LBJ, Ben Taub, and the 3 community clinics, and then the philanthropic support with Ms. Robertson? Thank you for your leadership in exceeding the goals and timeline there. Can you talk through that? And then I have one other question.
Sure. So I want to preface what I'm going to say is that the $2.5 billion was not the totality of our need. It was our borrowing capacity. But what was promised to the residents of Harris County as part of the $2.5 billion was $1.6 billion towards the LBJ, the new hospital on the LBJ campus, another $400 million towards the refurbishing of the existing LBJ hospital, $410 million toward the expansion of Ben Taub, and $500 million toward the expansion of our community clinics, which included 3 new clinics and adding capacity and capabilities to all of our existing clinics. Obviously, when you add it all together, it's well beyond $2.5 billion. It's north of $3.2 billion. $100 million in philanthropy was promised over the next 10 years, which you heard at the topping off at the hospital, that we've actually arrived at that 7 years ahead of time.
It's amazing.
Thank you for that. And the rest of it, actually, I have to thank Lewis Smith and also our CFO, Victorina Keaton, is really meant to do with our operational cost savings and routine capital investments over the next 10 years to fill in the gap. But that is the breakdown that was promised, and that is exactly what we're going to deliver.
So that was essentially my next, well, there's several sub questions, not really one last question. So the bottom line is that we went to the public, we put this bond, they overwhelmingly voted for it. We made a commitment that we are going to deliver what we said we would deliver. And we will deliver it, correct?
We will absolutely deliver on every one of those promises.
And so the concerns, which I know we all share now, we will be having quarterly public updates here in Commissioner's Court, correct?
That is correct.
Okay, so everyone can stay tuned and stay abreast of the progress that we're making together. But the bottom line is that there are plans to fill in the gaps so that we do achieve the exact things we told the public we would achieve.
Yes, ma'am.
Okay, and
And we had the first of those quarterly presentations last month.
I loved it, and I look forward to the next one already. And to remind the public, we told them that we would deliver these bond projects in a timeline of.
Next 10 to 12 years.
Okay. So I appreciate that. And again, I appreciate the thousands of community members who have attended these events, who have called, who have written, all of the groups working together. And to me, that's what makes me proud to live in Houston, Harris County. Like, we can do hard things. We can come together. We can find these both ands. And we have heard loud and clear, and I will be laser focused on making sure that the park-like features are a key element in the Ben Taub expansion. The public access improvements and the environmental protections are kept front and center. And I appreciate, again, the collaboration, and I hope that it continues as we get this done, because it's critical and urgent, and we can't get it done soon enough. So with that, I appreciate, and Commissioner Ellis, I'm ready to second when you're ready to make the motion. Thank you.
Chair, just real quickly, Doc,
Yes,
you should have told me Barron was involved. I would have trusted your process a lot more. Okay.
So quick point, at the probably next business court, Mr. Farnbaum, I want to just do a simple resolution, since we appoint people to that board, saying it's the sense of this court at least, whatever board is in place in the future when this comes about, that land, when they get off of it for the current facility, that'll be park space. So I just want to make sure I'm doing everything I can to tie the hands. And the last point is, we put that on a consent thing, I think, at the regular business court. From Ned's heads nodding, we're all for it anyway. And the last point is, Cara Lambert, I want to thank you and all of the folks in the parks community. If you think that community engagement didn't have an impact, I just want to tell you that I know there's $20 million in play that this commissioner would probably have used for other things in that area, so that it did have an impact. So I know some people, when they don't get everything they want, they'll say, well, who's that? If you could say it Blackburn, if you could say it in tongues, I got $20 million in tongues. How about that? That was not on the table. Just want to put that on the record. And with that, I'll make this motion. Considering all available information, including materials reviewed by members of this Commissioner's Court, and the public oral and written testimony provided during today's hearing conducted under Chapter 26 of the Texas Parks and Wildlife Code, and finding that there is no feasible and prudent alternative to the use or taking of the land, and that the project includes all reasonable planning to minimize harm to the land as a park. I move to authorize Harris Health's proposed acquisition by condemnation of approximately 8.9 acres of Herman Park adjacent to Ben Taub Hospital for the redevelopment and expansion of Ben Taub Hospital in accordance with Section 281.050 of the Texas Health and Safety Code. Second by Commissioner Briones. All those in favor vote aye.
Aye.
All opposed vote no. 4 ayes and no nays. The item passes. Thank you.
Commissioners, thank you. May I approach?
And thank you. Thank you so much. Thank you. Good. Glad it worked out. Thank you. Thank you. And the next item, Commissioner Briones, we're going to bring up items 142 and 143, the PDO and MAC items now. because the judges, I know, have to get back into court. And so, and you have a motion at the appropriate time, but I think you have some discussion on those two items, item 142 and 143. And I know we have speakers who want to bring them up. Is that all right?
Thanks again to everybody.
Thank you all.
Thank you.
So we got to hear from the speakers on those items, I know. Items 142 and 143. And Commissioner Briones, we're ready now. I think if the judges are here.
Yes, thank you.
Okay.
See Judge Draper, Chief Draper, and I see Director Brown and their teams. And so for those who are following along, 142 and 143, we are going to delve into the strategic plans, current landscape, and future roadmaps for Harris County Public Defender's Office and the Harris County Managed Assigned Counsel.
Good afternoon. I am Tanya Jones, the co-presiding judge of the Harris County Criminal Courts at Law, and I rise to join those who are gathered here in celebration of Gideon v. Wainwright. In that case, Justice Black made it clear that counsel is a right and not a luxury. On that day, a voice echoing from our nation's highest halls guaranteed that representation would no longer depend on the power of your purse or the width of your wallet. And the promises of that day persist today. As judges, my colleagues and I have a particular reason to remember the ruling. The ruling established our role and also our duty as stewards of justice. Under Gideon and under Texas state law, judges are charged with appointing counsel for indigent defendants. Answering that charge, we supported and continue to support the development of the PDO and the work of the MAC in our courts, work that we witness in our courts on a daily basis. We appreciate the faith that the citizens of Harris County and this court have placed in us as guardians of that guarantee, and we will continue to work with the MAC and PDO to secure indigent defense in our county. Thank you.
Thank you for your service, Judge Jones.
Thank you. Judge Jones is a really hard act to follow always. There are some slides that accompany this presentation. If we could have those slides available. Thank you. My name is Genesis Draper, and I'm the Chief Public Defender here in Harris County. Thank you so much to the members of court for allowing me to speak today. Yesterday, we celebrated the 63rd anniversary of the Supreme Court's landmark opinion in Gideon v. Wainwright, holding that the Sixth Amendment of the Constitution provided a right to counsel for those who could not afford it in criminal cases where their liberty is at stake. Our office and public defender offices across the country exist because of this constitutionally guaranteed right. Next slide, please. I think it's worth noting that this important decision began with a handwritten letter from Clarence Gideon to the Supreme Court arguing that a person cannot get a just and fair trial without the aid of counsel. Mr. Gideon, who didn't have much in the world, knew the thing he did have was a constitutional right to counsel. Mr. Gideon was tried and convicted in Florida. He filed his own appeal, and the Supreme Court entered this landmark decision.
You can continue.
As a result of that, he was retried with counsel and found not guilty. So this is a very important right. You cannot face the accusations of the government without the assistance of counsel. Today's briefing provides a clear, data-informed update on how the Public Defender's Office will provide this constitutionally required service in a fiscally responsible way. Next slide, please. The mission of the Harris County Public Defender's Office remains centered on delivering high-quality, constitutionally required representation for indigent people accused of crimes in Harris County. Our charge includes holistic legal defense, which is a client-centered model that addresses both the immediate criminal charge and the underlying social, economic, and personal issues driving a client's involvement in the justice system. As you all well know, I don't think a lot of times people associate the public defender's office with public safety, but we also have a responsibility in public safety, and that is the purpose of our holistic division. We want to make sure that we assist people not with just their case, but also try and reduce the chances that they return to the criminal legal system. And so that is a lot of the work that our holistic division does. Next slide, please. Today's focus. This slide outlines how we will structure the presentation around the current landscape and assessment and strategies and considerations for future growth based on those assessments. As you will see, there is no silver bullet in expanding the office, but a web of collaboration that will be necessary to expand our capacity to represent more people accused in Harris County. Next slide, please. For a little bit of background knowledge, we handle a range of cases. We handle appellate cases, bail, felony, misdemeanor, wrongful convictions. We provide holistic services, immigration consultations, juvenile representation, as well as mental health representation, mental health case representations. Specific to capital cases, because I know that this has come up in this court several times, the PD currently handles juvenile capital cases and is exploring what it would take to add a capital division for adult cases in approximately 5 years. It's important to note that that is a very heavy lift. We already have a pretty heavy lift, but I did want this court to know that that is on the horizon, that we do believe our office is best suited to take on that endeavor, and that that is a part of our long-term strategy. Next slide, please. As you can see, our share of indigent defense caseloads has grown in the past years, but we have kind of stalled out in the last several years, and so we took a different approach this year in or I guess it would have been last fall, in our misdemeanor division. And so we pumped many more lawyers into that division through our fellowship program. And so you saw a rise. If you're looking at this chart here, you saw a change from about 20% in the earlier or middle part of 2025 to as high as 31% at the end of 2025. And so right now we're hovering around 30%, but that's about a 10% increase in the misdemeanor division. So much of our strategy now is about making sure that we can feed that robust pipeline of misdemeanor attorneys into the felony division. So as they graduate out, they will then roll, as new ones come in, old ones will graduate out and join the felony division. The representation in felony court has hovered around the same, and so we have, we'll talk later in this presentation about some things that we have employed in recent months to try and see how we can address that in the short term with the staff that we have, but also in the long term as we add staff. Next slide, please. We are currently working with the Office of County Administration on this, on the dashboard to make sure that we are calculating case assignments in the same way. Right now, the way we calculate our share of the caseload is, I think, a little bit different than the way the courts are currently looking at that. So we want to make sure that we are aligned there to have a really good understanding of the amount of cases that we are taking. One of the things I think is important to note about these slides here, yes, our plan is to add staff. Of course, we have to do that. But what we have taken a look at since I've been there is how we can increase capacity with our current staff. And so we've taken a look at people's caseloads, and there does appear to be an opportunity to increase capacity with our current staff. And so based on TIDC standards, if we bring our attorneys up to that maximum, and understand that that is not an absolute number, but it does give you some guidance for what's appropriate. If we bring people closer to that number, in felony cases, we could handle around 21% of the cases, And in misdemeanor court, we could handle about 40% of the cases. And that's what with our current staff. So that's very encouraging to note that we can make some substantial progress before we even add another body to our current staff. Next slide, please. At this point, I do want to reiterate that expanding the office is not only about hiring lawyers for the office, but to make sure that we are continuing our holistic approach. So as we hire lawyers, we will also need to consider additional legal assistants, investigators, peer navigators, and other support that underpin our growth. We want to make sure that we are able to continue the same level of service as we grow. Also, retention is key. It's not going to do us any good if we are losing people as fast as we're bringing them in. And so we're looking at a lot of different strategies that will help us retain the people once we have them there. Next slide, please. Recruitment and retention. Even though we have grown significantly since the office's inception, I know this court is aware of how stagnant our growth has been in recent years. One of the key initiatives we implemented last August was to start recruiting lawyers out of law school in our post-bar fellowship program. Traditionally, the office hired experienced lawyers only, which ensured quality of representation but sacrificed our ability to grow. Last year was the first year of our post-bar fellowship program, which scaled up attorneys to our misdemeanor division, which we attribute to the spike in our representation percentage in misdemeanor courts. So where we discussed going from 19 to 30% in a matter of months, that coincides with us expanding our capacity with the courts as we increased our staff. The post-bar fellowship program has a dual function, scaling up our misdemeanor division and creating a robust pipeline that will feed into our felony division. This slide summarizes the work that we have done in our recruitment. One thing I wanted to highlight is our partnership with Gideon's Promise. I serve on the board for that organization. It's a nationally recognized nonprofit public defender training organization whose mission is to transform the criminal justice system by building a movement of public defenders who provide equal justice for marginalized communities. Our office is now proud to have been selected as one of the offices for their law school partnership program, which places high-achieving law students in offices across the country. Leveraging Gideon's Promises brand and resources maximizes our ability to recruit. Next slide, please. If we could get another slide, please. It should be the very next one. While we're waiting on that, let me just discuss some other considerations. Rolling out, other considerations for the court to consider on this pathway of growth is us rolling out new project management systems, expanding internal case management adoption, and identifying space needs. I have said to each of these courts that with this growth comes the need for additional space. We actively are out of space, the attorneys and staff. We don't have a space for everyone at this time. There is a new build out on the horizon that should be done in just a few weeks. And so I think at that point, we will at least have space for almost everyone in the office. But at the rate at which we're adding, we have 10 coming on Monday and 22 in the fall, we will be out of space again. So I do want to make the courts aware of that. For just a final closing point, we are looking at about a 3-year roadmap to try and get where this court wants us to be, which is where we're able to accept 50% of the cases. We want to make sure that we get there in a timely fashion, but that we get there responsibly. And so we have given you this roadmap so that you have an idea of what to expect where it relates to our needs as we make our way towards this type of growth. We will continue to work with our partners at the CJCC, the PDO board, community, and advocacy organizations to make sure that our work aligns with the needs of the counties and of the county, and that we do it in a fiscally responsible way. I would also like to note that we have been in partnership with the Office of Managed Assigned Counsel. that has been a really beneficial partnership to make sure that we are working together to maximize the county's dollars where it comes to this constitutionally required service. The last thing I'll mention is I've said that this type of growth will require partnership, and we have enjoyed the partnership of this court in supporting us in this growth. We will need that continued partnership as well as partnerships from our courts. We need them to appoint to make sure that we can actually get this number up. I have to give a special shout out to the misdemeanor court judges. They have been so intentional about making sure that we increase this number. And so we would not have been able to go from 20% to 30% in just a matter of a couple of months without their support. The district courts as well, they are a much larger group, and so it's going to take a little bit longer to turn that ship. But we have requested meetings with each of them individually, and they have responded well. And so I think that they will be well on their way to increasing that capacity in each of their individual courts as well. At this time, I welcome any questions that you have.
So Judge, she'll call you Judge. Once a judge, always a judge.
It's okay.
Thank you for the work that you're doing. Remind me again, what percentage of the overall cases does the Public Defender's Office have now?
So we carry about 17
continue.
to 20% of the cases in felony court. We handle about, at this point, almost 30%, and that's a relatively new development, but approximately 30% in our misdemeanor division.
So if we just calculate the overall cases, just if you know that number, is it 12%, 15% of all of the cases?
Of all of the cases combined, I think we are probably closer to 30% because you also have to think about juvenile. We handle a very large part of juvenile. And, obviously for the bail cases, we handle 100% of those.
Yeah.
And we are over 50% in our appellate division as well.
So when I calculate it, I always think about, I want to also thank Commissioner L. Franco Lee, who carried the item, and Commissioner Raddick, who was chairing the CJC at the time. And of course, the Rev. Lawson and Archbishop Fiorenza and Rabbi Karff and my Senate staff, because we were stirring it up. That was my role back then. But I think when I got here, I can't remember. I know I've said it to you before. So I might have been at about, it may have been, by the time I got here, if it had been around almost a decade, it might have been 10%, 11%. Sound right?
That's about right.
So that is progress if we're up to a 30. But I just want to remind my colleagues, not you. Mr. Bunnan did a great job and the whole team. But it was after George Floyd's funeral in May of June, whenever it was, 2020. So coming up on 6 years ago, when we made the commitment, we'd get it to 50% and whatever it was, 2 years. And now I know it'll take another whatever amount of time to get it done the right way. But I think that what you do and what the MAC does have to work in tandem, because we know, I always pointed out, I know people want to forget about it, the way the system was working. People using it as a way that they go raise campaign money. And I always want to stress that the notion of the judge picking the lawyer for somebody accused of a crime just is inherently, in my judgment, unethical and unfair. Nobody would sit back and think that the judge ought to pick the prosecutor. That doesn't happen. And I always bring it up. I'm not going to change now because I happen to be a commissioner now. But we ought to do that with all deliberate speed. And Commissioner Rams, I talked to you. You got more clout up down there. But it's a heck of a deal. Never had to serve a day. I did 26 years, probably 6 years interning and staffing. But that ought to change because under that law that passed in 2001, provision was included where 2/3 of the judges, I think, have to agree. That ought to be changed. And it was there. It was a mistake. But if I hadn't taken that, the state wouldn't be putting any money in indigent defense. You think we got a tab now? Counties used to have to carry it all. Almost a U.S. constitutional requirement from Gideon. But in Texas, for whatever reason, they decided to abdicate that from the state to the local units of government. But we ought to get that changed because so much of it is kind of cuddling and going on, and depends on who gets there, it changes. But I just want to stress and hope the press picks it up. That's just not right. And we wouldn't tolerate that in any other system of the judge picking a lawyer for our kids. And it ought not be that way for people who are poor.
And I want to add that we have built out our policy team so that we can focus on these areas of legislation that could advance these initiatives. It's great to do the work locally. It's great to have zealous representation, but it does trickle down from, our abilities trickle down from what is mandated by law. And so we do want to work with the county as well as the legislature at the state level to try and do better.
I just bring it up when I can. You can go tell them, oh, Rodney made a mistake in the bill. I won't point out the names of the folks, my colleagues on the other side that made me take it. And the other one is the system where the judges just send us a tab. We got to pay for it. And I don't want to go overboard because some commissioners' courts would decide just don't pay anything. There's a delicate balance there to make sure that we're fulfilling our constitutional mandate. Thank you. And thank you for stepping down from the bench to go do this. Judge Treb, it says a lot about you
It's been
and
an
your
honor.
commitment.
It's been an honor.
Thank you.
Thank you. Any other questions?
Commissioner Garcia and then Commissioner Briones.
Thank you. Thank you, Judge. Appreciate the work and appreciate the visits that we've had. And actually, both of y'all, thank you very much. And I'm excited about the progress being made and hearing the numbers, having an uptick is great. Commissioner Briones is circulating a motion, which I will support. I will make a friendly amendment to her second motion about your strategic plans, because I want to see thought given to increasing capital capacity. So just to let you know, I'll be adding that into the motion.
Sure. And pursuant to our conversation, that is absolutely a part of our strategic framework.
Commissioner Briones.
Yes, thank you. Thank you both, Judge Chief Japer and Director Brown. I look forward to hearing your update shortly. It is incredibly impressive and energizing to see the progress you have already driven in these months since we appointed you. So thank you for stepping down from the bench and just running with it, because this is unbelievable. So thank you.
Thank you.
Especially the Gideon's Promise. That was a brilliant move, and I love the fellowship talent pipeline that you're creating. I love the increase we've already seen with the misdemeanor courts using the public defender's office, and again, that's because of the credibility and trust I know the judges have with you as a former judge. So thank you, thank you, thank you. I know that the felony courts, you're meeting with them, and for all felony court judges who may be listening and tracking this, we ask you to please lean into, because this is a team effort. These individuals can have a higher quality representation at a more prudent cost, and so it is a win-win in terms of the quality of justice, and from a budgetary standpoint, as all of us are stewards to the people. So I hope that they will listen and make sure they're intentionally and in partnering with us to the greatest extent possible.
Likewise.
Because I share exactly the concerns that Commissioner Ellis just stated. Relatedly, onto the private appointment of counsel, there's a question for the auditor. I know Commissioner Ellis and I sent a new letter to get a new report on the latest information on the private appointment in counsel and which lawyers, how much, et cetera. So stay tuned. We will be having the latest data soon. But my question to you is, and I just wanted to make sure you're I know our teams have been talking, but just to confirm and do it publicly, I know y'all are working on a comprehensive 3-year and 5-year strategic plan to meet that at least 50%, to add capital cases and these key items. Would it be feasible to return to Commissioners Court with those plans by August 1st? Is that workable?
Yes, that is, I thought this was material. Yes, that is workable. We absolutely could have that available.
Okay, and we wanted to time it strategically as we work through as we prepare for our next budget year and the whole process. We want to make sure that we're supporting you in the ways that you need to be supported. So
Yes, and our plan is, of course, to provide you with enough detail to really understand our needs by way of knowing what resources we need, the timeline for deliverables that this court is expecting, and so we will make sure that you understand that clearly.
Well, I am, again, energized and thankful for the progress, and I love how you started with Gideon, right? So for everyone listening, like, this is a constitutionally required right, and this is something the county must offer and honor. And I look forward to the state being an even better partner in picking up its part of the tab. But in the meantime, this is constitutionally required. This is non-negotiable. We want to deliver the highest quality of justice and representation. I love your focus on holistic representation. And so we're going to be paying the bill regardless. Might as well do
Correct.
it with a higher quality and that's more meaningful and that then has public safety positive implications when we're delivering this representation. So again, I appreciate the misdemeanor judges. Judge Jones, thank you in particular for being here and your leadership. And again, I know and respect so many of our district court judges, and I ask them to lean in as well. So I can't wait to see the continued progress. And I know Commissioner Ramsey wants to speak before Director Brown, but I'm also excited to hear the progress you've been making, Portia. So thank you, Judge Draper.
Thank you.
Yeah, quickly, thank you for what you're doing. I think you've taken a very focused and pragmatic look at how we can increase the number of folks there. What's caught my attention on this issue, not being the attorney on the court, is the unpredictable nature of the cost. The outside attorneys that we bring in, and as I sit with Daniel, and I say, well, where, is this $50 million that we're trying to figure out how to pay? So that part of it, I think this may be not the good reason, but it is a reason. I think our ability to understand and manage our cost, pay attention to those is better. It's in essence an in-house attorney opposed to outside. The whole issue that Commissioner Ellis points to, I mean, that's just not in the category of right when the judge is appointing the attorney that's going to be making a case in the court. That just looks like when A&M played Texas, and I won't go down that road in terms of who the referees were. But I do appreciate what y'all are doing. It's noticeable to me as a non-attorney legal, this court system some days gets me real confused. But y'all have taken a very focused approach just in the short time that you've been involved, and I appreciate what you both are doing.
Thank you. I appreciate your remarks. And that is really the takeaway. That's a very good reason, actually, to support these efforts, because these are constitutionally required costs. As you have stated, the county will pay the bill regardless. And so you want to be able to predict that cost, to provide the service that you are supposed to provide, but at a cost that you can predict. And that is what our office strives to do. Thank you so much.
Thank you. Thank you.
Director Brown, please.
Yes, good afternoon, Commissioners Court, Commissioner staff, and our other county partners. My name is Portia Brown. I'm the Executive Director of the Office of Managed Assigned Counsel, otherwise known as the MAC. Do we have some slides we can put up for us? Thank you. No worries. Next slide. And so today's focus is going to be a quick overview of a little bit of background of what the MAC is, key tasks, our current and desired landscape, as well as trends, and some of our strategic planning timeline. Next slide. The MAC's mission is to support attorneys in treating clients with dignity and respect through high quality and holistic representation to persons accused of a crime who are unable to afford an attorney. I definitely have to say Happy Gideon's Day to everybody after that statement is said. Chief Draper also mentioned the Gideon's Promise program as what's being included in the Public Defender's Office. I did want to note that that's where I met Chief Draper, was us both being a part of that program, and I'm so happy that we're able to bring that here to Harris County through its leadership. Key tasks. Our goal with the MAC is to select and maintain highly qualified, ethical attorneys, as well as provide holistic services, provide timely and objective appointments, ensure that vouchers are taken care of, receive feedback, and promote professionalism. Next slide. Next slide. And so a little status update. I've been here since November, a little over 120 days, and it's been exciting, especially meeting with all the Commissioners Court staff, as well as meeting with our misdemeanor court judges. And I thank them for their support here in court today. So we've been able to re-engage stakeholder relationships. We've been able to do an operational assessment that's still ongoing, as well as pushing for development in the areas that we need. Last month, we were able to obtain 2 positions that were critical, a voucher assistant and an immigration attorney. Next slide. Earlier, we talked about quality representation, and that's what we're focused on. So here, when it comes to quality insurance, we make sure we do that in a lot of different ways, but one of the biggest ways is ensuring appropriate caseloads. The average MAC attorney has 100 misdemeanor cases as of 2025, which is well within the TIDC state guidelines. We've also been able to grow our attorney list by more than 135%. In the courtrooms themselves, these courtrooms, it's 16 courtrooms. We have 4 resource attorneys on each floor in the CJC just across the way. Those attorneys are observing court proceedings, addressing complaints and concerns, not only from the judiciary, but also getting feedback from the actual clients and then providing support to those attorneys in real time. We then use that information to make updates to the attorney list based on quality of representation. So what does that lead us to? It leads us to higher dismissal rates, stronger trial results, as well as fewer jail days. Next slide. Our current voucher review system. And for those of you who aren't aware what that basically means when an attorney finishes a case, they submit for billing, and then we are the ones that review it, audit it, and process that system. We have a custom 5-stage voucher review that addresses inaccuracies, double billing, and unreasonable activity. This is one of the things I'm most excited to talk about because it exceeds best practices, and that's based on our own county auditors' ratings. Next slide. I want to make sure that we highlight on our holistic services. This provides seamless access to holistic services, which reduces days in jail. How do we do that? Through case investigation, immigration consultations, and social services. We want to make sure that we see each client as a whole person, as well as building community partnerships to serve as a bridge to those services. Next slide. Let's talk about the current landscape. Next slide. So this is what happens whenever someone enters in via an accusation. So there's first a charge, and they end up at the JPC. Then they move on to one of our 16 misdemeanor home courts, and that is when a MAC attorney is appointed. Afterwards, their case will either result in a dismissal, a plea, or a trial. Next slide. In the end of that system, the attorney submits a case voucher through our system called VIPS. When that's completed, then they're paid out, as well as we also do the appointments through FDAMS, which is an objective way of providing those appointments. Next slide. This is our desired landscape. Next slide. So in this system, when someone gets to JPC, we are pushing for the actual MAC attorney to be appointed at JPC as opposed to waiting to the home court. That way the person gets quicker access to resources, quicker access to their attorney, and hopefully better outcomes with their cases. Next slide. Additionally, we hope to move towards a quarterly voucher system that will enable us to be able to have better forecasting when it comes to spending for indigent defense. There's a little red box there called SCALES. SCALES is going to be a new program that we plan to implement that's going to address quality concerns by increasing our ability to do evaluations as well as store that data in a meaningful way. Next slide. System improvements. Next slide. And so as I said with SCALES, this is my beta. It's a stakeholder comment and attorney list evaluation system. In the 4 months I've been here, I've been able to obtain a lot of feedback from our judiciary as well as the MAC attorneys and our clienteles. And one thing that's been important is making sure we have a central location to store that information. We're able to give quick feedback to the judiciary and their concerns, as well as coaching and being able to give feedback to attorneys in a meaningful way. So we're hoping to implement SCALES, which would be able to be a central area within our Managed Assigned Counsel's database. And the results would be better attorney evaluations, systemic improvements, as well as promptly addressing concerns from the courts. Next slide. I did want to take a little bit of time to talk about VIPS. This is the system that does the processing for the vouchers. It is owned by Universal Services, and we are looking forward to continuing partnering with them. But I did want to bring this up, and I believe Chief Draper also discussed. Our system is an ecosystem. And so in order for improvements to occur on the MAC level, they also have to occur in other places, such as with universal services, having the right amount of developers to enhance our voucher system downstream. Next slide. MAC trends and forecasts. Next slide. So I did want to talk a little bit about the numbers, right? So this past year, we're on track to have about 40,000 vouchers submitted this year. We also did a forecast for the next 3 years in regards to vouchers and attorneys accepting appointments. You'll notice that that green band is very wide, and that's because case appointments as well as the attorneys is going to vary from year to year. That could be because of less case filings or more, maybe different things that happen on the district attorney's office side, as well as different delays that could happen in court. Next slide. When it comes to our holistic services, we've seen less of a band. So you have a tighter green area there. There's less variables because we've been increasing, but we've been able to predict that accurately. And that's why we thank you for providing those resources like a voucher clerk and an immigration attorney so we can ensure that as we grow in such a steep area, we're able to maintain the same level of service. Next slide. So this is where we're currently at. We're at year 0, FY26. Right now, we are in 16 misdemeanor courts, and we're looking at what would a felony expansion look like and a juvenile expansion look like. We've also included our budget here as well as the amount of attorneys that we have in our current list, which is 225. I'll tell you this, in Texas, it is hard for MACs to find attorneys. In Harris County, we have had over 80 applicants our last time period. And so there's a need, there's a want, people want to be on the MAC list, as well as be attorneys for the public defender's office. So that 225, that's only what it could be right now. It will be more in the future. And so I want to make sure to highlight that in order to have and support those 225 attorneys, we need things like operational personnel. We need things like holistic services. And so thank you for the prior positions that you approved last month. And we'll be also asking for more in the short term for FY27. Next slide. And so what we would plan to move towards after looking at a felony and juvenile study would be to move towards working groups. And what do working groups look like? Those are individuals in rooms discussing what would be the challenges of expansion, right? What is this tech? What are the space challenges that we have? What are the things that we might have to include from universal services to get us to a level to be able to absorb the amount of cases that we would have to use to move to a felony and a juvenile. And we've also included some of the personnel and holistic services that we would need to support that. And then in the midterm for year 2, next slide, we would move into what we call a felony concept or a juvenile concept. And we have adjusted the amount of attorneys that we'd expect to need to continue proceeding, as well as the positions that would be required. And next slide. And by year 3, we would be in the area of doing proposals. Now, Commissioner Briones, I want to make sure to note, this timeline could be quicker, right? But I want to make sure that at least we hit these incremental points no matter what. This kind of expansion always requires judicial approval. And so there may be a situation where the judges are so impressed by what happens in the misdemeanor court and so excited by the results of a study and a working group that we're able to move quicker. But I did want to give a timeline that was firm that can get us to the national gold standard for being a MAC. Next slide. Any questions?
Outstanding. Thank you. Commissioner Briones.
Yes.
Thank you for this update, and thank you, too, for the progress you've been able to drive so quickly. Leadership matters, and you two are embodiments of that, as we've seen. I love where we're headed. I love the level of collaboration and communication that you've been able to establish with the judges. And the key to the MAC is the independence of the MAC. And so my question to you is, there had been some administrative changes that impede the independence.
Correct.
Can you talk us through?
Unanimous consent will continue.
Could you please, and again, I recognize collaboration, communication is key and non-negotiable, and independence is non-negotiable, and we're Harris County, we can do both and. So where are we on making sure you have the independence and runway you need, and how can we support you to make sure you get that?
I'm glad that you asked that. That has been a challenge for us. There was a recent local rule change back in October. I have been able to do listening sessions with all 16 judges, and I'm working on doing individual ones with them as well, including we are doing monthly meetings with the Harris County Criminal Lawyers Association, as well as with the presiding judge and co-presiding judge as well. In regards to the law, and some of the national standards, the ABA principles. We've also been able to talk with the county attorney as well as TIDC about their thoughts and what their opinions are about this revolving issue. We did just get that information, and we're dedicated and focused on trying to figure out how do we have those two scales balanced, right? We have independence, but we also have a judiciary that's confident in the MAC, which I believe they will be, and they currently are. And so right now, we're in the process of continuing discussions. There's not a week that I go by that I don't speak to the judges, and I think that's all been very helpful to being able to now break away from silos and to have conversations together in rooms so that we don't have issues like local rule changes that aren't vetted before, they're not discussed within the different stakeholders.
Well, I'm happy that some progress is being made, and I know we requested the opinions. And again, there's the collaborative, nice way to do things, and then there's this is the law, it will change way. And those rules need to be changed so that you all have the independence you need, which is inherent in what a MAC is. So I'm optimistic and confident that those rules will be changed so you can do your job and you can continue to build that trust and give them all the information they need so that they can best serve. Again, we're on the same team. Do the both and, which I know you are. And
Absolutely.
Director Brown, I appreciate you. One last question.
Sure.
You said that your strong preference in the kind of change of the current flow would be to have the MAC attorney appointed at the JPC.
Correct.
Could you briefly walk everyone through what you would need to make that happen?
Absolutely. So first thing would be judicial buy-in. I know that when it comes to this particular ask and what I envision, that's currently something that's been discussed in the felony court land. So I don't think we're too far apart, but it would also require support from the commissioners, because it would require extra staffing to be able to make those appointments, as well as continuing our partnership with the Public Defender's Office. And so I can definitely see a world where we both need additional funding to be able to place that resource on the front end and do the appointments when someone first comes in. The thing is this, when a person knows who their attorney is, they know who to call about when to go to court, you're gonna have better outcomes. And that's what we want. That goes back to public safety and better outcomes for clients.
And you already read my mind on the next question. So I'm highly in favor of this shift, and at least as far as my vote is concerned, know you have my support to make that happen, and I really do hope the judges will support that as well. Just very quickly, so at the end of the day, this will enhance the quality of representation.
Correct.
It will save money, create efficiencies, and then make sure people show up and all the things. But just can you talk about how quickly, let's just say, we're here, budget cycle, the judges have approved. How quickly could we activate that so that we have that operational shift and this higher quality, better cost efficiency, et cetera?
And I would say we've already discussed an August 1st timeline. I would like to come back before then or close by August 1st after we've talked to the appropriate stakeholders, the judiciary, the Public Defender's Office, to make sure that we have a budget cycle that can support that kind of systemic change. Of course, it's got to get judicial approval, but that's the timeline that I would like to move on. Would be something that says, hey, August 1st, can we have the right funding that we need to push this forward?
Excellent. Thank you.
No problem.
Thank you. Is there a motion? Commissioner Briones.
So I have a motion, and I know Precinct 2 wanted to add for
Oh, I'm
capital
sorry. Did
cases as
I-
well. Commissioner Garcia, did I understand you correctly? For capital cases? Okay, perfect. So here is the motion, please. Motion to direct the Public Defender's Office and the Office of Managed Assigned Counsel in coordination with the Office of County Administration and Office of Management and Budget to finalize comprehensive 3 to 5 year strategic plans, which shall include, for the public defender, addressing representation in capital cases, and return to Commissioners Court with those plans before August 1st. These strategic plans should be updated on an annual basis, and future funding and staffing requests should align with those plans and progress toward outlined milestones.
Second on both.
And you want to add a friendly amendment, or did you get it in?
Well, she got it.
I
She
brought
got
it in.
Any discussion? All those in favor, vote aye.
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 Four ayes, no nays, item passes.
And it is for both items,
For both
Commissioner? Thank
For
you.
both, please. And amazing work. Keep it up. I appreciate you both tremendously.
Thank you very much.
Thank you.
So, colleagues, it's now 1 p.m. What's your preference? I think we ought to go eat, and we'll come back at 2 o'clock.
Okay.
Okay, so it is now 1:05 in Commissioners Court. When we come back, we'll hear from the rest of the speakers and hopefully go through the consent agenda and try to finish up the day so we can enjoy it. So 1 o'clock, and for those who are going to speak, work it down so you got it down to your minute, and we'll get it done. Okay, it's 1:05, Commissioners Court is at ease? Yeah. Adjourned until then, at ease. Adjourned until 2 o'clock. A break until 2 o'clock. Yeah. Okay, thank you all. Thank you, everyone. Shh. It is now 2:04. Commissioners Court is back in order, and we'll go through the public speakers at this time, please.
First is Deborah Smith on item 2, Diane Bailey Risenberg on item 2, Marion Wright on item 56, Amy Zachmeyer on items 99 and 409. We each have 1 minute.
And we'll keep going if they're not here. If they come back, we'll let them up. Just call some more names out.
Juan Rubio on item 99, Janice Slay on items 156 and 157, Sarah Knight on item 212, Kimberly Carlson Lewis, item 212,
Thank you. Come on up, please. And just state your name for the record, please.
Hello, my name is Janice Slay. I'm the Executive Director of the ARC of Harris County, a nonprofit serving individuals with intellectual and developmental disabilities since 1984. We were honored to be part of the cohort number 1 of the Capacity Strengthening Program. Through CSP, we gained access to professional coaching tailored to our organization's unique needs, along with high-quality training from experts across the nonprofit sector. These resources were not just helpful, they were transformative. Because of the CSP, we evolved, we had relevant communities, and we adjusted to changing needs. And in a city as diverse as Houston, that matters. Every precinct represented here relies on nonprofits to support its constituents. The reality is most nonprofits operate on a shoestring budget.
Thank you. Your time is up.
Thank you.
Thank you.
We get you the drift. Thank you.
Thank you.
Next speakers.
Kimberly Carlson Lewis on item 212, Paul Miles, item 212, Sharetta Miles, item 212, Mo Cortez, item 237, Christopher Rivera, item 237.
You can keep going. I don't see any of them walking up.
Okay, Cesar Espinoza, item 281, Becky Smith, item 281, Jesus Zamora, item 281, Valeria Alvarado, item 281.
Sarah Knight's in line right now, in the security line, so she's coming up right now.
Okay, we can get started. Yes, sir. Just say your name for the record. You have 1 minute.
Mo Cortez. The watchful eye and the crumbling road. They're logging the plates on the back of your car while the bridge over I-10 is wearing a scar. A free-floating barge knocks a column away while commerce and traffic are forced to stay. 25 Superfund sites in the soil while sinkholes and data leaks bubble and boil. Is this the welcome for the World Cup crowds? A police state hiding in digital clouds? Almost anyone can buy what the brokers will sell, but a hackable lens makes a privacy hell. No warrants, no cause, it's the 4th they ignore. The 5th and 14th walking out the door. We need a presence, not a cold glass eye. Security isn't a camera in the sky, because data is fragile and temporary stays, and justice gets lost in the surveillance maze. Then look at the budget, the biggest expense, outsourcing bodies away from the county. Families driving for hundreds of miles while the 6th Amendment is buried in piles.
Thank you. Your time is up.
Thank you.
Thank you.
You're a poet. Thank you.
Good afternoon. My name is Jesus Zamora. I'm a resident in Precinct 4 and a member of the staff of Mi Familia en Acción. We work with communities across the county, including youth and mixed status families. We believe that when every community voice is included, we can create solutions that help every family thrive. Let's take a big step and look at the bigger picture of what's happening. The price of healthcare, groceries, and rent is soaring. Every summer, we all brace and hope that a hurricane doesn't flood our homes or that the heat doesn't knock the power out. On top of that, across the country, we're seeing with our own eyes a campaign of violence and discrimination toward communities like those in Harris County, one of the most prosperous and diverse counties in the nation. If we allow fear and judgment and hate to divide us, we lose a chance to create a better policy that solves the issues we share. We want all of our families and neighbors to thrive, not just survive and get by. This commission is an opportunity for immigrant and refugee families to simply provide feedback on policies. I ask that we dare
Thank you. Your
unite
time is
and to
up.
serve our Harris County families.
Thank you, Mr. Zamora.
Thank you.
Good afternoon, Commissioners. My name is Paul Miles, and I have a son that's a U.S. Navy veteran. He's 26 years old, and he has an 8-year-old son. He was upon his when he was released from the military, he was diagnosed with PTSD, depression and anxiety, and other disorders. He has a son. For the past 3 years, he has been cycling through psychiatric facilities and has been arrested on mental health crisis, and has been in and out of jail, never receiving the level of care that he deserves. Everything in our justice system has made it harder for him to heal and recover. In one instance, a behavioral institution sent him away to Dallas, and he had no means to get us back home to us. Another time, a court 14 in Harris County issued a failure to appear while he was hospitalized in another facility. He was sent to LaSalle in Louisiana a couple of months ago. We know this because of the Texas Commission on Jail Standards, Attorney General's remedial order, and the jail that anyone that with mental conditions cannot be sent away. We're asking Commissioner Ellis to please vote no and please let these men and women get the help that they deserve. Thank you.
Thank you.
Good morning, Commissioners. My name is Sharita Miles. This is the hardest thing I've ever had to do. I learned that people with mental illnesses are not supposed to be sent to LaSalle. A commissioner at the Texas Commission on Jail Standards meeting warned our staff to not send people to mental health with mental health conditions to LaSalle. My only son has been in and out of the psych facilities for some time now. He has documented serious mental illnesses. How is it that sheriffs are allowed to violate state policy by shipping them off to Louisiana? This is not justice. Please bring him back. Please do not renew this contract. Please vote no. He has an 8-year-old son. He was in a facility to where he was trying to receive help, and while he was there, the courts had put a failure to appear on him, but he couldn't get out. They wouldn't let him out.
Thank you. Thank you very much for coming.
Good afternoon. My name is Sarah Knight. I'm really struggling here to understand all of you. Commissioner Briones, maybe you will fathom my frustration and pain as a mother and as a Latina. How can you support this $38 million contract renewal for LaSalle? You know that our jail handed over 5,400 people to ICE last year, which is the massive increase from 3,300 people in 2024. And now you want to give another 38 million more to LaSalle so we can keep using the jail to separate families? Why? Every time I have to come here, you have taken the time to remind me that you too are a mother and how safety is your top concern. But who are the families you are protecting? Certainly not ours. Right now, the only family that stands to benefit is the McConnelly family that owns LaSalle.
Thank you. Thank you for coming.
Good afternoon. My name is Kim Carlson Lewis. When I saw y'all were planning to give another $38 million to the same private prison company, LaSalle Corrections, that has already killed 3 of our loved ones who were shipped out from Harris County, I had to come here and ask you why. Why would this court even consider giving more money to a private prison company that currently has 3 lawsuits against it for custody deaths of Harris County residents? I beg this court, under no circumstances, please do not renew the contract with LaSalle. I don't want a single dollar of my money to go to the people who killed our sons. Why would you reward a company that has the worst track record nationally for standards of care? And how is the purchasing department allowing this to happen? Isn't there a policy to not contract with vendors who have pending litigation against them? You're supposed to be good stewards of our tax dollars. This is an irresponsible way to spend our money, especially when the new DA has reduced the jail population by 12%. And he announced this week that he has cleared the court backlog. Please, please do not renew the contract with LaSalle. Thank you.
Thank you. Next speakers.
Hey, everybody. Sorry they called me. I guess I was still getting processed through. But my name is Christopher Rivera. I work with the Texas Civil Rights Project, and I'm here to speak on item 237. I know it's pulled, but I still want to say why I'm against spending additional $2 million on Flock. You know, this is the Fourth Amendment contract with Flock, and if we don't act quickly, we're going to lose opportunity, a moment, to really protect our most vulnerable community members and regulate how our data is being shared. This amended contract would allow Harris County to share Flock data with federal law enforcement and third-party contractors. This is alarming because Flock cameras have been used for deportation efforts, and if we don't regulate, control, and deny sharing this data, it would allow for more coordination deportation efforts by ICE using Harris County resources. The new amendment contract would also map all the locations of the Flock devices. We should make this map publicly available. These are tax dollars being used, and we are entitled to know where these devices are placed in our neighborhoods. In Lexington, they publicly share the camera locations, and in Universal City, they also do
Your
it.
time is up.
Thank you for coming.
Yeah, thank you.
Yes, ma'am. Come on up. Yes, ma'am.
Hi, sorry I was not back right on time, but my name is Amy Zachmeyer, and I'm here to say that I'm proud to live in a county that has leaders who put residents first. I'm proud that the county is moving forward on the implementation of worksite safety policy to eliminate the kinds of serious injuries and safety issues on taxpayer-funded projects of the recent past. I'm also proud that the county is ensuring that our electric grid will be stronger and residents can reduce energy costs with the continuation of the Harris County Solar for All project despite the EPA's attempts to thwart your efforts to serve the working people of Houston. Harris County is a place where businesses and workers can thrive while building the infrastructure that we all rely on. Thank you all for the work you do to serve working people.
Thank you very much.
Hi, sorry if I'm misinformed, but I believe my name was called already, Valeria Alvarado.
And just say your name for the record. We'll be glad
Okay,
to have
cool.
you.
Thank you. Hi, everyone. My name is Valeria Alvarado. I'm here on behalf of the ACLU of Texas. I want to say that the ACLU does support an initiative to create a commission on immigrant and refugees. We are also here as a resource for you guys. We believe that in order for there to be an effective commission, it should be staffed with diverse expert voices, people who are on the ground in the community across the county that really have that vital community information, as well as legal experts that can understand how to make impactful policy that is still within legal bounds. We think that if they receive funding and the proper time to push out actual impactful policy, these could be effective tools to fight against very relentless attacks that are happening right now against the immigrant community here in Harris County. So we appreciate the work you guys are doing. We are here in partnership and hoping that we can be a tool and resource for you guys. Thank you guys so much.
Thanks for coming.
All right, there's still speakers going through the lobby. I'm just going to call out names. Jacob Clementich, Guillermo Vasquez, Michelle Sforza, Jeff Ormsby, Hani Khalil, Barbara Denson.
And they're here. Thank you.
Good afternoon, Honorable Commissioners. My name is Guillermo Vasquez, and I am the Deputy Director of AFSCME Local 832. AFSCME has represented workers here at Harris County since 1965, and we are collectively 6,700 members strong in this community. I'm here today to ask for your support to adopt the consultation policy. As you know, consultation simply means giving workers a seat at the table, just like they do in Austin, San Antonio ISD, and the cities of Austin and San Antonio. and there's one here in place as well at Harris Center. If you adopt this policy today, workers will have a platform to address working conditions and other items that workers care about. This is simply a unity table between labor and management, and it's good business too. It builds an atmosphere of collaboration between labor and management at Harris County. Commissioners, you have an opportunity to make 5,000 workers' voices count. We hope we can count on your support today. Thank you.
Thank you. Looks like you got a few friends there with you, Guillermo.
Good afternoon. My name is Michelle Sforce, and I am the Associate Director of Organizing at AFSCME International. And on behalf of AFSCME's 1.4 million members nationwide, I stand in enthusiastic support of this consultation framework for Harris County. At AFSCME, we know that government works best when workers have a formal voice. And consultation will provide that voice through regular meetings between county representatives and an organization selected by employees to be the county's consultation agent. The model is based on labor management cooperation, collaboration, on policy development, and in engaging on solving real-time problems. Participation is voluntary, and you, as the Commissioners Court, make the final decision on policies proposed through the consultation process. Importantly, this resolution also takes a crucial first step in establishing basic due process for county employees. AFSCME members working for the state of Texas and in cities like Houston and Austin currently have a due process procedure, and Harris County employees deserve nothing less. We urge your support for this important policy and look forward to working with you in the future. Thank you.
Thank you.
Good afternoon, Commissioners. I'm Hani Khalil, Executive Director of the Texas Gulf Coast AFL-CIO. Our 75 unions and 60,000 union members believe that everyone deserves a voice at work. For years, the AFL-CIO has partnered with this Commissioners Court to improve jobs for both county employees and workers on county contracts, and to expand access to career training and good jobs through registered apprenticeships. This consultation policy is the next step in that work. County employees know their jobs best. When challenges inevitably arise, it's those workers who are best positioned to work collaboratively with their supervisors to find solutions together. When employees have a regular channel to discuss working conditions and worker priorities with their employer, it means that better services and a more responsive county government for all residents, workers, and businesses will come forward. So thank you for showing your commitment to working people having an organized voice at the table by passing this consultation policy today.
Thank you.
Good afternoon, Commissioners. My name is Tiffany Hill, and I'm an employee here at the Harris County Public Defender's Office. I just made a year last week. And I am, of course, not speaking on behalf of the office, but would like to say my openness and willingness to this, what is being proposed. So as an employee, I feel like this opens doors and an open line of communication for workers that some may feel intimidated to have as currently as employers to their higher ups. And it also gives a sense of transparency for workers to make important decisions, to have their voice heard. And so I do think this is going to be a beneficial and opening doors for not only employees but employers, so that we can foster a good working relationship and also to create efficiency within the workforce of Harris County. It's not just about me. I work at a great office, but other employers here in Harris County. Thank you.
Good afternoon, Commissioners. Thank you so much for this opportunity. My name is Jason Evans. I'm the president of Hope Local 123. We're all here standing in solidarity just to make sure that employees' voices are heard throughout the county. Unionization is an important thing that has been the backbone of this country. I believe it is also the contingency, the backbone of this city. And right now we have the opportunity to make things better for everyone across the board, not only from the standpoint of us and ours in the city, but for its Harris County. And I just want to say thank you for this opportunity. Thank you.
If I could just have a second to take a picture of this beautiful group behind me.
You don't know how to do that selfie? You want me to take it?
Need someone tall with long arms, and I'm not that person. Come on, Jason.
Oh, I'm sorry. Oh, Lord.
Thank you all.
Thank you.
Thank you.
Thank you.
And I see the next speaker coming right behind them.
Barbara Denson. Item 282 may sound administrative, but as you just heard, it is essentially a move towards unionizing county employees. Creating a consultation agent to represent employees in policy development and grievance procedures mirrors the structure and function of a union representative. This type of intermediary often becomes the foundation for collective bargaining and expanded union authority over personnel matters. Please oppose this measure because it shifts decision-making away from elected leadership and toward a third-party representative structure that will limit flexibility and drastically increase bureaucratic overhead and costs. Employee input is important. However, it has been successfully incorporated through direct communication, transparent HR processes, and existing channels without having to
Your time
create
is up.
a framework that resembles unionization. If it ain't broke, don't fix it.
Thank you for coming.
Greetings, Judge, in her absence, and to the commissioners. I am Reverend Jocelyn Griffin, the mother of Evan Griffin Lee, who was murdered in Harris County Jail 2022. And I'm asking if you would consider canceling the contracts to LaSalle, Louisiana, and Mississippi. Keep them in their states. Texas is big enough to house our overflow. And please consider a mental health jail system to detour the mentally ill patients who need care and not custody. Please expand Ben Taub services. Thank you. The vote was unanimously. But on today, on today, the 19th of 2022 is the day that I got a call from one of the physicians at Ben Taub Hospital saying that my son was there with blood trapped between his brain and his skull and needed an emergency surgery. So the need for that facility is very important. Thank you.
Thank you for coming, Reverend.
Thanks. Mhm.
Good afternoon, Commissioners. I'm Deborah Smith. Incarceration shouldn't be a death sentence. I lost my daughter in 2022 in Harris County Jail. It's not easy. And even though I speak many, many times, sometimes it's kind of harder than some other times. What I'm asking is that I have a problem with the contract that Harris County Ben Taub has with Harris County Jail. They should have been the first whistleblowers to letting society know instead of the deaths piling up and then, wow, what's happening at the jail? They were there, they were seeing the patients. This patient wasn't having a headache.
Thank you. Your
It wasn't
time is
having
up.
this or that. These people were hurt in their custody. So I'm not happy with Ben Taub. They should have been, they take a pledge.
Thank you.
They take a pledge, a Nightingale pledge and a Hippocratic oath. Take care of people.
Good afternoon, Judge and your staff. I am Diane Bailey Reisenberg. I lost my son in the Harris County Jail on July 1st, 2023. I'm here against the plan to build a new jail. You don't need a new jail when you need people to be reformed. Where is the reform system? The court system to be sped up for people who are having a simple case, especially mentally ill people. What does a mentally ill person do in a jail? All contracts about LaSalle, Louisiana, and Mississippi should be canceled immediately. What are we doing? Also, there cannot be a mentally ill jail. I heard that you want to build a mentally ill jail. To do what? A mentally ill person need restorative care, not being in jail. You've put my son in jail and he became worse because he didn't commit a crime to be in jail. I never knew that mentally ill is a crime. This is my son.
Thank you. Your time is up.
Thank you for coming.
And he has never committed a crime.
Pardon me. Hi. Thank you, Commissioners. I'm here on behalf of some other people besides myself. I'm with the Greater Houston Coalition for Justice. Johnny Mata is not doing so well, so he asked me to come, and then there's a civil rights attorney named Yamika Lewis. She also wanted to come, and they wanted to show support for the county judge, but she's not here, and neither are they, so that cuts my time real short. But I would like to say one thing. Commissioner Garcia, you were the first Hispanic sheriff elected in Harris County, were you not? I have never seen any recognition of that, and I would like to make a motion, if I could, because you can't, to get him recognized, a plaque somewhere, because just getting there was quite a feat, and I think you should be applauded for that. Thank you.
Sir, can you state your name for the record?
Oh, Reese, R-E-E-S-E, first name Jeff. Thank you. Good to see you, man. Thank you. Same here. Sharp dressed man coming up. Look out.
Hi, I'm Marion Wright, and I'm here today to ask, what are y'all going to do for our safety? And the reason that I'm asking that, and I'd appreciate it maybe if y'all could stop looking at your phones and maybe, I've been here all day, so I'd appreciate it. My question is, what are y'all going to do for our safety? We have a county judge right now who I think we all know what happened recently at the rodeo. I like Lena Hidalgo. I have nothing against her. But what happens in an emergency when she's at the helm? I've been into Commissioner's Court many times, especially during the budget season. This Commissioner's Court has been run so much more efficiently than when she was here. I'm just worried about our safety in Harris County with Lena Hidalgo right now. I don't think she's going to step down. Are there any other steps we can take for her own safety, for our safety, for everyone's
Thank you. Your
safety?
time is up.
Thank you for coming.
Thank you.
How y'all doing today, Commissioners? I'm excited to be here to talk about 281, the possibility of having a commission on immigration and refugee. So I think that is definitely very critical and very important to our community. I applaud you all for taking this stance. There's something that no one else has done, and I think it's a beginning step so we can start hearing the community discuss about what we need to do about this immigration and refugee problem we have in Harris County. So thank you all, and I support it 100%, and I hope this passes through this Harris County. And I know for a fact, everything that goes through Harris County when it gets started, other agencies take it on as well, like the state as well as the nation. So I hope this can go forward and be something very successful in our community. Thank you so much.
you.
Yeah.
Can you state your name for the record, sir?
Yes, my name is Willie Drew. Thank you. Oh, and I do need to say the same thing as Reese said. We do need to applaud Commissioner Garcia because he was the first Hispanic sheriff. So thank you for being the first Hispanic sheriff.
Any more speakers?
Matt Blumen, Warren Howell, Candace Floyd, Carl Homan, Jordan Weirick.
Hello, I'm Warren Howell. I'm a native Houstonian, lifelong business owner, and I'm a candidate for county judge. I'm here on behalf of the taxpayers to voice my opposition to item 282, providing for an official office for a union member to consult with Harris County employees who are being compensated more than well. A retirement program I don't think is even sustainable. It appears to be a trick to get unions into Harris County. This is a right-to-work state. Did you forget? I'm shocked that we don't come up with ideas to save money. You guys lay awake at night to spend money, to figure out how to do more. I don't get it. This is not Chicago. This is not New York. And it sure as hell ain't California. So we need to straighten up.
Thank you for your time.
Thank you.
Thank you, Warren.
Good afternoon. My name is Candace Floyd, and I'm an employment specialist with Summer House Houston. Thank you for the opportunity to recognize our partnership with Precinct 4. Our mission is to support adults with autism or intellectual disabilities, their families, and our community through partnerships that foster a culture of belonging, choice, and respect. We began this journey in March of 2024, working with Precinct 4, Tracy G., Thomas A. Glazier Community Centers, including Mary Jo Falcom, who's also here today, to expand opportunities and demonstrate what inclusive employment can look like in action. Summer House Houston is honored to formalize our MOU with Harris County Precinct 4 to support the growth of the All Abilities Position Initiative. At Summer House Houston, we believe work is meaningful, and meaningful work matters. It impacts not only the individual, but their coworkers, the organization, and the broader community. I want to extend a sincere thank you to Commissioner Leslie Briones for your heart, hustle, and higher standards, and your leadership and commitment to creative, inclusive workspaces. Your support helps turn opportunity into reality. We're grateful to Precinct 4 by leading by example and helping build a community where everyone has the opportunity to contribute and belong. Thank you.
Thank you so much.
Hello, my name is Carl Homan, and I am proud to be a part of the Harris County All Abilities program. Through Summer House and Tracy in the Tracy G Community Center. I started working here in 2024. Being here means truly a lot to me. Today, I am happy to stand here as an ambassador for Precinct 4 to show my support for the partnership between Precinct 4 and Summer House, because the partnership opens doors to people with the autism spectrum, including me. Since this job began, I have grown so much every day. I've become more confident, independent, and comfortable taking on new challenges.
Continue.
Yes, please continue.
All
You're
right.
doing great, Carl.
I especially am excited to do more creative tasks like the one I'm doing today. I want to say a sincere thank you to Commissioner Leslie Briones for giving me the opportunity to work at Tracy G. It has made a real difference in my life, and I'm grateful for the future opportunities it will create for others like me. Thank you.
Thank you, Carl. If I may, Commissioner Ellis. Carl, that was amazing.
Thank you.
We're so thankful to have you, and we're so thankful for your contributions and all of the other team members in our All Abilities program.
Yes.
We believe deeply that everyone should have access to opportunity, and as a former teacher who had many special education students, it's really important that you all have access to opportunity, and I know you want to work and contribute, so we're honored to have you. I hope my colleagues will consider a similar program, and we're so thankful for
And
Summer
Ms.
House.
Commissioner, I look forward to leading the pack. Precinct 4.
You are a leader amongst leaders, Carl. And Summer House Houston, we're really excited about this partnership to grow together because everyone deserves a fair shot and everyone should have access to opportunities. So thank you for being a part of the Precinct 4 team and for leading the way so that this can be scaled to other places. So thank you, Carl and team.
Yes, ma'am. Thank you, Madam Commissioner.
Thank you.
Thank you.
Thank you. Are there more speakers?
Thank you for letting us come today.
Thank you for being
Thank you.
here today.
Thank you very
Thank you.
Okay. Any more speakers?
Jordan Warwick.
That was Jordan.
Okay.
Thank you, Jordan.
Hello, good afternoon. My name is Amethyst James. I'm a City of Houston employee and a proud Hope Asked Me Local 123 member. I'm the Downtown District Rep. So I'm just here to speak for those specifically in quote unquote labor positions, the park workers, the employees picking up trash, the employees out there fixing water leaks. These positions are severely underpaid. Now, if you're a Harris County employee, you're in a high position, you're fine with your salary, okay, you don't have any issues, okay, but don't speak for every worker. You cannot. Okay, there are workers there who really need this, who really deserve this. And this is something that can really change their life and really change their working conditions.
Thank you for coming.
Hello, people. My name is Nephiteria, Nepheteria Swan. And I basically wanted to get up here when I heard a few people speak. I thought it was very amusing that those people look alike that spoke, the man and the woman who were anti-unionists. I don't really understand why they're speaking on unions if they're anti-union and they're not in it, they're not paying for it every month. What is it their business? It's not people's business if they don't want to be in it. Unions are involved in helping many people make decent money, not the best of money, and helping them with a lot of things that they need. It gets scholarships for kids. It does a lot. And like one guy said, the country was built on unions, and we know this. So I don't understand why they got up here, and was speaking whatever they were speaking. And that's all I wanted to say, because I know I can talk a lot, and I know this time goes fast. Thank y'all.
Thank you.
My name is Alexi Swirsky. As my children were growing up, I took them to the Houston Livestock Show and Rodeo every year. And as a 4-H leader, I took my 4-H kids every year. My husband now takes the grandkids. The children 4-H had to adhere to the 4-H rules. Publishing misleading information on a social media account is grounds for dismissal from a 4-H account. Attempting to force their way into an area they didn't have a ticket for would have broken 4-H rules. Fortunately, the kids in my 4-H program conduct themselves very well, and we never had any embarrassing incidents. I wish I could say the same about the head of Harris County, who is also the former but now discharged unofficial head of the Houston Livestock Show and Rodeo. Houston and Texas have a reputation of being a place where we combine hard work with looking out for others. That cannot be said of the current head of county government. Let's do what we need to do to keep our reputation of a city and a state that is hospitable and has good manners, instead of a state full of obnoxious, pushy people. Thank you.
Thank you for coming. Are there more speakers?
Larry Johns, non-agenda speakers, Larry Cooper, Stephen Kay, Richard Hyde.
How's everybody doing? When I was 19 years old, I started to work. I had the pleasure to work for Harris County, and never in my days did I think I'd be up here talking to the county commissioners. I've worked for 3 different commissioners, and it's been wonderful. My wife put in 15 years. She had got breast cancer, went It was stage 3C going into stage 4. She had a bilateral mastectomy. Everything's going fine. But we woke up one morning and her medicine that she needs, her injections that's helped her with her lymphedema, kidneys and stuff, that went from $25 to over $1,000. And it's of course, other things are happening, life and stuff, but this right here has been really horrific, and she wasn't able to make it here because of the stress over the last 3 or 4 days trying to get her medicine. And anyway, I'm out of time.
How many years did you serve?
40 years, a little over 40 years.
40 years.
And my wife, 15 years.
Thank you for your service.
Well, it's been a pleasure. It's been an honor to do that. I love the county that I live in, and there's a lot of hard-working people that doesn't get the credit and stuff, and I don't deserve anything, but anyway, we got to get this stuff straightened up for my wife, and I appreciate it. Thank you.
Sir, can you state your name for the record?
Chief People Officer Raleigh and
Sure. Larry Johns.
Hey, Larry.
All right, I appreciate all of it very much.
Larry, just before you walk away, thank you for coming up here. And I know that never having done this, it can be a little intimidating, but just to let you know that I have gotten a good number of emails of folks like yourself.
Yes, sir.
I got a call from former Major Don McWilliams regarding this issue. This was something that should not have happened the way it's happening.
Yes, sir.
There should have been more conversation with our retirees
Yes, sir.
about what to anticipate. When we were deliberating this contract with Aetna, we specifically said no impact to our retirees.
Yes, sir.
And so just know that I'm not happy with this having the kind of surprise it's having. And some folks are trying to characterize this as, well, it's only hurting the high-earning retirees. That's insulting.
We're struggling.
And that's insulting. So just know that when we don't think about things in advance, this is how screwy they can get.
I've got a close friend from Virginia, and he's a hillbilly, and he told me, and it stuck with me all these years, he goes, rat poison is 90% corn and 10% poison. And I believe the truth, if you put 10% of a lie in the truth, and then it turns out to be poison. And I think we all had y'all's eyes.
Just know we've at least I'm paying attention.
Yes, sir.
I think
I
we're all
appreciate
on
y'all
the
so
same
much.
page. Thank you.
And thank you for the opportunity to work for you the last years of my retirement and stuff, and it's been a pleasure. Thank you so much.
Thank you.
we appreciate you.
Good evening. Larry Cooper is my name. I'm a retiree as well, but I'm here for a different reason. I'm here to let the Commissioner Court know that we have a business, Lewis Food Town, operating in Harris County in the city, and they have been operating for 20 years unlawfully, no certificate of compliance. Also in the city, in Harris County, where most of their stores are located, people are getting hurt, employees being amputated. A person has died. I have gotten injured, and it's been washed under. According to Harris County Rutgers Engineer Department, I asked for to see who had compliance, and most of the stores did not have compliance. There's no record of them. I've had the fire marshal to come out and do some investigation. They found that these people were, in fact, violation of many laws. And in the city, they have stores, but they're in compliance. So I don't know what the equity is, but
Thank you. Your
I have
time is
submitted a package for you guys to consider and to check that out. Thank y'all.
Thank you. Thank you very much.
Thank you.
Stephanie Valdez speaking virtually on item 281. You have 1 minute.
Good afternoon, Commissioners. My name is Stephanie Valdez. My apologies for not being present today. I'm currently on a work trip, but I wanted to make sure I called in and show my strong support of Agenda Item 281 to establish an Immigrant and Refugee Commission. I just want to say this is about making sure the people most impacted by policies actually have a seat at the table. Immigrant and refugee communities are a part of the backbone of this county, and they contribute to our economy, our culture, and our neighborhoods every single day. A commission like this isn't just symbolic, it's practical, It creates a space for real feedback, solutions, and community-informed decision-making. At a time when there is so much fear being amplified, this is an opportunity for the county to lead with intention, with facts, and with humanity. I also want to acknowledge that while there may be opposition, that does not reflect the full picture of our community. And I want to say this clearly to our Latino commissioners. This is all a moment for you all to speak up. Our communities are watching, and immigrants all across Harris County show up for this county every single day. And right now, we need you to show up for us. Silence in a moment like this speaks loudly, and we need leadership
Your
that will
time
be
is
bold,
up.
visible, and grounded in our communities. Please support this item and move forward.
Thank you.
Thank you.
All right, Commissioner, we have one more virtual speaker that we're still trying to get in touch with, so I'll let you know if we are able to get her.
Okay.
And that's all the speakers on the list. I don't know if anybody came in after their name was called.
Is there anyone
And
who
may I-
signed up who was not, you did sign up, sir? But you
May
wanted
I
to speak?
take a-
Go ahead, come on up.
After he speaks, may I take a point of personal
wanna do it now?
privilege to recognize someone? But please, after you, sir.
I'm non-agenda related. Is that okay?
But you signed up to speak?
Yes, I did.
You can speak.
So I am a.
Well, say your name for the record, please.
My name is Stephen Kay. I live here in Houston. I grew up here. I have been a patient of Harris Health for years. It's interesting. Today, coincidentally, they're all kind of lobbying for more money and expanding, and always talking about patient healing, recovery, safety, dignity, all these great words. Safety net for the most vulnerable of the county. Unfortunately, I am a example of that not being the case. They turn indigents into cash cows. Unfortunately, people like me become a big source of revenue for even the public defenders. They all want more money as well. No one's really ever trying to efficiently optimize the money that they have, just use more. If we go overboard, could we please extend it? Because I've been here since 9 a.m. They told us it would be before lunch break, everyone would have a public comment. I paid like $10 for parking. The care that I've gotten there is very unintentional, very lazy, careless, reckless.
Thank you. Your time is up.
I've lost everything. I can't brush my teeth. I can't.
Thank you. If you
eat
would
solid
like,
food. They ban me.
if you like, you can submit a statement as well.
And I have. I never
good.
got a reply.
We got it. Thank
But
you.
They banned me.
Your
and it's
time's up,
really
sir.
unfair. If y'all could please intervene, I'd appreciate that. Thank you.
Hi, I'm Latricia Marshall. I signed up to speak today because I retired from Harris County about 15 years ago. And, the cost of living and everything has gone up over the years, plus our insurance has and our deductibles have. Well, when my deductible for my MS medication got to be $250 a month, I had to go on every other month because I couldn't afford that every month. So Cigna helped me get a manufacturer coupon, and the manufacturer took care of my deductible. And now that we have been transferred to Silver Scripts, they are no longer allowing manufacturers coupons because they are considered a Medicare Part D plan rather than when Harris County had us on it, we were
Thank
a
you. Your
regular
time is up.
plan. So I would ask the commissioners, just please reconsider because it'll cost me $3,000 a year for just one of my medications on the new plan.
How many years did you serve the county?
I was at this county for 19 years and I was at Galveston County for 5.
Okay, thank you.
Thank you.
Thank you for your service. And for the retirees, we will get to that item soon. But if you're here, can you raise your hand, sir? So you're here to answer questions and tell them what their options are as an interim solution. And we'll be discussing that soon.
I think we have one more speaker. And Commissioner,
then I have to,
didn't catch you
yes,
earlier.
something quick
I
after.
think this is the last one. Sorry, I didn't catch you asking me earlier. Yes, ma'am. And just say your name for the
Good
record.
afternoon. My name is Yolanda Andrade. This is really hard for me to do. This is my first time ever doing this, and I'm 69 and I've been in Houston for 67 years. So I know that y'all do a lot of great work, and I see it on the news and everybody. And But unfortunately, I have been blacklisted for the last several years. And per the Department of Justice, they told me that they rejected my complaint, and they told me that I needed to go through the process. So here I am. I have been, I will be emailing y'all, all of y'all, some documents that I have to prove my innocence. This is what I want. I want.
Thank you. Your time is
So,
up.
we'll have someone follow up with you. Okay? Thank you.
Commissioner, we have the final virtual speaker. We
Okay.
have them.
Commissioner, Bennett, did you have something you wanted to say first?
Sure. While the virtual speaker comes on, thank you, Tiffany Williams. I just wanted to recognize our former City of Houston council member, Mike Knox. He's here to show support for a partnership effort we're doing, item 334, which is the Vintage Houston Police Department Foxtrot 5K race scheduled at John Paul Landing on June 6th, 2026. So thank you, Councilmember Knox. Thank you for being here.
Thank you. Thanks,
Mike,
Pete.
I'm not wearing my glasses, but I thought that was you. Good to see you, man.
Thank you for your partnership.
Thank you. Okay, do you have one last speaker, right?
Yes, sir. Randy Trevino on item 281 virtually. You have 1 minute.
We'll come back to him if you get him later. So, Jay,
Okay.
Jay, you want to go through the corrections and no action review items?
Sure, we can do the corrections, no actions. All right. Page 11, item 98, no action is needed. That's the broad legislative discussion item. Page 12, 102, universal services requested no action. Page 38, 295, precinct 3 has requested no action. Page 31, 237, purchasing has requested no action. Page 46, item 385, there's a correction, add, and for the county clerk to execute any applicable bonds to be received after flood control district. Page 51, item 424, ACD has requested no action. Page 51, 428, Constable Precinct 1 requests no action. Page 53, item 441, purchasing has requested no action. Page 55, item 453, add in the additional amount of $42,500 after Firetron Incorporated and remove or until a new contract is in place with no increase in pricing. Page 56, item 462, county judges requested no action.
Jay, how about, I have also 127, no action?
I don't have that, but let me take a look here.
What is that? 127?
That is from the, that's a sheriff's item. Did you get a request that no action on 127 from the
I
sheriff's
believe
office?
we got an email from the sheriff's office.
Okay. So no action on item 127.
Okay, is that it?
On corrections and no action, that's all I have.
Okay, is there a motion for, did you get that other speaker? I want to make sure.
Not yet.
Not yet. Okay, so there's a motion for the consent.
Can I,
What-
sorry,
what-
can I add one?
Sure.
Can I add 182 to discussion?
Add 180 to
182.
discussion. Audit claims. Okay, sure. Yes, sir.
And Commissioner Ellis, can we go, should we go through the executive sessions, make sure which ones before we do the consent? Okay,
I'm hoping we don't have to go back on any of them, but then again,
okay.
who wants to go out and enjoy this day?
All right, these are the executive session items. Page 48, 401, this is a request by the county administrator for discussion on the reappointment of Chara Bowie to a nominee for the commissioner of Precinct 2 to the Harris County Area Agency on Aging.
No.
Why don't I do it this way? Are there any executive session items that a member of Commissioner's Court wants to go back on?
I think there's one that we have to, there's
Which
two.
one is that?
Two folks nominated. What's the number?
403?
So 404, we do need to go back from the county administrator.
Okay.
Item 405, which is from Universal Services, that should be on the discussion list, not an executive session item. So we need to place,
On discussion.
yes, item 405 should be on discussion.
And Jay, when you get a chance, I may have a question here.
I'd like to discuss 407, please.
407 in executive session. Jay, you just make sure you work up the motion for me so I don't forget when we get to it. So that's I think I heard
403.
403. Yeah, 403, 404, is that right? And
I think you want
411.
405,
411, Daniel?
411.
Yes, please.
Okay. Colleagues, is that it? You want to look at them again? Okay. You're right. Jay, you
Yeah,
have
could
them?
you please read the executive session ones?
Can you go back?
The ones that we'll go back on.
Do we need to go back on 408,
God bless you.
Chief Medical Examiner?
I don't think so.
No.
I'm good with it.
Okay.
Good choice.
So all I have right now is 403, 404, 407, and 411. Is that correct?
Colleagues,
403, 407, 403, 404, 407, and 411?
That's correct.
we're comfortable? I don't want to rush you all.
Yep.
I think we do need,
We need a motion on 456 for it. We need a name. Commissioner Garcia?
I move.
Oh, yeah.
Made by Commissioner Garcia, I second it. All those in favor, vote aye. Okay, it's passed. 4 ayes, no nays. Okay, anything else?
That's the feeling.
The only thing on that one is effective July 15.
So this is on 456?
456, correct.
Okay, so it's.
Say the name, though.
Motion is to approve effective
For July 15
July 15th, and the name,
is Philemon Bella.
Philemon Vela.
You know how to spell it? You have it?
yes, we can look at the backup.
Very
Yeah.
supportive.
Yeah.
Great choice.
Are we good, colleagues?
County
Good.
Administrator 408. There is the title issue in terms of carrying both titles. Is there carrying one title or two titles?
Yes, so the court has to approve chief medical examiner, but as county administrator, I could appoint executive director without a court vote.
Okay.
Do we need to call it acting or is this permanent? I
This is
heard-
interim.
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 Okay.
Thank
That's
you.
what you were getting at, Commissioner?
That's fine. She
Yeah.
just answered.
Yeah. Okay. Colleagues, I don't want to rush this. We okay? And did we get that speaker on the line?
Yes, sir. We have the speaker.
Okay, so before we do consent.
Randy.
on these items, let's speak. Yes.
Randy Trevino, you have 1 minute.
Thank you. My name is Randy Trevino, and I'm founder and director of the Raíces Collaborative, an organization based out of Southeast Houston, home to many immigrants, both documented and undocumented. I'm speaking today in support of item 281 for the establishment of an immigrant and refugee commission. I think that this commission is incredibly important because there's a lot of misinformation that's being spread right now amidst a lot of, tough ICE enforcement, the toughest enforcement that throughout the country, even though we don't see it as much on the news, is happening here in Houston. And it is very important that the community receives both factual information, accurate information, and that the decisions made by the county are based off of these realities. For example, I want to point out the fact that this city wouldn't be what it is if it wasn't for its immigrants. It wouldn't be the most diverse city in the country if it wasn't for its immigrants. And it also wouldn't be, as thriving and.
Thank you. Your time is up.
Thank you. Thank you very
you.
much. And we catch your drift. Thank you. Okay, Commissioner Garcia, was somebody going to say something?
And
One item, just to, I think it's just clarification.
Okay.
On item 291, it just needed to add the words ratification of, requested for approval of, ratification of renewal.
Okay, we're good on that?
Thanks,
And
Commissioner.
then, I'm sorry, just want to make sure, item 406 and 408, I know those are appointments, they will be approved as presented.
Yes, that's
Yes.
presented.
6 and 48, yes, ma'am.
Just with the title change, acting or interim, right?
And then just to confirm, 456 was Garcia Ellis, 40.
Yes.
Thanks.
Yes. Mhm. And Commissioner Ellis, I had two things, please. First, may I please add number 3 to the discussion list?
Number 3.
Yes.
discussion.
And then since item 334 is on consent, going back, Councilmember Knox, if I may share, because this is, my heart is with you and your family. So this is really powerful, and I hope that you will join us. For those of you who may not know the context, Councilmember Knox's son gave the ultimate sacrifice May 2nd, 2020. HPD officer Jason Knox, he gave his life in service of our community, and he had a dream to preserve the history of the Houston Police Department by acquiring, maintaining, exhibiting, and preserving historical examples of police patrol vehicles and equipment. And so today, his father, Honorable Mike Knox, his wife Kira, honors his legacy and his ultimate sacrifice by continuing this dream through this nonprofit, Vintage HPD. And so on June 6th, 2026, we invite you to John Paul Landing, which is a spectacular park here in Harris County in Precinct 4, to support Officer Knox's legacy. It's a 5K. Check-in begins at 7 and the race begins at 8. I will be recovering from knee surgery, so I will not be there, but I will be there in spirit, I promise, and maybe next year I'll be strong enough to run. But my heart and prayers are with you, and I know your son is looking down from heaven with pride and gratitude. So thank you very much.
Thank you very much, Commissioner, and send us a note. Now, I may be the last one to come in, but I'm gonna try. No bike riding on that one. It'll be a slow walk, but I'll try. And we're so sorry for your loss, but thank you and good to see you. Okay. Anything else, colleagues? There's a motion by Commissioner Garcia for the consent agenda. Is there-
Real quick.
You want to go through the discussion list, Commissioner, or are we just going to keep it as is?
I'm gonna leave it as is.
Okay.
Well, can
Minute 3.
we kind of verify that, because I know some of them were already voted on?
Okay, you can run through it.
Sure. What I have right now is item 1, item 2, item 3, item 99, item 105. Okay. Hold on one second here.
Jay, do you want me to go through the list?
Why don't you go through it?
Yes.
That'll probably be
Okay, what
faster
I
and more
have
efficient.
is 1, 2, 3, 6, 11, 86, 99, 105, 107, 126, 135, 136, 181, 182, 195, 212, 235, 281, 282, 309, 353, 405, 409, 410, 416, 435, 455, and 458.
Everybody's okay with that? And can you just tell somebody to print a copy or we'll pass it out up here? You're quicker than I am. My staff will print me one.
Okay, and then also, I did have a question. How about item number 7?
And that is a request for discussion, possible action, monthly update, outstanding balance.
No action.
No action.
Thank you.
We good, everybody?
Yeah, and I'll read the resolution here in a minute.
Okay, we'll do it after this. As a motion by Commissioner Garcia, I'll second it for the consent agenda. All those in favor, vote aye.
Aye.
4 ayes and no nays. The consent agenda passes. Commissioner Ramsey, that was a request. Yeah.
Also
So
459.
459. This is Commissioner Ramsey's resolution. Commissioner Ramsey, I know we passed a rule saying we would not read resolutions, so you would need to suspend the rules. I know I told you we'd bring it up. I just suggest it'd probably be a good idea to just bring that up on the day when the judge is here, by the way, if you'd like, just making a suggestion.
Well, just from the timing of it all, I think reading it here, and we can certainly talk about it again when she returns. her having missed the last 3 meetings, I'm not sure when she's coming.
Yeah, but to read it, if we pass that rule, I'm not saying I keep up with all of them.
No, I appreciate the
I'm not saying
suspension
I
of the
remember
rules
it
just to
all.
read the resolution.
Yeah.
Right.
Okay, all right. Thank you. So we'll go on to the next.
No, I want to read it.
So you need to make a motion to suspend.
Let me make a motion to suspend the rules so I can read a resolution.
Is there a second? Okay. Motion dies for lack of a second.
I guess I won't be reading the resolution. Y'all get with me and I'll tell you what that resolution says.
Okay, all right. Okay, so let's go to the consent agenda.
We're all on the same page though. So at business court, we can read, discuss, have guests, and the next business court, so everyone who wants to.
And I'm assuming at the business court, the way that rule works.
Commissioner, you have your microphone.
Sorry, maybe this is the, I don't know, what in me type A person, I guess. But just so we're all on the same page, at business court, we can have resolutions, we can read them, we can have guests. And so we know this will be happening on what day? County Attorney Fonbon, can you tell everyone when the next business court meeting is?
Let me check.
Yeah, and the reason I would ask, and I was
Next Thursday.
fully supportive.
This Thursday?
Next
Thursday.
I was fully supportive of us not reading resolutions at court, at general. And we moved that to business court, full recognition. But the reason I would even ask is the extraordinary Houston rodeo that we've just experienced. We've got 2 more days of it. If you hadn't been, you need to go. That's a personal plug to go to the rodeo. And they've done extraordinary things for the board to have to take the time that they did to deal with the inappropriate activities of Lena Hidalgo at the rodeo. That was the reason why I was asking. So there'll be a resolution. We'll look at that resolution at a business court going forward. But that is the reasons why, and I think I was clear in terms of communicating that with a lot of the press earlier. So thank you for considering it.
And colleague, I would say you and I are the ones who do the least resolutions. So I don't know if that was my rule or your rule when we did it, but I know the judge's office asked me to do one for Dr. Sanchez. And so my response, her office did, my response was, I'm not going to suspend the rules to read it. That was my way of getting out of it. But so that will come up when we have the next business court.
Yeah.
So
Commissioner?
this will be a no action for 459?
Yeah, or just be delayed if you want.
Yeah. Commissioner, the next business court was actually moved to March 31st, so it's the Tuesday. So I'll let you know.
Okay.
Tuesday, March 31st.
Yeah.
Tuesday, March 31st. And I'm assuming, by the way, just so I understand the rules, we would vote on the business agenda first.
Correct.
And then go to the resolution.
Correct.
Okay. Because I want you all to have all of the time that you need on them. But
And to be clear
I may
for
not be
the
here with-
public, again, just to be clear for the public, that during business court, these resolutions can be read, speakers can sign up, the pictures, all the things, correct? Jay?
Yes, correct. That is correct, Commissioner.
read the resolutions, do the speaking, then do the pictures. Okay. I'm looking forward to it. It's wonderful. Okay. Next item we'll go to is new county administrator. Congratulations on your first day. We're so glad to have you here. And
Thank you.
that's item 1. Commissioner Ramsey, you pulled it. Discussion on countywide operations and fiscal impacts of Senate Bill 9. Hit your mic, sir.
Obviously, Senate Bill 9, that particular bill has done, I think, many excellent things. When you look at the bill in general and the specifics of key provisions, restricted bail, public safety reports, prosecutorial appeal, focus on dangerous offenders. So there are certain impacts and costs associated with that. 2 new positions, technical staff, compliance staff attorney, to support the increased workload of the district courts. And again, I applaud the district court judges that are and have been coming in on weekends and week holidays to comply with Senate Bill 9. So I simply make the motion to approve as written, item number 1.
I think, Commissioner Briones, that you have something you want to add to it as well. Am I right or wrong?
I do have some motions. I think everyone has received a copy,
Yes.
but I would, OMB or OCA, our county administrator, Carter, would you like to make any comments with regard to this? Before I read some
Thank you,
language?
Commissioner. I think Director Mills is going to do 2 short slides, just to make sure everyone has the same information.
Absolutely.
Thank you.
Absolutely. Tiffany, if you could pull the slide deck, please. Next slide. So, Commissioner, as you noted, SB 9 was a big change, and it did require weekend and holiday operations, which hadn't occurred previously within the district courts. It also had some downstream implications. And one of the things that this Commissioner's Court did very, very swiftly, actually, was to put together or allocate some funding to allow departments to expend overtime to cover weekend and holiday shifts. That has been effective. The justice stakeholders have pulled together very quickly, put the operations together very quickly, and continue to function in a way that I think has been cost conscientious. Most of the operations can continue to be funded with overtime. District Courts has seen a need for some technical staff and compliance staff attorney. Important to note on this is that those can be added for the remainder of the fiscal year within the money that was allocated already with the $1 million. The annualized cost in FY27 would be 1.18, and that's the overtime for all of the departments and the 2 PCNs for district courts. And I'm going to do it in one slide unless y'all have questions.
Any questions, colleagues?
No,
Good job.
I know we've talked, so I'm fine. May I read the motion language? So motion to direct the Office of Management and Budget and the Office of County Administration to work with SB 9 impacted departments to evaluate and distribute centrally held funds for inclusion in the FY 2027 CLSS process, including recommendations on whether such funding should be one-time or incorporated into departments' ongoing baseline budgets. God bless you to whoever is sneezing. Second, motion to direct the District Courts Administration in coordination with Human Resources and Talent, OMB, and OCA to assess SB 9 related operational needs and return to Commissioners Court by April 16th with recommendations, including any request for the creation of up to 2 new PCNs.
I'll second. Is there any other discussion? All those in favor, say aye.
Aye.
All opposed, vote no. 4 ayes, no nays. It passes. Next item will be item 2. This is a request. Commissioner Garcia and Ramsey, you pulled it. Discussion and demonstration of the redesigned Harris County Jail Population Dashboard, along with the quarterly standing jail update discussion.
If I may begin, thank you for the team for improving how we track and share the data information, Tanya. The redesigned dashboard is clear and more useful. It helps turn data into insights for both the court and the public. This tool gives us a better understanding of population trends, length of stay, and key drivers. The focus should be using this data to improve outcomes, reduce unnecessary jail stays, and support public safety. So I appreciate all the work that was done towards the demonstration of this project and all the input that everybody gave. And just to reiterate that I'm very grateful to our district attorney for the recent announcement, the work being done to reduce the population. I think, what do? We got it from 150 about to 120.
The average length of stay?
Yeah.
From 188 down below 160, which
160.
It's
So,
156.
Yeah, so we've trimmed it up by 30 days. Those 30 days, in my day, Tanya, I don't know if you know this number, but in my day, a healthy inmate would cost the county an average of about $80 a day. Do you know what the cost is today?
105?
105 for a healthy inmate. Inmates on psychotropic medications back then were in the range of about 200 to 300. Today, I think it's closer to 400.
Yes, sir.
I would add the math that, because regardless of the population, 30% of the inmates are on psychotropic medication. So assuming that 30% of the 30 days is impacts those that have psychotropic medications, the savings is incredible just for 30 days. And so I don't want people to look at this and say, oh, what's the big, hoopla over 30 days. It's a number. It's a big number. And so I am just grateful. However, all that being said, I do hope we can get to the historical 30 days being the average stay of jail, because that'll be a much better day. And we can cancel all these contracts. We can help people be comfortable that LaSalle is no longer a vendor of ours for these needs. And so I just appreciate all the work being done. So thank you, Ms. Mills.
Director, did you want to show a slide or anything? I've seen it, but did you want to pop it
Yeah,
up?
she-
Okay.
If possible, she
Don't
would
have
like to
to.
demo a little
No,
bit. Did
really
you want to
don't have
speak? Okay.
Okay.
While she's pulling that up, I know it's been a long time coming. There's been a great team working on it, especially the Criminal Justice Coordinating Council's System Process Improvement Committee, which has been a driving force in our justice stakeholders. I also want to thank, on the Office of County Administration, of course, Director Tanya Mills, AJ Roy, who leads the data team, and the entire Justice Innovation team, who've integrated jail and court data, which makes this truly groundbreaking, and it's accessible and actionable. And also, just last week, they were presenting this at a Justice Challenge, and Los Angeles County and Cook County were already trying to steal these ideas. They consider this a best practice. They're very excited. This will go live March 31st, 2026, March 31st, and Director Mills is ready to demo.
Thank you. I want to give a personal thanks to the data team who took something that was a vision and made it a reality, and really in record time. And I have to give a shout out to the Sheriff's Office who partnered with us throughout and really helped make this a better product as we went along. So we're going to dig into the data. I know we're pressed for time. I'm not going to spend a whole lot of time on the first page, but one of the things y'all will notice is many of these data cards across the top are things that I talk about in the jail updates all the time. Now it's accessible to you. At any point you want to see it, or come the 31st, it will be accessible to you anytime you want to see it. You guys know I focus a lot on stays over a year. So here we can look at the stays over a year and see that the average length of stay went from 156 to 750 for the 889 inmates in custody who are in custody over a year. One of the ways that this differs from the dashboard that exists today is when you go to the jail population dashboard today, it's a long scroll and you've got to go all the way to the bottom of the page to see things. Here we've designed this so that you have a sidebar. So you can go from the demographics page to charges. Here you're going to be able to interact with the data where you can see, again, I'm going to look, let's focus on anything over 120 days, and then I'm going to select drug charges. This is how we then get to some really actionable data. The district attorney's office has worked with us in looking at this too. In the center, you can see the distribution of the charges changed, and we're able to see the top 15 drug charges that are in custody over 120 days. That gives us an actionable way to look at some cases that we might be able to expedite and get out of jail. We can also, y'all see how the interaction works here. The trends page is where the magic happens, at least for me. I watch this all the time. Here we're seeing the average daily jail population. This is a year over year. You can see how we compare to last year in the upper right with the average daily jail population. Commissioner Garcia, to your point, to the right is the average length of stay. And in this case, it's terribly evident that the average length of stay coming down has pulled our ADP down and has helped it stabilize. Late last fall, we talked about with the impacts of SB 9, projection models that could have us looking really bad or where we would stay stable. And what we asked is that the justice stakeholders work to keep the average length of stay of the in-custody population below 160 days. That would help keep us stable, and they are doing that for us. You can see bookings and releases. These are on a monthly average, but you could also interact on the last 30 days by clicking this button, and it'll show you the last 30 days of the jail population, the same with the bookings. Commissioner Garcia, you'll note that the number of days we spent with intakes over 300, that's taxing on the JPC. So this being a jail update, we're keeping a close eye on that with the jail and watching when the intakes get that high, we get a little concerned. One of the other data points that we watch very, very closely on this page is this released in less than 3 days. When I first started, I did analysis from 2019 through mid-2024 and then monitored it. Pre-SB 9, we consistently released about 61% of our population in less than 3 days. Post-SB 9, that percentage has gone down, and that impacts how quickly folks release. And we're seeing more folks stay in custody for a little bit longer, and then some ultimately detained. And then the last page that I'll show you is pretrial. Commissioner Garcia, you asked me many, many months ago to show you courts by average length of stay. This page will allow you to select the court with, let's look at the district court, who has the best overall average length of stay. Let's go back to looking at a year. We can see the courts that are over a year and then drill in by controlling and clicking. I can say what's the total average length of stay for that court. It goes up to 913 days for those 62 cases that are over a year in that court. That's most of the demonstration, unless y'all would like me to click on some other things. The population is pretty stable right now. The average length of stay is being managed. Our court partners are working very, very diligently at helping us keep the time to disposition down. And this product will be live March 31st. AJ Roy promised me this morning it would also have a mobile-ready version, and when AJ says he's going to do something, he'll do it. So you'll have access to this from your phones if you're in a meeting and want to answer questions for folks.
Thank you. Commissioner Briones and then Commissioner Ramsey.
Yes. Thank you, Director Mills. This dashboard is going to be hugely helpful for transparency and accountability and just making sure we're tracking our performance and progress. And so I was glad to see that we did at last pass the most recent Texas Commission on Jail Standards inspection. So again, while we have a lot of work to do, that was a step in the right direction. Can you or Chief Bosques please talk us through when we might expect another jail inspection, and then what that will mean in terms of getting more beds online? And then obviously the goal is to reduce all outsourcing, but essentially we're forced to outsource unless and until certain conditions happen. So can you walk us through?
Yes, ma'am. Tiffany, could you pull up the slide deck from? Thank you.
Yes, I'll get it up.
Okay, thank
Director
you.
Mills, you want me to answer the jail commission questions?
Please, thank you.
Good afternoon, court. Thank you for your time.
Good afternoon,
So,
Chief Bosques.
Commissioner Briones, specific to your question, I would like to say thank you to the court for all y'all support, and we did pass our most recent inspection, which was on March the 11th. And so the jail is in compliance with Texas minimum jail standards. And so that starts the process where we remain on enhanced enforcement. So the simplest way is, we still send documentation and different things like that at the request of the state. So we can expect an on-site comprehensive inspection, which usually is about a week long, where the jail commission comes in, they go through all our systems, paperwork, the facilities, they look at staffing, just anything and everything. And so we need to pass 2 of those type of inspections to then be able to go back and request for the remedial order to be lifted. And the remedial order is what takes the beds that we've talked about offline for use, the 580 variance bunks. So it was a great step. I mean, fantastic work by all the officers and professional staff here in the jail that got that done. So it's usually about a 6-month cycle when you're on enhanced enforcement. So we're very hopeful that the commission will come within the next 6 months so we can check off our first of 2 that are required to get us back to where we can go and request a remedial order to be lifted, thus gaining those 580 variance bunks back.
And then the 2 of 2 would be in the next 6 months?
No, they can do it 1 every 6 months if it meets with their inspection schedule.
Okay. So we passed 1, we still need 2 more comprehensive ones, is what I'm hearing?
Yes, ma'am. No, the one that we passed did not count for the 2 comprehensive on-site.
Okay. Thank you, Chief Puskas. I appreciate you
Yes,
and
ma'am.
Sheriff Gonzalez and your team. And thank you, Director Mills.
Commissioner Ramsey.
Yeah, I think I'll have more detailed conversation on Commissioner Briones' 309 item, kind of associated with the jail, more specifics related to the 7th floor. But just wanted to confirm that 500 and something beds that was tied up because of our non-compliance with the jail standards, that's some number. There's another number that's offline due to construction, due to reconstruction. So I think it's worth tracking that as well.
Yes, sir.
So whether that ends up on the dashboard or not, it's such an important number for our outsourcing. There's one thing you can say in terms of, I mean, the details related to the folks that are in there and their length of stay in those details, but what we fight every day are beds.
Mm-hmm.
And the number of beds that, and even today, I think the number of beds that are there, we're not able to staff. So that's another consideration, that's another number. Whether that needs to be tracked on the dashboard or some other internal way to look at that, I think unless we are tracking it, we're not going to be managing it, I don't think.
Agreed. I think that we could probably work that into the dashboard. Commissioner Briones, did you want to walk through the numbers to get to the outsource reduction?
We can do it at our next update. And I
Okay.
know we'll talk more about it in the other item that we have, the jail maintenance projects
Okay.
and then the safety bond. But yes, thank you for the regular updates, and I love the transparency and accountability. And I agree, if we're not tracking and measuring, we just need to stay laser focused. So I appreciate the dashboard. Thank you, Chief Puskas, as well.
Thank you.
Thank you, and Director and County Manager and Chief Vasquez. Look, I suggest when you go live, maybe do a press availability or something. I'm going to ask my team to promote it, maybe have you all on there talking about it on social media. It is a lot better. It's much more improved. I like that you show veteran status and bond amounts by court. But we have so many dashboards. It's good with being transparent, but just do something, even if it's putting it on social media, so people will go try it out. Okay, thank you. So no action on that item. That was next item is item 3. Commissioner Briones, you pull this one. Request for discussion and possible action on a prompt pay project, part of procured pay.
Yes, thank you. I would please like a brief update on the progress that's been made. So County Administrator Carter, please.
Sure. Thank you. Thank you to the court for your patience. I know you've been waiting on this a while, and the team has been working. This is update first is that there is a go live on the final part related to interest payments to our vendors. It is a go forward, so it won't look back, but it will go forward from invoices starting March 27th. The project team, led by Rachel O'Connell at County Administration, has worked with the Auditor's Office, Mike Post, Auditor Post, and Director Sindhu Menon and her team to do testing, and worked with all of our departments across the county. The other thing I want to highlight is that they've been training, so about our departments to ensure they understand the process for invoices and the AIP. We'll do a push. We are less than 50% trained for those purchasing and finance managers that deal with invoices. So OCA will work and reach out to other comms to make sure we encourage those liaisons to get trained. Our goal is 80% by the end of April. So we aren't behind, but we want to keep going. The auditor's office will closely monitor interest payments post the go-live moment to ensure the accuracy of the calculation before anything is paid. And the testing has gone really well, 100% pass rate thus far, and we have a meeting tomorrow for a final review.
Thank you so much, Administrator Carter. That's great. And just to level set big picture for those who have been tracking, we're making progress. So when we started Procure to Pay, there was over 2,000 county invoices that surpassed the 31-day mark to pay. Now we have that number from 2,000 less than 230. And so we're making progress. All vendors, but especially our small businesses, they need to get paid so they can pay their workers and continue growing their businesses. So this is super important work. Thank you, Administrator Carter, for carrying the torch so that we can get it down exactly. So thanks.
I want to brag on my team and point out that 98% from Precinct 1. All I did tell them what I remember from statistics is, does that mean we had fewer people to pay, or we did a better job of processing them? I haven't gotten my answer on that from month to month yet, but good job. Thank you all for the work you're doing. Next item is item,
Commissioner, is that a no action
I think so.
for number
No
three?
action. We didn't need action.
Thank
Yeah, I'm sorry. Next one is item 6, Commissioner Ramsey. This is a request for approval of a position and associated budget. Okay, motion made by Commissioner Garcia. I'll second. All those in favor vote aye. Aye. All those no.
No.
3 ayes, 1 nay. Commissioner Ramsey votes no. The item passes. Next is item 11. Commissioner Ramsey, you pull that one?
Yeah, I was looking at the organizations that we're a part of, and as far as I can tell, this is the first year we've been a member of the Government Alliance on Race and Equality, otherwise known as GAR. It's 17,500, and I was looking to, we need to separate those. I'm not supportive of that. I am in support of the rest of them.
Okay, I'll second your motion, move all of them, Commissioner Ramsey, other than GAR. And is that all right? You make the motion?
I'll make a
And I'll
motion.
second. All those in favor vote aye.
Aye.
All opposed vote no. 4-0, it passes. And now I'll move GAR. And Commissioner Ramsey, Commissioner Garcia seconds it. All those in favor vote aye. All opposed no, vote no.
No.
3 ayes, 1 no. Commissioner Ramsey votes no. Next item is item 86, flood control. Commissioner Garcia, City of League City.
Thank you. I just want to thank Dr. Peterson and her team. Today, we're approving an interlocal agreement between Harris County Flood Control and the City of League City to participate in a regional flood risk management feasibility study for the lower Clear Creek and Dickinson Bayou watersheds. This effort builds on a 2019 partnership study conducted by my office, which helped to secure authorization for a federal planning study in 2022. Through the efforts of our federal delegation, including Representatives Weber, Babin, and Garcia, and others, this new study will evaluate opportunities to reduce flood risk across the lower Clear Creek and Dickinson Bayou watersheds in partnership with the U.S. Army Corps of Engineers, and will identify potential projects that could secure federal investment for flood risk reduction. The Flood Control District will contribute up to $1.25 million towards this effort, which is expected to cost about $6 million overall. But by participating, Harris County ensures it has a seat at the table as flood mitigation strategies are developed that could impact communities in Clear Lake, Galveston County, and surrounding watersheds. Most importantly, this reflects how we approach flood risk through partnerships. Flooding does not stop at city or county lines, and every day the Flood Control District works with cities, counties, state leaders, and federal partners to find solutions that work across the entire watershed. This agreement continues that approach by bringing partners together, each contributing their expertise and resources to better protect our communities. So just want to highlight the collaboration and demonstrate that when we all come to the table, we can get some good stuff done. And I just want to commend both IGA, because they were necessary as a part of the process, but Dr. Peterson thank you and your team, and I'm very excited to see this item move forward. So move on this item as presented.
Second, congratulations, Commissioner.
Thank you. Actually, I'm running the meeting. All in favor?
Aye.
All opposed? All right, motion carries. Here you go. Here you go.
Next item is,
So this will be 4-0?
yes, ma'am. Item 99, Commissioner Ramsey, you pull that one.
Yeah, again, we continue to try to figure out the job site safety inspection. We've used terms like monitor, we use terms like inspector, we use terms like analyst. I can see there's a certain amount of paperwork that DEO needs to do, and I certainly understand that and support that. But when we send somebody to the job site, they should be fully capable of being able to inspect quality, quantity, and safety. It's a 3 deal. To have one person go out and monitor while others are on the site inspecting, I think creates confusion. I think you could probably miss some safety elements if the inspectors think they're not responsible for the safety side of it, that somebody else is out monitoring while they're out inspecting. So it may be down in the weeds a bit, but we're being asked to approve 8 positions. Apparently, only 4 are being recommended by OMB. So that's what we're saying. We're talking about 4. And of those 4, how many of those are analysts and how many of those are quote-unquote monitors?
And this is a OCA OMB recommendation, so we're both recommending 4, but one is a program analyst. There are 3 program monitors, and then there is some non-labor software to make sure all the safety record data is for infrastructure and the county are in one database. OMB, do you want further comment?
Nothing to add.
So again, I struggle with the concept of a monitor when the county engineer's office does need inspectors on the job site. And I don't know if we're trying to save money by sending a monitor out there to ask a couple of wage questions in the field or check some box on the safety side. I think we're putting at risk the job site, because if the inspectors think that the monitor is supposed to take care of safety and they're not, then I think they can create confusion. I simply think if you're going to go on the job site, you need to be trained and it need to be fully capable of handling all 3, quality, quantity, and safety. And I have no idea what a monitor is going to do on a construction site.
So I would say that we ought to watch it and see how it works, but, you know, it's a new policy that we have, and I want to follow the Office of County Administrator on this one to see how it works, but you all watch it, you raise some valid concerns. So, but I would move to create 4 positions for DEEO to support the worksite safety programs in alignment with the fiscal review request form recommendation.
Sure.
Yes, sir.
I too, Commissioner Ramsey, share your concerns. Director, you want to come up? I'd like to run a few things by you. First of all, thank you for your work. And to the same point of Commissioner Ramsey, I mean, we had a whole big, long conversation about worksite safety and inspections and, creating the capacity to do the inspections. So if you could walk me through the requests, because I remember we had the 8 positions originally proposed, and to see it pulled back to 4, I just want to make sure that we're doing what we are saying we're going to do as a court. We do see safety, worksite safety as a priority. Every day that we don't have inspections done could mean somebody's life at risk. So with that, I mean, I'll make a motion for 8 positions, but I'd like to hear from you.
Sure. Thank you for commissioners for the opportunity to speak today. In looking at the implementation plan, it was noted that the actual policy would not go into effect until July 1. So that eliminated the need for as many positions up front. The 3 monitors that we're asking for will have safety backgrounds in order to be able to be on the job site and make those recommendations. The additional funds will be so that we can upskill our current workforce. We have approximately 40 monitors already that do various things, whether it's prevailing wages or vendor diversity checks. So we have that. And so in looking at the budget and attempting to be responsible with the funds, we concur that we are okay with starting, and any additional positions we will ask for in the next budget year.
Good deal. With that in mind, will you have enough runway to train up inspectors when we do approve them for you? I mean, if the policy goes into effect in July, I don't want to be approving positions in July. So
Sure.
when should we see the next item come back for the additional positions?
We'll consider it for the budget as we're in the budget cycle. Again, the plan is ongoing. A couple of things that have happened since last meeting. We are meeting with the infrastructure team as well as the worksite safety. So it is a collaboration effort, and we're hoping to flesh out any of those discrepancies or who is accountable for what portion of it during that implementation time. And so, again, I feel very confident that with the approval of the funds to upskill our current workforce, in addition to bringing on staff that have safety in their portfolio, we feel like we can start. And again, we'll monitor closely. But July 1 is when the policy goes into effect. So ideally, I would not expect that we would have much to investigate, at least for the first 30, 60 days.
Good deal. Currently, if there are worksite injuries taking place, where does that get reported? Does that come to your office?
It does. In fact, we're investigating some inquiries right now. And so there is a policy, or not a policy, but our procedures are that we do investigations, we do the interviews. Sometimes there's some reconciliation. We have to get W-2s from the workers. We have to get certified payroll to flesh all of that out. And so that process is a bit lengthy. So moving forward, we are going to try to find a way to streamline that process, because for now, that's where I see the bottleneck is in the time that it takes to do the investigation, because most of that work is still paper and still manual effort.
Good deal. If you will, if I need to make it as a motion, I will, but as direction to provide us with a monthly report, if that's not too cumbersome, of any worksite injuries that are occurring.
Yes, sir, we can do that.
Wonderful. Thank you.
Thank you.
Commissioner Briones, I see you on the list. Is that right? Or is that old?
So yes, Administrator Carter, could you please walk us through kind of the rationale for your recommendation? And then my next question is about the collaboration between DEO, engineering, flood control, and HECTRA, and how we're going to make sure we're maximizing the training and the synergies and the quality of the implementation of the worksite policy.
Sure. As Director Hausman mentioned, the July 1st start, it actually primarily focuses on new contracts because it'll be part of new contracts that are signed instead of reopening. Not that we won't care about and look at safety, especially from our infrastructure departments, but the accountability will be part of new contracts, so it wouldn't be 100% of our current projects. But also DEO, they are primarily gathering the data and also dealing with reports from workers. That's when they go out and do extra visits and do extra reviews and collect paperwork, as you mentioned, streamline, follow up with infrastructure, and do part of the investigation. And then the Worksite Safety Committee is still updating a few provisions. DEO continues to lead that. That will come back to this court. And they are responsible for ensuring we're meeting the needs of the Worksite Safety Committee as well. So that's what it went into this recommendation.
Okay. Thank you. So then just to confirm, y'all on the same page about the recommendation for today's purposes?
Yes.
Okay, thank you.
Thank you.
Commissioner Ramsey?
One last question, County Administrator. Just please, someone look at the resumes of the people that are going to the job sites and quote-unquote monitoring. And please look at the resumes of the people that are going to the job sites and doing investigations. I think it should be someone experienced in means and method of construction and shouldn't be someone that's read a book. So it should be that kind of experience. If it is, if that's who is out there investigating, if that's who's out there reviewing safety conditions in the field, then that's fine. But somebody needs to look at those resumes and affirm that they have the experience and understanding of what goes on the construction site. Thank you.
So as I understand it, there's a difference between monitors and inspectors. Yep. Inspectors stay on the job site on a continuous basis. So I agree with all the comments that were made. I hope you pay it enough, but I'm prepared to go with the recommendation you all have at this point. It's a new policy. We want to make sure it works. If at some point you find you need to come back and change it, I want to encourage you to bring it back. Don't be reluctant to bring it back. So with that, I'll make that motion to create 4 positions of DEEO to support the worksite safety programs in alignment with the fiscal review request form recommendations.
Second.
Second by Commissioner Briones. All those in favor vote aye.
Aye.
All those opposed vote no.
No.
3 ayes and 1 nay. The item passes. Thank you.
Thank you.
And the next item, Commissioner Ramsey. Okay, the next one is 105, and you pull that one. Artificial Intelligence AI Program.
Yes, Director Sindhu. One, as you walk up, let me acknowledge and recognize the good work you're doing here. This is so important, essentially getting everyone on the same page related to artificial intelligence. And my question is simple. We don't have to go into a lengthy detail. It looks like that we're approving commercial paper funding in 105 of $845,000.
That's the initial, and then they can go up to that 1.5 number.
And I just have a problem going into debt on salaries. Now, I know there's a nuance there in terms of you've got someone working on a capital project, and so you include their salary in working on that capital project. I understand that. But when we start borrowing money to pay salaries, I just struggle with that from a long term. If you're working on a road, that's a 40-year item. If you're working on a computer, that may be a 4-day item. I mean, these computers, they turn over fairly quickly. So again, my only question had to do with the $845,000. Is any part of that being used to pay salaries?
Good afternoon, Commissioners. Thank you for the opportunity to speak today on this item. Sindhu Menon, Executive Director, Universal Services. Commissioner, thank you for the question there. The way we are looking at it is these are small scope of works that would be completed and the resource would then be rolled off. That is the way, I mean, it's industry standard on projects when it comes to information technology. So you have the capital resources working on that and then they hand it over to the operational team to maintain it. So we're not expecting, once the scope of work is done, we don't expect this to be a long-term relationship. These are small scopes of work that would be completed and move on.
Okay, thank you.
Okay.
Sure.
Commissioner Garcia.
Director, thank you so very much. It was great to see you at last night's event. I've been very, very impatient for artificial intelligence, for permitting. Give me some timeline, some milestones. When are we going to get there?
Commissioner, thank you for the question. We have embarked on the journey. There are 2 steps to that particular project, and I'll start with the easy step, and I have our lead on that particular initiative with me here. Ray, you want to address the question, or would you like me to address? I'll kick it off, Commissioner, and I'll hand it over to Ray. So basically, it's a 2-step process. The first step is for us to make sure that this proof of concept will work. We have the data, and the data can work for a long-term solution. So that's the state on which we are. And we have made considerable progress in that particular stage. We have the scopes. We have worked very closely with the engineering department to understand what would they like to see in this proof of concept. And we've been working hand in glove. Ray's team has been working hand in glove with the engineering team to make sure we are progressing in the right path. With that, for further details, I'll hand it over to Ray.
Good deal. Thank you.
Hi, thank you, Commissioners Court, for having me this afternoon. The first phase of our proof of concept is actually scheduled to be delivered by the end of this month. And then from that proof of concept phase, we can outline very particular details in terms of the scope for what is required. And I'll just try to take a little bit of time to say that any conversation of AI is also a conversation of data governance and safety. So we're taking all of that into account in this proof of concept.
Good deal. And so from what I understand, there's Lingua Link,
Yes.
there's Cora, and there's Permit IQ
Yes.
as it relates to that particular initiative. So the current status of Permit IQ AI is what?
The current status is the initial proof of concept phase. And then from the proof of concept phase, once we have delivery, we will work with engineering on whether or not we sign off to initiate a go live, or we can proceed with a very thorough statement of work.
Very good. And so what would be the next steps to help move things a lot faster?
Well, we've had very good collaboration between Universal Services and engineering. The very next steps is the evaluation phase of the proof of concept. Once we make delivery of the proof of concept, we will work with engineering to get feedback, and then we will make a determination in collaboration with engineering on whether or not how we proceed for building and developing a custom solution or proceeding with a statement of work for a different solution.
Okay. And then what do you anticipate to be the projected costs, including the software, staffing, any ongoing maintenance?
So beyond the labor costs, an internal AI solution for ePermit, we estimate services to be somewhere around 500,000. Market analysis can show that a commercial solution is somewhere between 2 to 3 million. So we have a lot of opportunity internally, but 500,000 plus the labor costs for the internal developed solution.
Good deal. And Ray, thank you for your work. And I would ask that at the appropriate time that you visit with the Greater Houston Builders Association, maybe sit down with a few of them, just to kind of run through what it's going to feel, look, act like, and things of that nature, just to make sure that we're getting their input as well. We might be looking at it from our convenience perspective, but I think it's going to be very, very important to make sure we hear from them. Yeah. So if you'll do that, that would be very, very helpful. And then lastly, in terms of, let's assume the proof of concept works. And before I go there, years ago, ePermit was, fireworks were going off and parades and all that. And all it was just where you can scan your plans, and it got to somebody's office, but it went through the same merry-go-round that it always goes through. It just changed from plan reviewer to plan reviewer. People were still getting 30-day delays for corrections, just for reviews of corrections. Can you help me just very briefly understand that this will be significantly different?
Yes, this will be significantly different. And I will add to that, I think engineering does a fantastic job. We have a very complex permitting system here. There are over 45 different application types that must go through a triage and checklist of evaluation. This particular system will evaluate different types of plans for very, very menial and repetitive tasks. Things like, is your compass facing north in the bottom left corner, or is it in the bottom right corner? Using AI for those repetitive tasks is actually the best use case of AI. And then in the initial proof of concept, we will be handing that off to the reviewer as a report. to train a model and automate that process for the resident. So the final goal that we're trying to achieve is that an AI solution can achieve that plan review process immediately as a resident uploads their blueprints and provide them recommendations on how to increase the integrity of their submission.
Good deal. And you know, Ray, when we say that we're better at our permitting process than the city of Houston, we generally measure that by days or weeks. How much better are we going to be?
Initially, our target is trying to reduce plan review by at least 50%. I am a very optimistic person. I come from a place of wild ideas. I mean, plan reviews to me.
Yeah, right?
For myself, looking at AI and what we're doing with the models, I mean, we're talking minutes within uploads to have tangible results on what the resident should be able to do.
Cindy's sitting there saying, say 25%.
Yeah.
But yeah, that's the goal that we're trying to target is at least 50%
Awesome.
reduction in
Awesome.
reviews.
Awesome. Thank you very much. Appreciate it, Director.
Commissioner, on the to be on the safe side, since this is a public forum. Well, we will
No.
know
It's
the-
it's in the record. It's in the record.
we
Forever
will
hold
know
your
the
peace.
results when we test.
Yeah. Good deal. Ray, you still doing your farming?
Yes.
All right.
Oh, yes.
Give your
Can't let
kids
that go.
give your kids my best.
Thank you so much.
So I had a few quick questions to build, and Commissioner Garcia, I agree with you 100%. And I know we have Dr. Rahman here, so I wanted to bring him up for a collaborative discussion on where we are. So I want to make sure I'm clear, not to always keep going back to this both and, but Director Menon, this item, I'm all about coming up with the macro AI plan for the entire county as we work through the interrelated kind of synergistic, multifaceted dimensions with having 70 departments. I get it. I love that we're doing the macro. But to the both and we have been very clear that we want to really implement the responsible use of AI to do first reviews in permitting. And we've agreed to all these KPIs and to how we're going to get better in permitting. And I take this so seriously, representing one of the fastest growing areas in the United States. Between the plat requests and the permit requests, we get so many calls about whether it's the lack of continuity of reviewer and the days spent, and I know we're improving. And Dr. Rahman meets regularly with GHBA and these key stakeholder groups to track the progress. So please don't have a separate meeting. Do it as a team, united front, so we can hear feedback and implement them. Like, we don't have room or time to waste. But my question is, as you do the both and as we recognize we've made commitments to these KPI, I love, by the way, I'm also in your fan club, 50%. I love bold thinkers. We need to go bigger or go home, right here. So, Dr. Rahman, in all candor, from your perspective, how is this going in terms of the collaboration? Because I'm a little confused, I have to say, is we're doing a test case, proof of concept, when we know Travis County down the street is already doing it, and we could just piggyback on their software. So part of me, perhaps the urgency of now, why are we doing and I recognize we may have differences than Travis County, I get that, but why not build on something that's maybe, I'm making up a number, 75% similar versus starting from scratch. So could you just educate me truly on where we're building on best practices from across other jurisdictions and where we're just straight up building it from scratch? Because I am eager to get to the 50% reduction because I don't want higher costs being passed on to my residents because of government inefficiency. So Dr. Rahman, can you give me your piece, and then Ray?
Yes.
So what's your last name?
Burns.
Burns. And then Mr. Burns, I'd love to hear again from you. Thank you, Dr. Rahman.
Commissioner Milton Rahman, County Engineer. Thank you very much. First of all, I want to acknowledge the collaboration between Universal Service and our staff members. We're working hands and gloves every day to make it work. The goal, what we have when we started these projects from this court, is two things. One, speed of plan review, and to improve quality of plan review. And we visited several entities who have done it, like you mentioned, City of Austin, LA County. From the user's perspective, that was our main objective. From the technology perspective, that's when we hand off to Director Menon. One thing that I would like to do, and the test case, as what you heard, is more to go back to our clientele, where we talk about GHBA, SCEC, and along with our plan reviewers, also let them use some of those test cases to see how this performance works or not. And before we put together a big scope of work and see, we spend millions of dollars, we want to make sure that we start on the right fit. So that is being helpful. But your idea of if it's already working somewhere, why can't we tag and build alone? That's also an option. But again, I defer that technology question to Director Menon.
Yes, I'd love to hear the pros and cons because I hesitate to build, and I recognize we have unique processes which we're trying to refine. But why not hone an extant product, i.e. piggyback off of Austin, versus just start from scratch? Like, it just seems, again, everything here takes way too long for my taste. So help me to understand the pros and cons and trade-offs.
Sure. Thank you, Commissioner, and thank you, Dr. Rahman. I echo the sentiment that he had. There's a great collaboration going on between both the teams here, and the goal is, for both of us, the goal is to get to the endpoint as soon as possible. But we also don't want to get to the journey and then have to find out that journey was not the right one or the tool wasn't the right one, because we have uniqueness within our system. Our data, our points of clarification, all of those are different from the other entities. So we want to make sure that when we go with the scope of work, we are going with a very solid scope of work with a success clearly identified at the end of the journey. So that's the reason why we are going through this proof of concept. The proof of concept, if you recall, Commissioner, we started off in the month of January, and it is March that we are completing the proof of concept to hand it over to engineering. And this is an internal one where the engineers will have an opportunity to go through the plans and tell us if that report works or not. But ultimately, if this proof of concept works, then in collaboration with engineering will determine the scope of work and go for that particular tool. We also have to make sure, we had some conversations with the purchasing agent as well. It would be, one of the points that was made was we'll have to do an RFP if you're going, or a competitive solicitation. We can't go with one tool, if that makes sense.
So it does, but it doesn't, to be completely candid with you. It must work for Harris County. Agree 100%. I also know that there's a lot of cooperative agreements for other jurisdictions. And I know there's tools that are already built that then you can tailor to your own process versus starting from scratch, right? As a non-IT and non-engineer, again, I respect your expertise, and we don't have time to waste. And so whether from a purchasing, I just don't understand. We're at NACO, like Commissioner Garcia and I are at NACO, right? And there's like all these national, what I'm calling cooperative agreements that we can latch onto. And, we're unique, but maybe there's other places that do things better. So like, how can we really get the best thing in the least amount of time for the best price is always, what I'm going for anyway. And so I just am struggling. If we're going to go on this whole journey to come up with this whole new thing versus let's tailor something that's already 80% what we need and let's just build a 20. So I feel like I'm still struggling with your answer to my question.
Sure. Commissioner, if you would let us, we'll go back and in the next code come back with an update on once we have talked to the purchasing agent, engineers, and by then the first proof of concept step, it's going to be live next week, so we would have that also completed. So if you'd let us just go back and recalibrate and come back.
Please, and I'd love to see it. I know we have many other items, and I just care so much about this because at the end of the day, it's our residents that pay more for their house, right? So this is real and it's important, and I appreciate y'all. And I love the 50%. Like, I just tell me when we can get there and sign me up for that journey. So thank you.
Good deal. Chair, one
Yes,
more
sure.
question for you, Doc. The flood control regulations and guidelines, will this system be able to incorporate that as well?
Commissioner, our permitting system also our e-permits also includes all flood controls permitting. So it will be able to support that as well.
Wonderful. And what about the projects that fall into the ETJ?
So for the ETJ projects, Commissioner, the regulation is they have to meet both jurisdictions standard. So anything that comes from the county, they have to, it can be very helpful. One of the things that these tools are going to do is pre-review, which is if you submit a document, it will already have checklist, and they'll say, hey, look, your project sits into city of Pasadena or city of Jersey Village. So you got to go follow their floodplain regulation, follow their things as well as the county's regulation if it's in the ETJ.
Good deal. And then because we have the partnership project and we do work with other cities, will we also be able to incorporate their guidelines and regulations?
Absolutely.
Wonderful. And then lastly, since I'm not a fan of AI taking over people's lives or work or jobs, better yet, but I do want to understand how much less human hands will be involved or in this process, because that's the only way AI will be able to really work efficiently. So what's the interaction reduction?
Commissioner, I'll touch on this. The initial goal is to improve the customer service significantly. So when you talk about less hands, I'll give you an example right now. Based on our queue, a person can submit a plan and for our staff to go there, and it's in the queue of 100 until the 99 is done. They'll go there and say, you know what, you missed the swimming pool permit form. This technology will immediately improve that. So the timing-wise, it will still probably need similar time, but from the customer end, they will see a significant improvement in terms of the feedback. So they can resubmit it back. So what we're expecting that there is a significant improvement in terms of the number of days, because they will be able to resubmit back quickly when it takes, but we'll still need an engineer, a plan reviewer, a fire protection engineer, structural engineer to look into the details of it. So what it will do, a lot of standard forms and standardization and things of that nature, it will be able to detect, and the accuracy of those reviews will be much better than what we have. And you hear this a lot from the developers, and so do I, that, hey, this is my 4th review and I'm getting a new comments, but I haven't changed anything. So those are the things. We'll be able to also review it efficiently. So if they change the setup plan or sheet number 24 out of 100, we'll be able to tell them that, look, you have a new comment because you have changed the sheet and it has a different configuration of the roadway than you had before. So those are some of the intricacy of the matter that what we'll see, we expect to see, and this is also from our perspective of some of our places we visited, City of Austin and LA, that most improvement we'll see initially on the pre-review and the customer service perspective, and the technical will be the second one.
Good. Thank you both.
Thank you both. Yes.
So, colleagues, we passed item 101 on the consent agenda. Is there a motion to approve this item as presented? Motion made by Commissioner
Second.
Garcia, second by Commissioner Brianna. All those in favor, vote aye.
Is
Aye.
this for 105, Commissioner?
105, yes, ma'am.
Thank you.
4 ayes, right? 4 ayes and no nays. Item passes. The next item, Commissioner Ramsey, this is 105 Universals. No, that's the one we just did.
107. 107.
Yeah, 107, Commissioner Ramsey, you pull that one. Approval of 3 positions effective March 21st for Universal Services.
Again, we covered a lot of that with Cinda and what she was just up there reviewing. But again, my simple question, Cinda, is that these positions you've discovered you needed in the middle of the budget cycle. As you get into making these improvements, I totally agree with what we're doing here across the board, technology, review, those sorts of things. Are you discovering, well, we're not going to hire folks until we need those folks? Is that what this is
Yes,
about?
Sir. Yes, so that's the way, because we have quite a few contracts through the motions that we have had from the Commissioners Court, quite a few contracts. We're looking at enterprise agreement. We are processing quite a few POs. So as one of the most complex departments, we're seeing this need become more urgent for us now That's the reason we are requesting.
Okay, well, I make a motion. We move on.
Motion made by Commissioner Ramsey and second by Commissioner Garcia. All in favor, vote aye.
Aye.
Four ayes, no nays. Item passes. Next item is item 126. Commissioner Garcia, you pull that one? Yes. Port of Houston.
We have the World Cup coming up. We've just completed the Baseball Classic. We got Fleet Week coming. And so for those reasons, obviously, Homeland Security and public safety are always top of mind. So I want to begin by thanking the Port of Houston and the Harris County Sheriff's Office for working together to make this particular agreement possible. This partnership strengthens security at one of our region's most critical infrastructure assets by placing dedicated sheriff's deputies full-time within the port. These are not passive roles. Our deputies will be actively patrolling, investigating crimes, and making arrests while remaining under full sheriff's office command to ensure accountability and professional law enforcement standards. This comes, as I mentioned, at a critical time as we prepare for the 2026 World Cup, which will bring millions of people to Houston, Harris County, and will have an increased global attention. At the same time, ongoing conflicts involving Iran and disrupting global shipping and increasing risks at port and critical infrastructure areas worldwide. It is important to make sure that we're getting this right. So what happens overseas directly impacts us here at home. As trade routes shift, the Port of Houston becomes even more essential and potentially more vulnerable. So this is an agreement that's smart, fiscally responsible, and is a step that strengthens security without placing additional burden on taxpayers. So we must continue building on this effort and to ensure that our port remains safe, secure, and resilient. And when I was sheriff, people would always ask me, "What keeps you up at night? Is it the jail? Is it patrol? Is it whatever?" My consistent answer was the Port of Houston. So I'm very proud to move on this agreement as presented.
Second.
Motion made by Commissioner Garcia, second by Commissioner Brianos. All in favor, vote aye.
Aye.
Four ayes, no nays. Item passes. Next is item 135, County Attorney's Office, Commissioner Ramsey. This is the Barrasto Mendez Bondi.
We just need to
case.
vote.
I'll move it. Is that
Second.
Motion made by Ellis, second by Commissioner Garcia. All in favor, vote aye.
Aye.
All opposed, vote no.
No.
Three ayes, 1 nay. Item passes. Commissioner Ramsey votes no. Next item, Commissioner Ramsey, you pull that one. This is
Just need to vote.
I'll move it. Commissioner Garcia moves it. I'll Commissioner Brianos seconds it. All those in favor vote aye. Aye. All opposed vote no.
No.
It passes.
And this
Three
is
ayes, 1 nay.
136.
That's 136. Commissioner Ramsey votes no. Next one is 181. Commissioner Ramsey. Contracted slots, the Department of Economic.
Again, we've struggled. I know Baker Ripley had to pay a fine related to some of this. I know there's a lot of concerns related to fraud. We just need to vote.
Commissioner Garcia moves it, and I'll second it. All those in favor vote aye. All those opposed vote no.
No.
Three ayes, 1 nay. Commissioner Ramsey votes no. It passes. Next one is 182 audited claims. Commissioner Ramsey, you know what you want to pull out?
Yeah, let's make a motion to approve all items except PFM Group Consulting.
Commissioner Garcia seconds it. All those in favor vote aye. Aye. Opposed vote no. It passes 4 ayes. And now Commissioner Garcia moves on the item left out, and I'll second it. All those in favor vote aye. Aye. Those opposed no, vote no.
No.
3 ayes, 1 no. Commissioner Ramsey votes no. Next one is purchasing. Again, Commissioner Ramsey, this is 195, Solar for All.
We just need to vote.
No, actually, I have questions, please.
Okay. I'm sorry, I didn't see your note there. Yes, ma'am.
Could we please, Mr. Dickerman, County Administrator Carter, could we please have a quick update? And then I have some questions.
And is this tied to 409 and 455 as well? You want to take all those together?
Which one is
Please.
this? 195, 40?
And we're talking about solar for all of those who are following along.
195,
Yes.
409, and 455.
Yes.
Okay, we'll bring all those up together. 195, 49, and 455.
Sure. Thank you, Commissioner. And Mr. Dickerman has been leading this, and so he has a broad update and then these specific items.
Thanks, Commissioner. These items, these are for the developer. I think actually we have both the developers here today. This is the grant to build both the solar and battery storage assets that we would use for this program. This program, as you know, like this was always originally, there was going to be a county contribution. We were going to fund it with CIP dollars because they're going to be county assets. And then it was going to be repaid by tax credits and then by the grant fund. The grant funds were a reimbursable grant. So we've gone through, we had a lot of participation, Office of County Engineer and others to help pick two vendors with a lot of experience doing very similar work. And I think we're happy to see that County Attorney, moved very quickly in purchasing to move these contracts forward. We're doing that because the tax credits now have certain deadlines that we want to meet, and we believe by passing that today, we are confident we'll be able to meet those deadlines and achieve those tax credits as we'd always planned.
Anything else you would like to add?
Did you want to give the percent in the bill? I wanted you to reference the bill.
Oh, for the bill savings, yeah. So
The bill that sustained the tax credits. I'll mention it.
Yeah.
Sorry. These tax credits were changed in the big, beautiful bill, but they were included. So they are continuing on to clarify, but the deadlines are a lot sooner.
And can you all reiterate the deadlines for everyone's?
So there are multiple ways to qualify for these tax credits, one of which is getting started before July 4th. If you start before July 4th, then you are sort of outside of the window for you have as long as it takes to finish those programs. So if we get started, then we can go past the current deadline, which is the end of 2030. So things that are done, that get started after July 4th of this year have to be completed by 2030. So we want to make sure that with all, that we're using the most generous, we're mitigating risk as much as possible. So we want to get started before July 4th so we have as much time as we need to finish all of these projects.
Okay, and just for those of you who, to level set, to me, this project is critical, right? I'm so proud that Harris County is the energy capital of the world, and to continue dominating, it's a both and. We need to dominate in traditional energy sources, and we need to be leading in the energy transition. So we were all thrilled when the Texas Solar for All Coalition, we were awarded $250 million grant from the Biden-Harris administration, and then Harris County specifically, we were awarded $54 million. So this is what we're talking about. And we've had some challenges under the Trump administration, so I have some questions about the status of the grant specifically. But in the meantime, under the Big Beautiful Bill, these energy tax credits were continued. We have this July 4th deadline that we're racing towards. Just to be clear, the two vendors that were selected, are those contracts ready if approval is granted today to be signed?
Yes, they're ready.
Okay, and then specifically, the project labor agreements are of utmost importance to me. I know under the contract, there's a bit of additional time to get those ironed out, even after the initial execution. And we know there's no room for error.
Absolutely. We're 100% committed to those project labor agreements. While the vendors have some time to complete them, we would encourage them right now and in the future to finish those as quickly as possible. There's no project without those agreements.
So I'm 100% committed to the project labor agreements as well. And you said we had the representatives from the two awardees, Big Sun and SunGrid, correct?
Yes, I saw them.
Yeah. Are they here?
Yeah, they're waiting.
From both?
Yes, one's. Just Big Sun. Oh, just Big Sun. Sorry, yeah.
Would you kindly join me up here, please? And so while they're walking towards me, so if approved today, how quickly could the contracts be executed, County Attorney Fonbon?
We'll prioritize them as soon as we get them.
Okay, and then I know we have to start construction by July 4th, is that, just to be clear. And to the best of our knowledge, 100% on track to get started by then.
Yes, that's correct.
Okay, and could you please introduce yourself for the record and state your company?
We drove by the NRG Center during the lunch break to check it out.
I love field trips, but could you please state your name and your,
Yes, I'm Jason Pittman. I'm the president of Big Sun Solar.
Hi, and I'm Robert Miggins. I'm CEO of Big Sun Solar.
okay, well, thank you for your partnership on what I see as this critical project. My question to you is, do we have your commitment on the project labor agreement?
Yes, you do. So we've reviewed the agreement. We've sent it back with our red lines on it. There was only, I think, 2 issues that we had that we're trying to work out. Basically, those are, we submitted a utilization plan for small businesses with our proposal. So these are women-owned and minority-owned businesses, and we need to make sure that those 2 subcontractors that we've committed to are also considered core employees in the agreement.
Okay. And do we have your commitment that we will be able to start construction by the July 4th?
Yes, yes.
Okay, thank you. And the reason, not only do I want us to continue being the energy capital of the world, both current and future in the transition, but with rising energy costs, our unreliable grid, the opportunity to have great paying labor jobs, it's one of those win-win-wins. And given this very short time frame, I want to make sure we're all working as a team to get it done together. So we have your commitment.
Yes, we're ready to go
Okay.
as soon as the contracts are executed.
Okay, thank you. And there's, just to confirm, the other company's no longer here?
No, I was mistaken.
All right, well, you've answered my questions. And then lastly, in the meantime, what is the current status of the Federal Solar for All grant? Where are we in our?
We're still in litigation. We are in the midst of filing different motions for summary judgment. There's been some delays because of other case law that's proceeding at the same time, and we are cautiously optimistic. I think we think our arguments are better than the DOJ's, but we probably won't see a ruling for another few months.
Well, again, I appreciate this kind of both and while we work on litigating the grant and the contract that we had. In the meantime, we are racing towards the energy tax credits because this is a huge opportunity for our county. So thank you very much. We look forward to working with you, and I will be in support of these 2 items. Thank you both, Mr. Dickerman and County Administrator Carter.
So I'm next on the list. Jesse, I just want to make sure I'm clear. I understand the issue with the grant and the risk there because it's in court. And I'm for the item. I'm willing to take the risk, but I just want to make sure I get some sense of what it will cost. So because Congress is sort of at a standstill right now, it's unlikely that they would do anything to do some kind of tax reform, we think. But in the event they did, what's your guess, best guess? You or the county administrator, budget officer, whoever, on what financial risk do we have? I'm willing to take it, but I want to know.
Well, the tax credits are worth approximately 40% of the capital of the program. So if we're at 90 million in the program cost today, it's 40 odd million, a little less on the tax credit piece.
And I know that's unlikely, but I think that's the crux of the issue. I would just go to it, so at least we know if that happens. It's unlikely, but stranger things have happened in this environment. Okay, anybody else? Commissioner Ramsey?
So you're saying that if we don't get the grant, where do we get the money?
So if we do not get the grant, then there will be additional, it will sit on the debt books with the rest of the debt. We're able to use CIP dollars. The other thing I'd say, Commissioner, is that if we don't get the
Take
grant.
dollars that we were going to use for something else and use it for this?
Capital dollars, yes,
Capital,
sir.
I'm talking about CIP.
Yes, sir.
That's all money.
Yes, sir. I think that the other thing that we have is that these are revenue generating projects, and in the case that changes and that we don't get the grant, we can reevaluate how we're using some of the revenue that comes into the program.
I would like, when you report back, that you're going to have to use dollars if we didn't get the grant. We need to understand what we're not going to do because we are doing this, simply stated.
Sorry, one more question. So the 40% of the tax credits, can you talk about how those tranches come in as the project develops?
The tax credits don't come in until the projects are delivered.
So that's the 4-year horizon.
That's the horizon. So that hasn't changed. That's always been the case with these energy tax credits, is you deliver the project and then you put in for the tax credits.
Okay, thank you.
So I think the motion would be to move items 195 and what other two, Jay?
409 and 455.
As presented.
I will move them as presented.
Okay, and second by Commissioner Garcia second. All those in favor, vote aye.
Aye.
All opposed, vote no.
No.
3 ayes and 1 nay. The item passes. Okay. Next is, what is my next one, Jay?
212.
212? Item 212. Commissioner Garcia, Southwestern Correctional. LaSalle, you
Yeah,
pull it
thank you. I just want to get an idea. Tanya, if we say on the pace that the DA is on, who's doing a phenomenal job, when do we think we could possibly cancel this contract?
The LaSalle contract? Ola, Chief Bosquez, are you still on? I think in your outsource reduction plan with it would be 650 over the next 2 years. We could close Ola in 2027. Is that correct?
I'm sorry, I caught the last half. Yes, the reduction.
We could close Ola, one of the facilities, at the end of 2027, calendar year 2027, correct?
Yes, if everything aligns, that's our goal. We've already started talking with, I'm sorry.
That's one of the 3 contracts.
Okay.
That's LaSalle.
LaSalle is actually all 3 of the contracts. Jefferson, you're going to have to pronounce Natchitoches for me.
And why pick out Ola?
It's the, sir, go ahead. Furthest away?
So Commissioner Garcia, Ola is the furthest away, just like we did concentrated on Mississippi. So we want to get them within the Houston bubble.
Gotcha.
So LaSalle operates 3.
Got it.
One in Beaumont, that's in Texas. That's 100%. We use that as TDC overflow for folks that have been convicted, waiting to be picked up by the state prison system.
Good.
Natchitoches is just across the border. So it's as close as we can get to the Houston area. That holds 400, and we approximately use 60% of that, again, for TDC, just inmates waiting to go to prison after they've been sentenced. And we're trying to maximize that. Our goal is to get that up to 100% as soon as possible. And then, so Ola is the furthest away. It's the biggest contract. That's what the first 2 steps that we presented to you on the 100 within the next 90 days, and then an additional 150 towards the end of this calendar year. It would be out of that facility, which would set us up for 2027 to, again, reduce the last 400 and completely close out that contract.
Good deal. Thank you. Thank you.
Thank you, sir.
Move on.
Commissioner Garcia moves the motion. I second it. Anybody? Commissioner Briones?
No, if I can just make a few quick comments. So, I mean, this is one of those things that keeps me up at night and just pains me to my core that we have these outsourcing. To be clear, Chief Bosquez, do we have any other choice at this point in time?
Specifically
outsource. given the inspection challenges, the bed availability challenges, the staffing challenges, et cetera, all the things that we've discussed numerous times, like this is our only choice, essentially, is my question, correct? Outsourcing because we can't have the people here because of the lack of beds, because of the maintenance projects, because of all the things that we've talked about. Basically,
Yes,
why do we have to outsource these people?
Yes, I believe that the short answer is yes. With as we've talked about, the remedial order beds that are not approved for authorization, the construction beds, which comes to roughly 1,250, 1,300, with the classification variants, which the national standard or recommended is 10%, and we kind of come in under that. That adds another 300 or 400. So those factors in a safe jail, yes, correct. That's why we do outsourcing.
Thank you. So we're all committed. We all share a commitment to ending outsourcing responsibly, permanently, as fast as we can.
Yes, and again, to praise the court, the support that y'all given us by the staffing and the salary increase, so it helped with attrition rate. Those are the things that we've been able to reduce hundreds of outsourcing beds in the last 24 months. We're going to continue to reduce those in this calendar year. And again, our plan is for next year to remain that. So Sheriff Gonzalez and the whole sheriff's office, all the people that work here, we can't do that without the court support, great support with the DA's office and the court system, Director Mills. It's really a systemic thing, CJC, just everybody working towards a goal, and we're seeing the progress.
What's the number
you.
of beds at this
Ola?
How many
We have
beds?
we have 650, Commissioner Ramsey, at that facility. We have 400 at the Natchitoches, Louisiana facility, and 188 beds at the Beaumont, Texas, Jefferson County
So
facility.
you're pretty close to what, if you can get some relief from the state on now that we are in compliance. And I know we're going after that over a couple months. That's 500 something beds right there. But we'll all be counting beds and
Yep.
counting
With the
others.
dashboard. No, I just want to say thank you, Chief Boscas. And also to your point, we're seeing, again, we have a long road ahead, but we're seeing the progress. And I too want to thank DA Tier for just phenomenal work in moving those cases, giving victims their day in court, the defendants, moving these cases, the judges, the sheriff's department, it's a team effort. And we still have so much work to do. So we must approve this contract because we have no choice. And we look forward to the day we can end outsourcing responsibly and permanently. So,
And Commissioner and Court, so y'all will see another amendment, hopefully within the next 30 or 45 days, that has the two things that we presented for all the reduction of those beds this year. We hope to have that amendment through County Attorney's Office and our legal, so we can get those 100 back, and then again the other 150.
thank you, Chief Boscas, and thank you, Sheriff Gonzalez.
Thank you.
Okay, so motion was made by Commissioner Garcia, second by Ellis. All those in favor, vote aye.
Aye.
All opposed, vote no. Vote no.
And that was 458 as well.
Yes, sir. Correct?
So it's also for 458
Yes.
as presented, okay.
Make sure I knocked it out. 458, as present. Oh,
No,
no,
No, not
no, not 458. We're about to get to that one next. So that was which one? Just so we got it right.
So we just finished 212,
212.
so 235 next.
235 is, that one was pulled by Ellis and also by Commissioner Ramsey. I just want to make and Garcia. All of us, I'll just jump in first since I pulled it as well. And I want to say that I think all of us felt the pain of the people who came in and testified. I sent a proposed motion around, and I want to explain why I'm going to do it. I know that it's difficult for the budget director, the county administrator, any department head to predict everything. But when this item came up on August the 14th, 2025, this was a discussion on the employee group waiver.
I got a tape of you responding to that August meeting.
Oh, yeah.
I was going to show it in a minute.
You're going to show, you got it?
Where you asked, can I show that?
Yeah, go ahead and show it. I was going to read it. I was not going to. I want to know how you get this stuff so quick. I want you to know under the old court, one of your predecessors would come up, Raddick would come up and go, show me what I said, but I could never get it. This time I did get it. So there, it's much.
Well, I think they've got it queued up if they'll play it. I think it's set.
Which one you want to play?
This is the
August 14th, 2025
court,
discussion about
Mr. Ellis asking Director Ramos about
The
benefits.
employer group waiver.
Daniel, I'm setting the stage
Here it is.
by saying you would
Here it
never
is.
know. Go ahead.
Roll.
The employer group waiver program. I'd ask for action on that one. Just to reiterate, this is not increasing the cost of prescription drugs for our retirees. This is simply recategorizing our retiree health in order to receive more federal reimbursements from CMS.
So just make sure I'm clear. So no cost to retirees, zero.
Correct.
Okay, so I want to set the stage, Daniel Ramos. There's no way you would know, but you're in a better position than we are. So when it was coming up, I made it clear. I'm real sensitive about these benefits because I know a lot of people stayed. if any retirees are left, you think you got it hard. I stayed in the Texas Senate for 26 years on a $600 a month job. And I took the platinum gold retirement deal. So really, I had the privilege of writing the state a check every year. I can't remember how much, a good $3,000-4,000, because I took the best life insurance and everything I could get, as old as I am, having our last child at my age, to protect my retirement and my family. I stayed 26 years. And part of it was, I figured, other opportunities came my way, but at least there'll be a retirement. And it's a challenge telling a lot of the millennials now, stay on a job long enough to get a retirement. Don't just jump and grab the next one. But so the motion I sent around, and I know there'll be a lot of discussion, but at my age, I like to get out of here. I'm a much nicer person when I get my exercise. And it's better to do it during the daylight instead of having to go to a gym. So at the appropriate time, I'm going to move to direct the Office of Management and Budget and Human Resources and Talent to review the implementation of the Aetna SilverScript Employee Group Waiver Plan and identify options to, number one, address retiree concerns, align with the court's intent that the transition not increase costs for retirees, and provide options to address concerns of retirees that have seen increased costs. Translation, give them their money back. Because I know this item has to pass, or there are other financial implications if we don't do it. I mean, I don't have to say it all here in public. You can, but you spent a good 20 minutes walking through it with me. And then the county administrator came in with your group and Human Resources to walk me through it earlier today. And then the last part is, and report back with an update at the May 14th Commissioners Court. So at the appropriate time, but we'll go down the list. I don't want to belabor it. I want to wrap this up. We got a few more important items. Commissioner Garcia, then Commissioner Ramsey, then Commissioner Briones.
Thank you, Chair. And so I appreciate all the work being done, but I did vividly remember this conversation. And I remember it because I also tend to hear like the retiree that I am from the city. So I pay attention to these things. So the projected savings and long-term impact on our retirees' liability is obviously something that we want. That's the positive thing we want to provide them. However, at the same time, we need to make sure that we balance the savings with the real experience our retirees will have on a day-to-day basis. And so I'm concerned about the issues that we're hearing about and seeing come over in emails, especially higher out of costs from formulary tier changes and the inability to use manufacturer coupons. So what can we do right now to reduce that burden on our retirees? On the side of communication, it sounds like a lot went out, but we are still seeing confusion about Medicare Advantage enrollment and penalties. So what can we do differently to reach people earlier and a broader group of these employees, in particular our retirees? Because that's one of the things that I heard was that they received some communication, but they felt that it was minimal at best. And so what can we do better at engaging them? And can we, look, I'm going to make a motion to form a retirees commission because we need to make sure that we're not making these kind of moves in absence of their input. So looking ahead, you have outlined options like improving plan design and reviewing the formulary. What is the timeline to bring these improvements back to court, and what would it take to make this plan work better for our retirees? I'm not sure who can answer that.
We
That
can
would
jump
be
in. So
HR.
Andrea Coughlin-Raleigh, Human Resources, and this is Sarah Acosta. She's our Benefits Director. So we're here today to express, first of all, our regret for what retirees have gone through, and we did have our team here today to support those who showed up. Behind the scenes, our benefits team has been working long hours, very diligently to help address every issue that they can. So a couple things immediately, and then to address your further question, Commissioner Garcia. The things we're doing right now are trying to help with anything that can be remedied immediately. So in some instances, just the logistics of the change have been difficult for retirees to understand. To your point, they haven't had maybe sufficient communication. And so we're helping them with things like understanding how to get pre-authorization.
Continue.
By
Okay,
unanimous
if that's-
consent, I move that we
if that's the
continue to a
problem.
finish.
Or understanding if they need to change pharmacies or if there's another drug on the formulary or something like that. So Sarah's team is helping them understand and address a lot of the issues that way, but some of the issues won't go away, like the increased payment for the premium from Social Security, the Medicare Part D that you were mentioning earlier. That won't change because it's income related and it's Social Security. We can't touch that. So we're helping them with the immediate things that we can. To your point, we have a very aggressive plan as to how we'll engage with future retirees, current retirees and future retirees who will be hitting age 65 Medicare eligibility, and making sure that they fully understand that we engage with them in the retirement planning process and then leading up to when they hit that age. I'm going to pause and let Sarah address anything else that she'd like to share.
I mean, I think you pretty much covered it. Hi, thank you for having me. This has been a very condensed timeline to get a very complicated plan in place as it was. And we were really trying to make sure we got some of that communication out early, but not too early to the point where we couldn't deliver that file to SilverScript, because we had to make sure we could get it to them. So that way we knew the effective date would be 2/1 as what was the intent. But after that, we nailed in on the communication with providing multiple webinars and such. And so beyond that, I know she mentioned, Andrea mentioned that we're going to have, explore formulary changes. Maybe there's a better formulary. I mean, what was proposed was what mirrored our formulary now. Same with the plan design. The plan design mirrors what our plan design is now, with the addition of what's called a catastrophic phase. And that's where it's actually a protective factor built into all Medicare Part D plans. And so the member will not pay any more than $2,100 out of pocket for their medication for the year. I understand that's still something that retirees, when we would tell them that, they're like, I don't want to pay $2,100. But ultimately, we do have a lot of members, as you probably understand, that are on several medications. So I already, just from some initial reports, we know that people have hit that already by this month. So we started at 2/1 and we're on already in March 15th, or I don't know the date today, but anyways, but we're looking at possibly modifying that plan design so it's richer, so it takes it factors in where that coupon, that manufacturer card that they can't use anymore, that it fills it in for them. So
Good deal. And
yeah.
and in terms of the, you touched on it. We moved on this pretty quickly, and earlier we pushed something else through quickly that I don't think was fully baked, and we had these particular problems, and I'll foresee particular problems on the other item. But with that being said, who would we have known that this was going to be the case, or is this as much a surprise to us as it is to the retirees?
I think some items we would have possibly known better, but we do not have as much line of sight on the income, the IRMA, so income what is it? I'm blanking right now, but IRMA. So we don't have everybody's tax returns, but we do know what pensioners do take home from TCDRS. So there is some information that we would have had available. The MA or Medicare Advantage plan members, we do have quite a few of our retirees that enroll in MA or MAPD, Medicare Advantage prescription drug plans outside of Harris counties. So they have several health insurances. And so by enrollment in this plan, it actually kicks them out. And so we wouldn't know what they're enrolled in, but we did have a partner in that with Kelsey Care, or Kelsey Care's MAPD plan. They're already one of our plans internally, and they do our clinic. And so we reached out to them to get ahead on that, and we identified about 400 members that we sent lots of letters, made outbound phone calls saying, hey, you need to make a choice, basically, because we don't want to take away your Kelsey Care doctors, but you also have a prescription drug plan that's changing. So there are a few things that could have been done definitely better had we had time to investigate them more. But it was a very fast-moving process. We had to work with Universal Services to get that eligibility file built. That is quite complicated in the Medicare world. We had to do a lot of investigating for Medicare beneficiary IDs that we didn't have on file. It came back, we had about 1,000 missing out of our approximately 5,000 plus retirees members. So we had to go find those and research those, reach out to retirees then. So it's been a long, for us, it's been an ongoing process since it got put into, implementation with August. So I know everybody is, I wouldn't say frustrated, but we're really trying to push through and make the retiree whole and then look at what we can do to improve it.
Good deal. I appreciate that. Lastly, well, two things. This is a year-to-year contract, Mr. Ramos? Is that correct?
Yes, sir.
Okay. Because I finally, I don't understand why it took so long. I had asked probably months after we went to Aetna, because I was hearing problems from employees about a customer survey. I finally got that. When did we move to Aetna?
2024. 2024.
Yeah. I finally got that report, which I'm curious about. But in reading that report talks about great benefits. Everybody loves the benefits. But there is a consistent theme of customer service deficiencies. And so I'm not sure if they're listening, but this is a year-to-year contract, and these are the kind of things I'm going to be remembering when it's time to talk about that contract. Thank you very much.
Commissioner Ramsey?
Yeah, quickly, all the concerns that have been expressed, I agree with that. We all know a lot more about income-related monthly adjustment amount, IRMA. We've all gotten those phone calls, and when people call me and say they were paying, didn't have to pay anything at all, now they're paying $300 a month. 14-year retiree went from 0 to 50. Someone went from $100 cost for 3 months to $1,200. Just major impacts to these folks who are sitting there counting their nickels and pennies and doing what they should. So a part of these agenda items today is an amendment to the Aetna. That's correct?
Yes.
This is an 87-page amendment. Mm-hmm. Has somebody read the 87-page amendment?
Yes. Yes.
And so we know, maybe we'll know now maybe for some things to look at on this one, going through, not that we did before, but clearly we're a bit surprised by a lot of what's happening. And again, thank y'all for what y'all do. Y'all getting more phone calls than we are.
Yeah.
But I totally support Commissioner Ellis's motions related to, we're not going to sit here and decide how we're going to fix it. All we decide today is we're going to fix it and make it right. Thank you.
Thank you.
Yes, I echo my colleagues' sentiments. I mean, to me, this is a sacred promise that we make our Harris County employees. When you spend your life working for Harris County or any other jurisdiction, and you serve the people, you rely on the dignity that you will have in your retirement with these benefits, and then to have just these unexpected changes and implications, and then not to have communicated them as clearly and as multifacetedly as should have been done. And then as somebody who has been entrusted by the people to help run the third largest county, and I'm so happy we played that tape again, because the information that we were given versus the reality, huge inconsistency. And so I ask not only you all, but every department head, everybody who presents to us, the due diligence must be accurate to the best of all ability, because this affects people's lives when they're living literally counting pennies, or they can't take their medicine, or they have to skip every other month of medicine. I mean, this is real people's lives. And so I know between Aetna, between the benefits consultant, like Commissioner Garcia said, we're watching, we expect excellence, period. And so I also support Commissioner Ellis's motion, because we are committed to fixing this, committed to honoring that sacred promise. And in the meantime, continue troubleshooting with our retirees because they're suffering. And we're all committed to this, and we would have not made this decision if we had had the actual information. So never let that happen again, and please fix it. So with that, thank you, Commissioner Ellis, for your motions, which I proudly support.
Thank you. So now look, in closing, I don't think you have to do the presentation. I think we get it. I mean, I know you've talked to all these officers because you came in and talked to me. I just want to make sure it's clear that I'm hoping we'll come back when I say address concerns. I know we have to pass it. You can explain to them why we have to do it. I'll say in defense of the bureaucracy, we made changes collectively, and it was the last minute. Y'all were trying to come up with savings to help us make that budget balance. So I get that, but you just got to be real careful on it. But I hope we can go back and correct it, make those folks whole, even after the fact. I mean, it says a lot for people to continue to work in government, particularly in this environment when so many people jump around. Even the ones in my household, sometimes I'm trying to explain to young people, don't quit. You know, at some point, I know it's hard to believe it, even you all will get old. And look how pretty you look when you get old, if you live right. Okay, so I read the motion earlier.
Commissioner, I did have a question. Your email says it's for item 235 and 458.
Yeah, we bring them both up.
So the motion is for both items, and they'll both be approved as presented and as well as with the motion you read.
Yes, ma'am. Is that second to the motion?
Second.
Second by Commissioner Ramsey. All those in favor vote aye.
Aye.
All those opposed vote no. 4 ayes, no nays. Item passes.
And we have the June budget coming up too, Daniel, right? We'll have to adjust accordingly.
Yeah.
Yes, sir.
Yeah. Okay, the next one is that me again? Oh, yeah, consultation agreement, right? Is that my next one? Am I skipping one? Oh, Immigrant Commission.
Immigrant bylaws, yeah.
Okay. When we take a 5-minute break, I know somebody else has to take a break as well. I know it's 10 minutes. Y'all need a break too, by the way. So it is 4:55. We'll take a 10-minute break. Okay, colleagues, it is now 5:02. We're back in session. The next item is item 281. This is an item that came out of my office, and I appreciate Alan DeLeon and Spencer Lively for the work they did on it. It is to create Harris County's first Immigrant and Refugee Commission. It's about making sure our policy reflect the realities and needs of a diverse and vibrant community. We got 1.3 million immigrants in our county, representing 26% of our population. Half of Harris County's children have at least one immigrant parent, and most of these children, 82%, were born in the United States. Immigrants make up about 809,000 workers, making up 1 in 3 workers in our total labor workforce. Immigrant-led households contributed an estimated $19.3 billion in state and local taxes and $38.8 billion in federal taxes in 2023. We're following the model of a number of other places who have done this. Cities like Austin and counties like King County, San Diego County, Baltimore, which is a city county, and Denver, which is a city and a county, have similar commissions. And we pretty much followed the track of language that they did. The motion, which I have sent around, and I'll just read it in case you don't have it, will be this. It's twofold. I move that this court adopt the proposed bylaws guiding the structure, responsibilities, and activities of the Harris County Immigrant and Refugee Commission to ensure its effective service to our immigrant and refugee communities. And I further move that the court direct the Housing and Community Development Department to designate appropriate staff to provide administrative support to the Harris County Immigrant and Refugee Commission. Motion made by Ellison, second by Commissioner Garcia. All those in favor? Oh, we have to, well, I think it passed when there are 3 of us here. I think she wants to vote on it anyway. Yeah.
Commissioner?
Yes. I'm right here. Okay, so if, motion made by Ellis, second by Commissioner Garcia, all those in favor, vote aye.
Aye.
All those opposed, vote no.
No.
3 ayes and 1 no, the item passes. The next item is.
Commissioner?
Yes, sir.
I just want to comment on this and say thank you for bringing this item forward. And to the folks that we're going to ultimately add to this commission, you and I talked about it a bit with the background of what do we call the city? MOIDA, Office of Immigration and Refugees at the city.
Yes.
Benito.
Yes.
Benito ran that office for years and did a phenomenal job. I
Great
hope this
job.
commission helps us as the county do a better job of understanding the needs and challenges, and make sure that county government serves our immigrant and refugee community better. So I appreciate you moving on this item.
Thank you.
Yeah,
Commissioner Briones?
Very brief comments. Commissioner Ellis, thank you for your leadership on this. I believe very strongly, and I'm happy we're moving forward. When you have a Harris County where 1 in 4 people are immigrants, and then there's places like Gulfton, which I proudly represent, where over 60% were born in a different country. I just think it's incumbent as us as leaders to make sure that we're listening, that we are learning, and that we're continuing to improve in how we are keeping folks safe, providing opportunity, and creating resources, language access, health, et cetera. So with that, thank you, and I look forward to continuing to make Harris County an even more inclusive, welcoming place.
Thank
So,
you.
Thank you.
So the item passes 3-1. You got to vote 3-1. The next item is item 282, and this is the resolution establishing a consultation agent to foster employee engagement and development of personnel policies and improve handling of employee grievances and disciplinary. It's a simple matter that in Texas, I think that all workers deserve representation. This is an important day for workers in Texas. We're introducing the first and most robust consultation policy for county employees in Texas. Created alongside labor advocates, this policy empowers our workers by giving them a seat at the table to address grievances related to pay, promotions, termination, and working conditions. We're making sure that county employees have a fair opportunity to be heard when they have a workplace concern. This policy does not, I want to repeat, this policy does not create collective bargaining rights. Instead, it creates a consultation process for areas of employee concerns where Commissioners Court still has final authority over all decisions. We made some substantial changes in this county. We fought for a living wage and passed it. We fought for and invested in apprenticeship programs and passed it, along with a continuous stream of funding after the federal money is gone. And today we make a historic move towards a better workplace for all. This day's been a long time coming. I want to thank the county attorney's office, Mr. Farnbaum, taking his phone calls, and Neil Sarker and the entire team at that office, including the previous county attorney, Mr. Menifee, put a lot of work into this. The Office of the County Administrator, all of the court offices, our friends in labor who helped make this possible. I won't belabor the point, but I think it's an important measure. I was joking at the press conference, Commissioner Briones, I want to thank you and your staff, by the way. You know, I always joke about we can only talk to one, and sometimes you can forget. You know, I guess I pick somebody each time, but I know you can forget which one you talk to. I might forget to say if you talk to anybody, and then that person might forget, but I chose to work with you, and it's a pleasure working with you and your team. But I was joking at the press conference when I said I was not in the legislature in 1947, since they joke, Tom, about people having experience around here. But I was there when we reenacted the Texas right to work law. I just can't remember if it was under Governor Richards or Governor Bush. I think it was 93. So it was under Governor Ann Richards. And I've tried to, just on ChatGPT, see if I voted for it. If the governor signed it, I probably did vote for it because it was clear precedent in Texas, not necessarily something I favored. I know the circumstances when it passed in 1947, when my daddy couldn't even walk down most streets in Texas where he lived. But regardless of that, it is the case. But I think it's a good thing. It just gives our employees a seat at the table. And for some who would say or suggest, well, there's no place for unions. This is not a collective bargaining agreement. But some of those very people are the ones who ignore the fact that certain groups of employees under the law in Texas can form unions. So they don't think about that being a non sequitur. It doesn't follow to use that logic. But again, it is not a collective bargaining agreement. Commissioner Briones.
I think Commissioner Garcia's
Oh,
first.
I'm sorry. I didn't see you. Oh, there it is, Adrian. I'm getting
But
tired.
then I
See
do
what
have
happens when I
comments.
need my jicama? Little energy here.
First of all, thank you to all who worked on this item. And, having gone through the early days of union organizing at the police department, it was hard. There was some degree of representation, but obviously the frontline folks felt like it was only supporting the brass. And so the Houston Police Patrolmen's Union was born and then ultimately led into what is now the Houston Police Officers Association. But to that end, I will tell you that in the old days, and there's a guy by the name of Bob Thomas. I don't think anybody remembers or knows that name, but Bob took so much grief and retribution and heartache and just just was put through the grinder because he was the person leading the organizing for us at that time. And I would just say, so glad that we don't have to go through all that, all that muck and gut to get here because we understand it. But I'll just tell you, I've been a union dues paying member. I get it. I understand the value of it. And just looking forward to it. And by the way, Yedmo, I was an AFSCME member back in the day when I was on council. So I don't know why my application hasn't come again. But thank y'all for your work on this. I just want to make sure that we get this right. And so if there's any hiccups that go through it, I don't want to have what we just experienced with our retirees. I want to make sure it works well and that it's a real system that our employees can depend on. So thank y'all for y'all's work.
Thank you. I should have pointed them out as well. I know I didn't send, and I've sent the motion around and I think you all have looked at it as well. Commissioner Briones and Commissioner Ramsey.
Yes, today is a historic day in Harris County. Commissioner Ellis, thank you and your team for your partnership. Commissioner Garcia as well, for everything you've always done to fight for workers and working families, and to all of our labor leaders and partners, and most importantly to our workers who have already been coming to us with ideas, concerns, questions. I mean, the reason I'm so excited about this is this will empower and uplift workers' voices. And when you think about Harris County workers, I mean, these are the people filling your potholes. These are the people cleaning your ditches. These are the people mowing your parks, picking up trash in your parks. These are the people that after a hurricane are picking up that huge log that prevents you from leaving your home on the road on your way to work. I mean, you can go on and on. These are the workers. I mean, Harris County workers do so much, and we've taken so many steps, whether it's raising the wage to $20 an hour for Harris County workers, passing the 2165 for our contract workers, the worksite safety policy, the investment in apprenticeships. We believe in creating jobs and creating good jobs, and then honoring the work, even our retirees, not to go back to our last item. But to me, this is so fundamentally important because these are the people serving all the families in Harris County. So we want to do right by our workers, and we want to listen, we want to learn, and we want to improve. And so this is what it's about. It's to make sure there are more robust discussions and that we're empowering workers' voices. So I am proud that Harris County will be taking this action, and I hope that other counties and other jurisdictions will follow suit, because at the end of the day, we're only as good as the people on our team, and the people of Harris County deserve the best. And so by having the best workers who feel listened to, who feel safe, who feel empowered, we are ultimately making Harris County an even better place. So thank you to all of the collaboration and partnership. I also want to thank the County Attorney's Office. They were on point on so many things, and this is another great example. So with that, I look forward to voting in favor.
And Commissioner Briones, we will be the first county in Texas, if I didn't mention it earlier. The other cities and hospital districts, but we'll be the first county in Texas.
Yes, so I'm very proud when Harris County is the first county and leading for the right reasons, and this is another example of us doing that. So I hope other counties follow suit and other jurisdictions generally.
Commissioner Ramsey.
Yes. Is there a cost element to this?
Oh, sorry. You come back here.
Oh, no, I forgot to do one thing, but I'll go after Commissioner Ramsey.
Director Ramos.
There will likely be some costs as the number of grievances likely to expand, more hearing officers, investigators, et cetera, but we're still working through the fiscal note.
But in terms of the consultation,
it's possible that we may need some additional legal support. We're working with county attorney to see what can be done in-house versus out-of-house, but
so we don't know.
I can't imagine it's going to be a huge expense, but there likely will be more. There will likely be a higher need for hearing officers, investigators, documentation, and potentially some sort of liaison with labor.
Yeah, I would thought that, and that's pretty typical of new initiatives on the court. We always understand what the costs are before we move forward. I think that would be unusual to move forward now, not knowing what the costs are, other than it ain't no big deal.
I think that there's a few steps between here and when the consultation would begin, the organizing, the election, the certification. So we have some time to come back to court with a more formal fiscal note.
And I think Commissioner Briones did hit upon.
I ask for unanimous consent to continue until we finish. Is there any objection? Hearing none, we'll continue.
Agreed. I think it's been said what we've done just in the last couple of years, whether it's pay equity or dealing with worksite safety, all those types of issues. What I am most proud of for folks that whether they mow our parks or take care of our roads, knowing folks by name, having folks that work with them one-on-one that actually know what their job is, work with them very closely. I'm just very concerned that you get to a third party who may not understand what the county job is, may not understand what the responsibilities are, may not understand any part of it other than they're getting paid as a advocate to deal with it. In terms of grievance, I'm going to embarrass Conrad Joe behind me. He serves on a grievance committee, and that's the kind of folks that actually work at the county, that serve on these. They understand what issues are, and they deal with it. I think we have a very robust program, and as we all have been tiptoeing around collective bargaining, obviously it explicitly states that public employers, Harris County, cannot enter into collective bargaining agreements, and we're very careful to say, well, this is not what that is. Well, it sure feels like that's what it is. It sure feels like that's where we are headed. And maybe if you say, well, it's just a consultant, it's really not a union-type deal, just let me remind you, we had a consultant called Siegel that helped us with our medical, and now we're having to go back and fix that. We had a consultant named Gallagher that helped us with our pay parity, and we're having to go back and fix that. I don't know that we need consultants or any other third party to deal directly with the needs of our employers. We know their dog's name, our employees, we know where they live, we know what their issues are, we work closely with them, we are their advocates, and I'm very proud of all of our supervisors, of all the people that work at Harris County, the 400 plus people that work in Precinct 3, that we very carefully listen to and I think respond to their needs. So this is a solution looking for a problem, and I'll not be supporting.
Commissioner Briones.
Yes, if I can make two more comments. So I agree that when, we always want to do the right thing, and then we want to do the thing right, both. And the effective date is October 1st, right, County Administrator?
Yes.
Okay, so that will continue to give us time to plan because we want to execute with excellence, as always, as we aspire to do. But I'm looking at County Attorney Fonbon because, again, as a lawyer, and I believe following the law is non-negotiable. And County Attorney Fonbon, could you please walk us through why this is in accordance with all applicable laws and why you feel comfortable to the extent you do with us voting today?
Yeah, so I think you remember a couple of years ago, we were here discussing a proposed consultation policy for the Harris Center. This is very much in line with that, and so our position then is the same as our position today, which is this is not a collective bargaining agreement, and it explicitly states that it isn't. It doesn't create any contractual rights for employees. It's not enforceable against the county. The County Commissioners Court retains all authority to decide whether or not to implement the recommendations of the consultation committee. And so as a result, because you don't have a collective bargaining agreement, you're not violating state law in any way. And that's all that state law really prohibits. It's bargaining towards an agreement with an exclusive labor union for employees.
So from your legal expertise, your legal opinion is that this is in compliance as written?
Yes.
Okay, and you have no concerns with us voting today?
I don't.
Pardon me?
I don't. I mean, I haven't heard the motion language yet, but based on what I've seen in terms of the drafts of the policy that have been going around, I don't have any concerns.
Thank you. And we'll ask the same question after my colleague, Commissioner Ellis, reads the motion. But thank you for your expertise, County Attorney Fonbon.
So I'll read the motion now. The motion to approve the resolution supporting the creation of a consultation policy with implementation effective October the 1st, 2026, authorizing a process for certain county employees to select a qualified labor union to serve as a consultation agent, establishing a consultation process by which a consultation team composed of the consultation agent, certain employees, and certain management representatives will make at least monthly to discuss, certain employees and certain, establishing a consultation process by which a consultation team composed of a consultation agent, certain employees, and certain management representatives will meet at least monthly to discuss and recommend any changes to the county's personnel policies and procedures. amending the county's grievance policy to notify the consultation agent when eligible employees file a grievance and entitling eligible employees to receive representation from the consultation agent in grievance or disciplinary matters. That is the motion. Is there a second?
Before a second, County Attorney Funbon, having heard the motion language, what is your legal opinion?
Yeah, that's fine. That basically at a high level describes the draft of the policy that's about to be adopted today. Of course, with an implementation date of October 1st, that does provide some room if we need to make some tweaks to the language of the policy, but in substance, it's essentially what's been agreed to between the precinct staff.
Thank you. Second.
Okay, all those in favor vote aye.
Aye.
All opposed vote no.
No.
3 ayes, 1 nay. Commissioner Ramsey votes no. The item passes. Thank you. Thank you.
Thank you to all the Harris County workers. We appreciate everything you do.
Y'all make noise.
Yeah, y'all been in here all day. Go on up and get some of that jicama and go on home and enjoy this day. I do. Bring some of the jicama down. Bring the jicama down. Next item is item, am I right? Am I on
309.
309. Commissioner Ramsey, you and Commissioner Briones pull it. This is 2022 public safety bond projects and 2024
Thank you all.
GO project. Yes, sir, Dr. Rahman.
Good afternoon, members of the court.
Well, let's y'all tip out quietly now.
Milton Rahman, County Engineer. First of all, I want to thank Commissioner Briones for providing us the opportunity to present an update for the public safety bond project Proposition A that has been approved from the voters of Harris County in November of 2022. But before I start the presentation, Lucinda, if you can upload the slides, I want to introduce two of the finest public servants we have in our region who is leading this initiative, Chief Sam Pina, who oversee our building operation, disaster recovery, and public safety project initiative. And we also have Greg Summerlin, who is also a retiree from Harris County Sheriff's Office, serving as our subject matter expert and main coordinator with Sheriff's Office to lead some of this project. And again, Greg was instrumental leading the JPC, which is a state-of-the-art facility. So with that said, I'll give you a quick update. And as many of you know, the 2022 Public Safety Bond Proposition A was selected once it got approved. The first step was to select priority projects. We had a lot of competing needs, unlike a lot of municipal bond when we have a list of projects associated with it, or a school district bond. Our bond was an open-ended, so the first few months we had a lot of competing projects that has been submitted to Office of the County Administration, Budget Office. We did some estimates to see how much it's going to cost us. So the first step was to actually select the 8 or 9 projects that this court has authorized us to move forward. So what we'll do today, we'll go a quick overview of all those projects, where we are. At the same time, we'll also provide you an update of the jail maintenance projects. We heard it loud and clear in the last Commissioner's Court that how important this is. So what we did since then, Chief will provide an update to see how we can expedite some of this project to get it done quickly. We also have a representative from the Sheriff's Office, Sean Williams. So along with that, I'll move it to Chief Pina, if you can go on the project. Thank you.
Well, thank you, Doctor, and good afternoon, Commissioner. Sam Pena with the Office of County Engineer. And I am joined here, as Dr. Rahman mentioned, by Greg Summerlin. He's our project specialist, as well as the Assistant Director for Planning and Research for the Harris County Sheriff's Office, Sean Williams. He's here today as well to speak on the, or answers any questions that you all may have on the bond project. So if we can advance to the next slide, please. So before I walk through the projects, I'd like to briefly frame the timeline to provide a full context on these bond projects. So the Harris County voters approved the bond proposal, Proposition A, in November of 2022. They authorized up to $100 million for public safety facilities. In August of 2023, Commissioners Court directed OMB to develop cost estimates for candidate projects. So following that action, Commissioners Court then directed OMB to formally authorize, or Commissioners Court authorized 9 projects, and then directed OCE to proceed in May of 2024. So those 18 months from November 2022 to May of 2024 was the legal review and the project selection period, which OMB coordinated cost estimates. And at this point, OCE was still not in scope. OCE then received authorization, excuse me, in a project list in May of 2024. They immediately began the pre-design process for each of these projects, which included, of course, the FIMS. It included the design consultant procurement. It included the pre-design programming with the Harris County Sheriff's Office to ensure that their requirements were defined and included in the final scope. Then the purchase order was executed, and all eight projects now are currently in design. So I want to note one exemption on these projects. The Swiftwater Rescue Project, that's water training facility, that was a separately authorized item by Commissioners Court in April of 2024. This allowed the project to begin design earlier than the other projects. In January 24, they selected a designer, and then that moved over to CMAR, and the project is now in progress. Next slide, please. Now, the program consists of 8 construction projects. To date, we've spent $6.5 million that has been invoiced across all the programs. All 8 projects are currently in design. One project, the Swiftwater Training Facility, has completed the design and the CMAR procurement phase and is the closest to breaking ground. The first project we have listed up here is the District 5 relocation project on FM 1960. Just a brief overview of this project. The current District 5 substation in Tomball is not geographically aligned with the calls for service. This project relocates and expands that station to the 1960 corridor between US 290 and State Highway 249. The design is currently 50% complete. It's going to go to bid in September of 2026, and construction is due to begin in December of 2026 with a targeted completion date of September 27. The second project is the Butte Creek Road project. That's the Patrol District 6 expansion. This is a new patrol station. It'll be positioned where resources are closer to the service demand. The facility also serves as a community hub for outreach, engagement, and crime prevention programs. This one is in design. It's 90% complete. We expect bidding in April, and the construction is due to begin in July of 2026 with a targeted completion date of May of 2027. The next one, as we spoke, is the Swiftwater Training Facility. Harris County does not have a dedicated Swiftwater training facility. This is going to be the first of its kind in the region. It's going to provide realistic flood simulation and training not only for Harris County Sheriff's Office, but for regional first responders as well. The project is a construction manager at risk delivery method. Kitchell Contractors has received the award, and this is closest to coming to fruition. The item will come to court before you for approval next month, and we're going to be breaking ground in July of this year for this project. The fourth project is the active shooter training. That's a new facility on 2316 Atascocita Road. This is going to include scenario-based simulation, building, classrooms, and secured ammunition and weapons storage as well. This is 50% complete in design. The design is also CMAR, and it'll be completed in November or December of this year with construction to begin January of 2027. The next project is the Trainer Academy expansion. It's also on Atascocita Road. This will serve the Harris County Sheriff's Office and the Fire Marshal's Office, who have been operating at capacity beyond capacity since 2018. This is going to expand. It's going to add 15,000, square feet, and it'll serve where they can have simultaneous training sessions in that building. The project, again, is a CMAR delivery method, 50% in design. That should be completed in December of this year, with construction to begin in January of 2027. We're targeting the completion of this project in the second quarter of 2028. The sixth project is a fire complex renovation. This is a firearms range that'll serve multiple local and state law enforcement agencies for mandatory training. This is 90% in design. Final documentation is targeted for April of this year. Bid will happen in April. Construction is targeted for July of 2026 with a completion date of May of 2027. The seventh project is the precision driving course. This is a vehicle-related incident, I just made a note here for myself that vehicle-related incidents are the primary cause of injuries for first responders, right? So it's important for all first responders to have a course where they can train. This one is going to include, this one's going to serve, the sheriff's office. It's going to serve the fire marshals. It's also going to serve all 8 constable precincts as well. It features a skid road section, simultaneous urban street driving, precision driving track with classrooms and support facilities. This project is 60% in design. We have a June of this year to go out for bid target. Construction is going to begin in September of this year and completion in Q3 of 2027. And the final project, number 8, is a vehicle crime processing facility. This facility is going to process crime scene vehicles for multiple Harris County law enforcement agencies. The renovation is going to add enclosed bays. It's going to improve the lighting. It's going to add additional offices, and it's going to have public interface ability. 50% in design for this project. We're going to target the completion in November of 2026, bidding to begin in December of this year, and construction to begin by March of 27, with a targeted completion date of March of 2028. So in summary, all 8 projects are on track. 3 projects, the Butte Creek project, Firearms Complex, the Swiftwater, they're all in the final stages of design, and they're going to enter construction in May through July of this year. 3 additional projects, the 1960, the driving course, and the vehicle processing center. Those will be ready for bid at the end of 2026. And the two remaining ones, the active shooter training and the training academy expansion, those are going to follow in early 2027. So again, the full program, we're hoping we're targeting to finish by the second quarter of 2028. That's a quick overview of the programs and the projected start dates and finish dates for them. And at this point, we're open for questions.
Commissioner Ramsey, and then Commissioner Briones, and then Commissioner Garcia.
Thank you, Chief. Appreciate the update, Dr. Rahman. Good detail. I like dates rather than quarters. So my only minor comment to you, it'd be good to start having dates, particularly if a project's bid. You could probably put a specific date down.
Yes, sir.
So the item that Commissioner Briones put on the agenda was to also go over the 2024 jail maintenance project.
Yes, sir.
And you came to my office. I appreciate the time you spent. I know we talked about several things. I guess part of what we were going to, or you were going to work on and identify, giving specific dates for specific floors. And as we discussed in last meeting, the floor 7 was to be complete in June of this year.
Yes, sir.
That was the report in last meeting.
Correct.
Now, I, again, would like a date, but I'll take June at this point. You've been to the 7th floor recently.
Yes, sir.
Will it be complete by June?
Yes, sir. And we listened to the conversation not only on this issue, but other conversations that were related to the jail population. We share your sense of urgency. And, our commitment is to do our part to ensure that we're reducing the number of outsourcing, that number. We have visited the jail. It's our priority, Commissioner, to answer your question. I did visit. I've even taken pictures of of what's going on over there. We've made some changes in how we're approaching this, and Dr. Rahman has been clear as far as what the direction is, and it's to get these projects done on time, safely, and on budget. We're meeting that target. We have our project managers now in conversation with and coordination with Chief Bosques. We have our project manager assigned to the jail. That's where he's working out of there. We are also exploring other avenues to ensure that we're compressing the time to get these projects delivered. We're looking at adding a JOC to that facility as a secondary sub to do some of these projects. We've discussed and coordinated with Chief Bosques on additional or expanded hours of work, not only including during the week, but also including some weekends. So we're working through some logistical items as well to kind of streamline the process for our workers to get in, start working, and get this work done. But a direct answer to you is, in speaking with the general contractor directly, they're committed to having the plumbing done by the end of June of this year and having the HVAC done by the second week of July of this year. And so, again, that's what we're focused on, but that's one of
The
four
floor
projects.
7 will be ready for the chief to take it over and use it in July of this year?
So July of this year, we will finish with the HVAC system. In conversations with Chief Bosques, they've requested to revisit some project, the LED project, the lighting project. We're still in conversation on that. So if they're going to do that project, then that's going to, we want to get ahead of it sooner than later so we can finish it in time, right? So to be out of there by July of this year.
Well, we won't, go ahead.
Commissioner, if I may add, in terms of the LED project, we put that project in pause when we were talking about whether we're going to keep this jail, we're going to do a complete reconstruction or put the jail somewhere else, all the study as was going on, because the return of investment in terms of number of years, about the amount of money we're going to invest on LED and then tear this jail down doesn't make sense. So as we are making the other decision, that's why we put a pause on it. Recently, I think a couple of weeks ago, we received a request from Sheriff's Office that they are willing to move forward with the LED investment as we started a new study for the jail. And also at the same time, even if we build another facility somewhere else, I'm going to have to keep this facility there for another 4 or 5 years. So we're going to look into to see if we can get this LED done. And if we are to do this, our recommendation is going to be to use Aramark, which is one of the approved vendor that Sheriff's Office use for day-to-day maintenance. So that way we can get it done expeditedly.
Okay, I just think, I'm glad y'all are putting additional resources on it. Thank y'all for listening. I think it's important for all the reasons we've said before on our jail population. If we're now thinking, well, let's go ahead and do the lights, that's going to add a little time. It's going to be 2 or 3 more months before we can get floor 7. Those kind of decisions need to involve, at this point, us.
Correct.
I think this court has said we want floor 7, and I don't know that I've yet got an answer on when you get the keys to the chief so he can put people on floor 7. And is it June, July, or sometime after?
Commissioner, we will be done with the last project that we have on the priority list from the Sheriff's Office, which is the HVAC, the air handling units, mid-July of this year.
So can you use it then, Chief Vasquez? Can you take it then?
If all the HVAC, all the plumbing, and all the systems are put back in place by the second week of July, yes, we'd have to do a walkthrough to make sure that.
And how many beds is that?
2 years that it's been sitting vacant.
How many beds?
About 750.
A lot of beds. Okay. So I like it. I'm hearing dates and specifics and get HVAC done, and we got a plan. Then you do 4-6. And the next question, we don't have to do that today, but you need to get a date for 4-6, a date for 4-5, a date for 4-4, a date for 4-3, and a date for 4-2. I know you're not doing 4-1. But with those, I think Tanya and the rest of the folks can do their planning on when we can get folks moved back here.
Yes, sir. We're coordinating with Chief Bosques and his staff on the priority list for the other floors. Excuse me. Floor number 6 is a mirror image of floor number 7. So when floor number 7 is done, from my understanding is that they will move personnel from 6 to 7.
Yeah.
And it'll
Got it.
clear up
Got it.
6 for us to work. Yes,
Okay.
sir. Mhm. Yes, sir.
Commissioner Briones.
So thank you, Dr. Rahman. Thank you, Chief Pena. Many of my questions were exactly what Commissioner Ramsey said. And first of all, thank you for listening. I know last time I had a multitude of questions. I appreciate the time you spent taking a really deep dive with me and my team and answering even more questions. And thank you for today's update, which really is helpful. So to be clear, however, so floor 7 has 700 beds. It will be finished by July. Is that what I heard?
Yes, ma'am.
However, then we'll move to floor 6.
Correct.
And so the individuals on floor 6 will then move up to 7, Chief Bosques, is that correct?
That's correct.
So we're not
You don't
really
gain any
getting more beds. Pardon me, sir?
We don't gain any beds.
Okay. So
You're rotating them down.
Okay. So we're not getting new beds, we're just moving the folks so that we can then start working on 6. So to Commissioner Ramsey's point, please, I know y'all will now be giving us regular updates here at court. If you could just keep us as closely abreast to the specific dates so that we can, I mean, I know all of us just feel a tremendous sense of urgency and angst, frankly, about the jail. So thank you for that update. My other question, though, goes back to the public safety bond. Thank you for those updates. I'm happy all the projects are on track. My question is with regard to coordination cadence between engineering, between the sheriff's office, the fire marshal's office, and the constables. How are y'all, I know y'all work together all the time, but how are you keeping them abreast to make sure we're getting their ongoing insight and expertise to help inform our work?
Yes, ma'am. Look, we're meeting bi-monthly with the sheriff's office on different projects. Director Williams is here. We coordinate with him at least once a month on all these projects as we move along, and we provide updates. We engage. So we're connected from start to finish. To answer your question, Commissioner. So there's nothing that I've said here that will surprise him, and I mean he can speak for himself. But the coordination is there continuously.
Perfect. And I can't wait for, well, all of the projects, but especially the Swiftwater training facility, the active shooter training facility, the driving facility. This will be fantastic. So to confirm, it's for our sheriff's department team members, our constable team members, correct? Plus other jurisdictions across Texas that may want to book trainings.
That's correct.
Okay.
Sean Williams with Sheriff's Office. So all these public safety are for the whole region.
Perfect.
For the state to come in. We expect even for Swiftwater, for people from Louisiana, Arkansas to come in. The interest is there.
Excellent.
The only other tank of its size and calibration is all the way in North Carolina at this time. So this will be the second of its nation, first in Texas.
For the Swiftwater?
Swiftwater.
Wow. So this will be one of the top in the country. And I love the multiplier effect. So the fact that not only our Harris County law enforcement will be learning, but the fact that we will be opening up for the country. So thank you, and I really appreciate y'all.
Thank you. Commissioner Garcia.
Yeah, Doc and Chief, thank you. Major Sumlin, thank you guys for all your work. Yeah, listen, folks, for those of you who may not know, the Joint Processing Center that was opened as a consequence of finally passing a bond. The city had passed a bond under Mayor White, and that was to consolidate city and county jails. And the city passed its bond, the county did not. And then when I became sheriff, we got back on the campaign trail. We got the bond passed, but it was Captain Summerlin, who literally was the project manager, along with another handful of folks who really understood the jail system incredibly well. One of the things that wasn't in brick and mortar was the jail management system, which what we had was like, archaic at best. And so I'm glad, Greg, that you're part of this process. It gives me a great deal of comfort. But Greg here almost had his entire career in the jail. And so he knows that environment incredibly well. And so I'm glad, Doc, that you've got him and his experience in there. Those buildings, staff may have changed, but the buildings haven't. And they are tough to deal with because sort of like what we deal with our neighborhoods, we got street flooding because the inlets were of a different size back then. Now we have to go back and retrofit stuff. It's the same thing in the jail. The plumbing is old, and that's why I applaud Chief Bosques and his team, because the inspection is really tied to the performance of old buildings. And so the fact that we've gotten to this point is exciting. The fact that you get a handle on all of the project timelines is great. But a little bit to Commissioner Ramsey's point on the LEDs, it's a good decision, but make sure that we're engaged so we can kind of track it with y'all as well. If that was the case, I don't remember if you did or didn't.
So, Commissioner, would you like us to bring back a business case scenario in the next court so that way we get you have the full picture and you authorize us whether to move forward or not?
Yeah, I think that'd be smart. That'd be smart.
We'll
That
do
way we know exactly where the direction that you're going, and we can travel that alongside you. But thank you for all your work collectively, and Greg, I don't know if you're walking that building again, but I know that, and I apologize. Give me your name again.
Sean Williams.
Sean. I don't know if you guys are in the building on a regular basis, but please continue to tell our detention staff that we appreciate what they're dealing with and that the fact that they've taken on that job to handle. So just let folks know that we continue to think about them. All right.
Commissioner, thank you for the kind words. Greg Summerlin, working with engineering. I can tell you the jails are really having a hard time because they're old. 701, even 1200, about 20 some odd years old, but 701's pushing 35, 40 years old. These facilities are just wearing out. You could just point out a system and there's a problem. So everybody is aware of it, and we're hitting the highest priority ones, but systemically, the jail is just aging.
That's right.
So,
that's right.
Thank you all.
Good deal. Thank you, guys.
Colleagues, in the action on this item was discussion, possible no action. Okay, thank you.
Good deal.
The next item is
Thank you.
Thank you very much. Next item is a transmittal item 353, Commissioner Briones. And this is the talent and update on the compensation pay equity project. Come right on up.
Yes, we will please hear a brief update from Chief People Officer Rowley. And again, we want to do the right thing and we want to do the thing right. So could you please update us on the progress?
Yes, of course. And we do have some backup if it's possible to bring that presentation up. Thank you. I won't go through all of it. I know you all have access to it. Could we just move forward a couple of slides, please? This will work. Thank you very much. Appreciate that. This gives you a sense, Commissioner Briones and Commissioners, where we are. We have engaged with all of the departments, as I mentioned to you the last couple of times that we discussed this. We are working very diligently with them to engage to align on the recommendations. So a lot of back and forth, a lot of great engagement. We're very grateful to your teams and to everyone else in the departments who are working with us. Gallagher is working behind the scenes to re-benchmark some of the jobs that we have questions about. And then, as we've discussed before, our plan is to move forward with everything that we're aligned on. And then where we don't have alignment, we'll set aside those roles to look at shortly after implementation. And so where we stand as far as we have almost all the departments scheduled for meetings. We have 81% of them actually completed. The concerning statistic here is that we only have one actually fully signed off on file. And so the reason for that is we do have a lot of files that we're very close to being fully signed off on, but Gallagher is just completing the final validations. And so as soon as Gallagher gets the file back to our team, I mentioned to you the process that we've engaged our compensation team members, job evaluation and job analysis in this process, and they're performing that final validation. So, we've had a lot of mistakes in the past, which we put the departments through quite a bit. And again, we appreciate them working through all of this with us. So we want to get those finals back in good order. So we're anticipating meeting the planned execution date. And even though that 1% is slightly concerning, we do believe that we're going to get there. There are a few other slides about communication plans. I don't know if you've seen some of the things that we're sending out. We're trying to use more videos and things that are a little bit more engaging, and also to explain basic compensation facts so that leaders aren't put in the position of explaining benchmarking and compensation analytics and so forth. That being said, we do have a lot of training scheduled for leaders. We've done some. We continue to do more. We're going to have a pulse survey for all employees too, so we can see where gaps remain, so we can address them before we get to implementation.
Yes. Well, thank you for this update. I share that the 1% is a bit staggering. So one, when do we anticipate that truly to reach its highest point? And then two, more importantly, given the challenges we have had with Gallagher, how are we further pressure testing that what is final is truly final and accurate?
Again, it's really with the insertion of our compensation team. So it's all the way from Amanda Porter, who you've met before, who's our director of compensation, all the way through all of our analysts at the junior level in the teams. In many of the meetings, we have myself or Amanda and 2 or 3 additional resources from each of those sides. So it's all hands on deck. And thanks to the compensation team, because they're working so hard to help get this right. But that's the key.
Thank you. And then a couple other quick questions. So we're estimating, initial estimates are that approximately a third of employees will see a salary change. Is that correct?
That's correct.
Okay. And then the pay adjustments will be on the paychecks of Friday, May 22nd, which reflects the payroll period from May 2nd to May 15th. Is that correct? Okay. And so can you very briefly, my last question is, talk to us about additional communication plans so that those who are getting adjustments will be informed and that they know the why and rationale behind the adjustment?
Yes. So as I said, some of the baseline communications that are starting to roll out now regarding how the process worked. And we've provided all of this. It's on the website. We've sent some emails, et cetera. But we're sending out these little videos now that may be a little bit more engaging. And again, the survey is to test what questions do people still have so we can address them between now and implementation. We then have leader training scheduled. And we're also, we've reached out to your offices to ask if you have facilities where we can come and do live sessions so we can take on a lot of the questions. But our plan is to prepare leaders with both the training, but also we do have a leader toolkit. We have a lot of facts, frequently asked questions on all the different subsets of the work. And that leader toolkit is available 24/7. Some of the training videos have been taped so that they can also view them at their convenience. So it's just meant to be a very comprehensive engagement with leaders in preparation. That being said, we're always here to back them up. And so if they have questions, leaders, or if employees have questions, we're very happy to entertain them either through phone calls, emails, or we do have on our project website a place where employees can put questions in, and then we reach out and answer those questions. We have a project plan as far as notification to leaders when they're supposed to let employees know. And our expectation is that, and our desire that we'll ask of leaders, is that they have a conversation with everyone at some point, but prioritized by who's getting an increase so they can understand that first before they see it on their paycheck, and then to have those further conversations with everyone else. Just to be clear, if you're not, because sometimes when we look at our paychecks, some people pay closer attention than others, especially with a back pay that's going to be implemented. It'll be a little bit tough to figure out on your own.
Mm-hmm. Well, I appreciate it. I know you've been working tirelessly, so I appreciate you and your team for really helping to get this on track and execute with excellence. So thank you.
Thank you.
Commissioner Garcia.
No, I'm sorry. I was from the pre.
Okay, thank you.
Okay.
Is there any action on this item, Commissioner Briones? No
It's a
action.
transmittal, Commissioner.
Okay, thank you very much.
Thank you.
The next item, which one is that? What's the next one?
405?
05.
Yeah.
Who pulled that one?
Commissioner, this was an executive session item that I think needed to be
We'll
discussed
do it
here
later.
instead.
What else do we have? What other items out here?
We've got, I think, 4 other items total.
410, I just had a quick question.
Yes, sir. 410.
Again, good job, Sindhu, on 410, on the computers. I just want to understand how this works. Some of the precinct 3 computers that we're getting, that comes out of our budget. I know you're replacing some. How's that working between what's coming out of our budget and your budget?
Commissioner, I'll lean in on Director Ramos to touch base on how this budgetary aspect works.
So the distinction, Commissioner, and the policy that Commissioners Court set up is if you're going to utilize this funding, the central funding for computers and laptops, then you follow the specifications that Universal Services lays out. If you were to go and purchase directly, something outside of the specifications that Universal Services has in inventory, then it would come out of your budget.
Okay, well, I think we're right down the middle of the plate on your.
Yes, sir. You are a part of our replacement cycle, and I think we have done a few for you already, and then there is wave 2 coming up where precinct 3 computers are included in all the precincts are a part of this program.
That was it. Thank you.
Yeah, there was a prioritization which court, when they adopted the program, set out, which was law enforcement, I think the courts, the Justice Department, and then after that, it was kind of an order of size, I believe.
Okay, I'll move on to Adam.
I'll second it. All those in favor, vote aye.
Aye.
I'll suppose so. No for ayes, no nays. Item passes.
Thank you.
The last item for executive session is the toll road authority item.
Commissioner, if I may,
Commissioner.
there is one more item for executive
Yeah,
session.
item 4 or
which
5.
is a very quick update, if that's okay.
Yeah. You have an update?
It's a discussion
Yes,
item.
it's
It's
a
not an
open
executive
forum
session.
Yeah.
It's a
Sorry.
quick update on.
Please make it quick.
Yes,
You losing
yes,
me.
sir. Very quick. Thank you for this opportunity. Again, this is with regards to the conflict that is happening with Iran. And, as we know, cyber is a critical aspect of the attacks that are happening. And I just wanted to give a quick, because it's an open forum update, I would not go into the details, but just say that we are monitoring our network. We have seen increase in the phishing attacks, as well as we are blocking increasing number of threats that are coming our way. Our Cybersecurity Operations Center is being monitored 24/7, and all alerts are being managed well. So that's kind of a quick update on
Good, thank you.
of cybersecurity.
All right, thank you.
Thank you.
Thank you. The other item is one that I pulled. This is the request by the Toll Road Authority for approval of revised toll invoicing policy. Is there someone here from Toll Road?
Yes, sir.
Oh, there you are. Roberto, let me tell you what my concern is. On a $500 cap
Yes, sir.
for legal expenses, that's per vehicle, right? So that means if somebody has, whatever it is, $25, use some small hauler, and you get 3 of these deals, they're $25 each. Some of them, small operators, and they change in their addresses or whatever, and they don't get it, then they're gonna end up paying $500 for each $25 infraction if it goes to court. That's the way I understand it.
Sir, it's the commercial accounts vary in number of plates. They don't have an account. So as we try to track down how many invoices are associated to one commercial business, assume there's 10 plates, we would charge $50 citation for each plate above 8. So in the way it's written, we're tying it into the policy where we give 8 free easy tags to customers. So we're allotting 8, and then after that 8, we're charging $50 per plate associated with that account. Or not account, with those transactions.
So when we decided that you could do this,
Yes, sir.
the issue was we wanted to make sure it was not a predatory practice.
Yes, sir.
Okay, now, I'm not an expert on predatory practices, but I just kind of know them when I see them. But now I know I got PK, Preacher's Child, down here.
Kid.
Preacher's Kid down here, PK, not PC. But now I know from my theology class in the Bible, there's some reference to these money changes in Matthew, Mark, Luke, and John. Make it up for that, see?
Man, Commissioner, when you start quoting scripture, I get scared.
I want to get you scared now. I'm not going to stop there. In the Quran, it's 1185. They talk about just balances. Then in the Torah, they speak about dishonest trade, about exploitation.
Yes, sir.
So the question is, who did you all go to figure out when we're dealing with money changers? I know they all swarming around, wanting to get back. I'm just wondering, I don't know what's fair, but how do y'all come up with it?
When we're doing so when we got the direction from court to not be predatory, what we try to do is we try to make sure that the fees and fines associated with the invoicing policy are not a profit center. So when you say we have a $10 administrative fee, it costs us $10 additional to pursue that transaction.
But so the question is, so when I got on this, it was a group called Appleseed.
Yes, sir.
I don't know if they're still around, but when this came on the agenda, there was quite a bit on this agenda, by the way.
Yes, sir.
So when I looked at this one, I said to myself, call Appleseed, see what they think. Because they were the ones that did this comprehensive study on predatory fines and fees. I don't know if they're still around, but some of the prominent law firms here in town used to be active with them in Austin. So I'm just wondering, like, was it your team? How did y'all, what consumer groups did you go to? I just don't want to, this court took a leap of faith to stop the stuff on property tax collection. I don't want to end up back in there. So I'm just, how did you know? And do we have to vote on this today? Because if you didn't have to check with them, I want you to go check with them.
Yes, sir.
Even if it's on a consent agenda. I just don't want to do it after doing all my preaching. You done got me in quoting the Bible and the Quran and the Torah.
Yes, sir. Yes, sir. So I just want to, all the term fee and fine are a kind of misnomer. So we didn't go and do research. We wanted to set the trend of a new invoicing policy that is not punitive to the customers, but it really just equates the value that of additional O&M costs Hector has to incur because someone doesn't have a tag and went through there and chooses not to pay. So when we put a value for the $10 administrative fee, that's the cost to print 2 invoices for postage, for customer service rep.
It's only the legal fee.
Correct, but
within
then
$500 that I'm worried about.
as it goes to collections, when we have to do a citation, there's costs that we have to incur for the clerk. We have to pay for administrative judges. The $50 that we're proposing is associated with the cost to collect. It's not in any way, shape, or form intended to be punitive above and beyond what we incur to collect when it comes to.
So let me ask this, because I only want you to go to Appleseed to somebody.
Yes, sir.
What's the downside on this waiting? And you go talk. Appleseed is one I think of. Now, and colleagues, I want to tell you why I'm doing this. When this issue came up, it was on property tax collection when I was on city council. And then Mayor Whitmire, Kathy Whitmire, decided that she didn't want to pay that outrageous fee that the legislature passed. And the quote I had in the paper was, it was the sleaziest form of pork barrel legislation I'd ever seen in my life. That was in the paper. I just couldn't believe they passed something said you had to be a law firm. So now we went all these years. It's gone on all around the state. Everybody does it. We stopped it here in Harris County. Starting, by the way, with the toll road. When I said that unlikely pair of Raddick made the motion, I seconded. I just want you to go check with somebody, because I honestly don't know how you decide what's predatory.
Okay, yes, sir.
Doesn't sound like, I think you all did the best you could, but I'm just saying there are groups who go out here and think that they are protectors. I mean, they pretty vocal in Austin. They're just not as vocal here. I think Appleseed, I think Neil Manny used to be on that board or something. Appleseed, Commissioner Brown's helped me. He was kind of like all of the white shoes, we refer to them, law firms, would go make up all that money they were making. And then they would go do good stuff with Appleseed. But I just want you to check with somebody like that. I don't want to do this.
That wouldn't be, it'd be more checking.
Oh, absolutely. I mean,
And so can we just?
no, absolutely. I'd
Okay,
rather get
all
it right than rush it.
And if I'd have called you, but this was a pretty full agenda, by the way.
Yes, sir.
And so when my staff was briefing me on it yesterday, between your summit and a lot of other things going on, and then I'm asking them, well, did y'all call? And they said, call who? So I said, well, what happened to Appleseed? They were always around the Capitol. I don't know where they are now. But would you do that? And
No, absolutely.
And you can put, if you do it and send it to us, you can put it on the consent agenda. I just want somebody to opine.
Yes, sir.
Other than you all did a great job on trying to come up with it. And I know you made the commitment to me and told me you'd be sincere. I hate so much is going on, I didn't just call you and didn't even see you sitting out there. That's what happens when these meetings go on.
No, absolutely, sir. Additional due diligence to get it right.
Hold it, and if you get check with them and send us something, just
Yes, sir.
let folks know. You can put it on the consent agenda. On the business court. But I just want to feel some comfort level after having.
Okay. Yes, sir. Absolutely,
Thank you.
sir.
Jay, do you have the language to go in executive session?
So,
Yeah, so no action on this item?
Anybody? Adrian, you on? I'm
Commissioner
sorry,
Garcia and I.
Yeah.
wanna go first?
Go ahead, Commissioner Briones.
So first of all, thank you, Director Trevino, to you and your team for updating the policy, and thank you to the County Attorney's Office for their collaboration. It would be and I agree, if it's coming up, I know there's multiple deadlines that we have to be attentive to. So just to confirm, not moving forward today and waiting till business court, which is on the 31st?
Yeah. And somebody
Does
could
that
pull it
work
off
for you?
business court.
Yes,
In terms
absolutely.
of
That-
all the.
Yes, that works
procurement
for
out.
us.
Okay.
Yes.
And then the other thing, I think it would be very, next time when well, I guess if it's business court, you're not going to. So for today's purposes, I think it's helpful because I 100% do not want to be predatory,
Yes.
period. We always want to be fair and we need to be clear. And so last time we talked, and I know there's different definitions for how we're defining it, but essentially separating individuals from commercial fleet accounts based on the number of plates. And so just to be clear, laying it out, what that looks like in terms of caps, in terms of fees would be very helpful so that in addition to getting additional stakeholder feedback over the next few days, that we are being crystal clear with folks what this means. And especially, I care about everybody, but I especially want to make sure that the individual paradigm is essentially aligned with what we've always been doing. We're just updating it to kind of bifurcate the world, so to speak. And so given especially the impact of these commercial users on Hectra differs very different than someone driving to work.
Yes.
So I think starting with a level set would be helpful so that anyone listening knows
Absolutely, Commissioner.
what we're trying to achieve and how we're going to achieve it in a fair, non-predatory way.
Yes.
Commissioner Garcia.
Director, thank you very much, and I appreciate the input. I completely agree with both of what's been said in terms of the caution to being predatory. But as you do that research as to whatever the best practice for this might be, also let us know that, over the years, there's also been a conversation that at some point there's got to be some consequence. But I think we can set limits to that consequence so it doesn't go to what it used to be. But at some point there's got to be some reason that someone
Penalty. Do it.
Yeah. And there's got to be some penalty.
Yes.
Because I just can't help but to keep looking at the bigger number of what's out there. And so, maybe it's just a strategic way to, go about the collection. But at some point, there's got to be some penalty attached to it as well.
Yes, sir.
Thank you.
I'm thinking if they know when it's starting, we after you. It's sort of like what we're trying to figure out on these ATVs. You catch one and put them on social media, and they know you're out there. It'll have an impact. So I get it. I want the money. Trust me, because I got ideas on how to spend it.
I mean, when we're talking about fees and such, people that come from the surrounding counties, whether it's Montgomery or Waller or Liberty or Galveston or Brazoria or Fort Bend, and our hospital district's open to everybody, and we come. I get a little irritated when I hear the surrounding counties talk about their low tax rate and how they don't have, when we are taking care of large numbers of their people in need. So I don't know if there's something down the road. That's when you brought up fees, that just reminds me that people are, and we're willing to help people, and that's what we do. But there's a number there. I think it's probably a pretty big number. Obviously now the city's concerned about them taking care of a wreck or two on the toll road, and they're going to have to, they're going to bill us for it. So when we start collecting these fees, I think those that can't afford, like, I don't know, I'll just throw one out there, like Montgomery County, if there's some large number of things that we're doing here to serve those needs. It's just part of this whole fee. I agree the predatory, we want to avoid all of that. But we also don't like it when just people ignore because they think they can.
Yep, agreed. Agreed. Are there any other concerns, questions, items you want him to do? Because I would love for this to pass on business court, because I know we have to really align timelines.
So do the checking. Obviously, if it's on a business court, anybody could pull it. And if I thought about it, I would have brought it up. And I would say check Appleseed.
Yes, sir.
Like, we had so much going. I asked my staff, did anybody? I say, have somebody come say something if they have any concerns.
Yes, sir.
So I hope Appleseed is still around. Leslie, am I right? It used to be a pretty respected group.
I remember that, yeah.
Yes. Mm-hmm.
Okay, yeah. Okay.
We'll reach
Well,
out
hey,
to
you
the
did a good job. And
No, thank you, sir.
If so much hadn't been going on, I wouldn't have brought it up to Leslie.
Of course. Don't worry.
Chair,
Yes, sir.
actually, that reminds me. Mr. Ramos, we made a change to the investment policy, and when will we get a report on that?
So we've been working with all of the precinct offices. We asked for the information back in April. It'll probably take us a couple of weeks to get it turned around.
Gotcha. But there was a piece in that motion to let us know when things are maturing.
That was transmitted already.
What's that?
That was transmitted.
That was already transmitted?
The maturities by fund. That's correct.
And have you been able to work out the cost to the investments?
So that's what the brokers are charging the investment entities. We put a poll out. We think it's somewhere between 2 and 3 points.
Okay, thank you. Thank you.
Thank you.
Yes, sir.
Are there any other business
So-
before we go to executive? No action.
Yes.
Yeah.
So no action. And then I also
Put it on
have
business
item
court.
435.
435.
That was done earlier. That was voted on.
Do it earlier?
Yes.
We did it earlier. We did that one earlier. Okay. So Jay, you want to read the motion for executive session? You want to record?
Want
you
it
wanna
on the
do
record again?
Yes, we don't
No,
have
I'll
it on
move.
our notes.
Commissioner Garcia moves it. I'll second it. All those in favor, vote aye.
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 Is this
No,
one
no,
before
no,
Tom?
I think you want to vote no, Commissioner Ramsey.
I already voted no on that.
Yeah.
Well, she didn't get to vote earlier.
Yeah.
Yes,
So
none of us
3
have
ayes
it on
and
our
1 no.
notes, sorry.
Commissioner Ramsey votes
He's
no.
reconsidering his vote.
Somebody tell you to do that.
I put your name on the pleadings.
Okay.
When we did it earlier. Yeah, she didn't catch it. So Commissioner Ramsey is no. The other 3 of us are yes.
So it's Garcia Ellis.
Garcia Ellis. Yeah, Ramsey. See how we try to look out for one another?
Appreciate you.
Tom? It's late today.
He was-
Okay.
he was pulling it
We're
back
going
up
to
to
executive session.
reconsider.
What are the items? Jay, what's the motion?
Sure, it's just call to time, 6:16. Commissioners Court will now proceed to executive sessions on items 403, 404, 407, 411 pursuant to Texas Government Code Section 551, 071, and 074.
I'll make that motion. Commissioner Garcia seconds.
Second.
Okay. It's now 6:16. We're going to do that. Okay? We're going to executive session. Am I all right? You want me to read it? You write it up when I come back, whatever else you want me to say, I'll say it. Okay. And the rest of y'all ought to go out and enjoy that bike ride I wanted to do. It's 6:59. Commissioners Court is back in session. Commissioner Garcia?
Thank you. What's the item number?
403.
403. On item 403, I move to appoint Francisco Castillo to the Houston Land Bank Board of Directors, position 11, for a term ending 12/31 of 2027.
Motion's been made and properly second. Are there any objections? Hearing none. 3-0. Is there any other business?
No action on the other items
No action on
in
the
executive
other
session.
items?
It's now, it's okay. 6:59, this meeting's adjourned. Good night.